Bu Nani?
Kemarin kan belum jadi Mbak kirim. Kata Bu Nani sudah dikirim ke Mbak Sesi. Kayak, Mas nggak kedetek Mas, flash diskmu Mas. Ini po, rekor. Oh ini.
Indonesia, known as Nusantara, consists of thousands of tribal islands and millions of diversity, bring millions of hopes and dreams. Here is the place where passion and hopes meet from across the archipelago to nourish the nation. Politeknik Kesehatan Kementerian Kesehatan Yogyakarta, established in 2001, is a fusion of 6 health academies in Yogyakarta, establishing itself as the leading college of health workers in Indonesia. Politeknik Kesehatan Kemenkes Yogyakarta, or Polkesyo, is a state university under the Ministry of Health, known as university that upholds cultural values, nationality, and upholds diversity and prioritizes the interests of the nation. Polkesyo, with various works and achievements, we have proven ourselves to always serve tirelessly to produce competent health workers who can carry out their professional performance to make the healthy nation. Polkesyo, which is located in the special region of Yogyakarta, or referred to as a student city, creates a learning climate and academic atmosphere that supports student achievement. Polkesyo continues to grow and develop to become the leading, best health college in Indonesia, and aspires to be global by cultivating, implementing, and utilizing education, research, and community service, which are the main goals of higher education in Indonesia, or the Tridharma of higher education, by always being guided by Pancasila values. We carry out education, conduct research, and provide community service by improving science and technology in health sector that is beneficial to society, nation, and state. This is where the nation's best sons and daughters from various backgrounds and variations are given the widest opportunity to gather and build an intellectual community to solve health problems in Indonesia. By mutually enriching the repertoire of knowledge and human values, exploring knowledge from history, processing today, and researching for the future. Polkesyo has 6 departments and 17 study programs, namely Diploma 3, Applied Bachelor, and Professional Education. Supported by 1 professor and more than 149 lecturers who have experience teaching and research in various disciplines of health science and technology, and support from education staff. Polkesyo always develops quality education processes, which national and international standards, producing graduates with global competitiveness. To support competence, knowledge, skills, and attitudes of students, Polkesyo provides various laboratories with sophisticated and modern equipment and technology, so that a strong research culture continues to develop, marked by various innovative discoveries that are useful for society. Polkesyo has pioneered and developed the Science Techno Campus as a manifestation of its ability to create and commercialize various innovative health technology products. As support for conductive learning, in addition to other facilities and infrastructure, Polkesyo has established itself as a healthy campus by creating a green campus that is comfortable, environmentally friendly, and pollution-free with a well-maintained layout. The various existing facilities support the development of student talents through student activity units and are encouraged to realize their dreams. To improve services to the community, Polkasio is given flexibility in financial management based on the economic and productivity principles and the application of sound business practices by establishing it as a public service agency work unit in 2011. Polkasio has been given the title of corruption-free area as a manifestation that Polkasio has met most of the criteria in implementing the 6 areas of reform of the bureaucratic reform program and has been able to prevent corruption, collusion, and nepotism. To provide quality assurance and quality control of education, as well as improve the competitiveness of graduates, Polkasio has received accreditation recognition both from the government through BAN PT. The year 2020 is the toughest year for all countries in the world.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. We are delighted to welcome you back to the second day of 9th International Conference on Health and Sciences, live from Grand Cokro Hotel, Yogyakarta. The Honorable Vice Director on Academic, Dr. Heni Puji Wahyuningsi.
Chairman of Committee, International Conference on Health Science 2022, Dr. Agus Karmayana Rubaya.
Lecturer of Health Polytechnic, Ministry of Health Yogyakarta, Nanik Setiawati MKes.
Lecturer of the Hong Kong Polytechnic University, Dr. Cynthia Wu.
Lecturer of American University of Sharjah, United Arab Emirates, International Association of Student Affairs and Services, Regional for Asia, Mrs. Lisa Bardil Musaritulu, PhD.
Associate Professor, National University of Singapore, Dr. Shifali Shore. Again, last but not least, we welcome back our distinguished guest, presenter, the organizer, and more than 100 both domestic and abroad registered participants on the second day of the International Conference on Health and Science 2022 with the theme Innovation and Applied Technology for the Acceleration of Health Transformation.
My name is Eka Raihan and my partner,
Nilam Pratiwi,
your master of ceremony that will guide you from the opening until the closing on the second day of the conference, October 26, 2022, live from Grand Cokro Hotel, Yogyakarta.
Ladies and gentlemen, we will announce several information and today's schedule. Certificate of participant who registered through the website can be received and downloaded through the Serpo Poltekkes Yogyakarta starting on November 4, 2022. Book of abstract can be downloaded at https://s.id/boa_ECHS 2022. We would like to announce to all participants to fill the present-on link that we will be sending by the committee. Today's session will be started with presentation by speaker from Indonesia, Hong Kong, United Arab Emirates, and Singapore, followed by final session of oral presentation, in which we prepare 3 breakout rooms for participants to enter. For any participant that willing to ask any question during the session but having difficulties using English, you may ask in Indonesian and our experienced interpreter will pleasantly help you.
Ladies and gentlemen, we are going to have the first panel presentation by the lecturer of Health Polytechnic, Ministry of Health Yogyakarta, Mrs. Nani Setiawati MKes, with the topic of Teropong Digital, an innovative tools to improve the accuracy of cervical cancer screening for midwifery, and Dr. Cynthia Wu carrying the topic, Effect of TEMI, Robot-Assisted Program on Fall Prevention. Both presentation will be guided by Dr. Agus Karmayana Rubaya. Dr. Agus Karyamana Rubaya, please come forward.
Okay, good morning everybody. Good morning participants of the 9th International Conference on Health Science conducted by Polytechnic of Health Yogyakarta. So we meet again this morning to continue our presentation about from our invited speakers that have been mentioned by our Master of Ceremony, that in this morning session, the first session of this morning, we will have two speakers. They are Mrs. Nani Setiawati from Polytechnic of Health of Yogyakarta, and also from Dr. Cynthia Wu from the Hong Kong Polytechnic University. So they are both are going to talk about technology-based devices that are supporting the decision about specific health problems. So the first one will be delivered by Mrs. Nani Setiawati. I will greet her first. Bu Nani, are you already join us? Yeah,
Yes,
Bu Nani?
Mr. Agus. Yes.
Yeah, yeah.
Can
Good
you
morning.
listen me?
Yeah, Assalamualaikum,
Good
Bu
morning,
Nani.
Mr. Agus. Waalaikumsalam warahmatullahi wabarakatuh.
How are you today?
Alhamdulillah, Mr. Agus.
Okay,
Nice to see you.
Yeah, that's good. Okay, Bu Nani, you can start your presentation now. Your time is about 15 to 20 minutes. Yeah, the time is yours, Bu Nani.
Okay, thank you for the time. Okay. Okay. Can the committee to share our presentation?
Yeah, we are waiting to.
Okay.
So,
Okay, thank
okay,
you.
yeah.
Yes.
Okay, you can start.
Okay, thank you, Mr. Agus. Assalamualaikum warahmatullahi wabarakatuh. Good
Waalaikumsalam.
morning, ladies and gentlemen. The Honorable Director of Poltekkes Kemenkes Yogyakarta, Committee of International Conference on Health and Science, and to all you who present today, thank you for coming to our presentation. Let me introduce myself. My name is Nani Setiawati. I'm from Poltekkes Kemenkes Yogyakarta. The topic of the presentation today is about teropong digital, an innovation tools to improve the accuracy of cervical cancer screening. Okay, next. Okay, cervical cancer is one of the most common cancer in women and one of the leading cause of cancer death in women in developing countries, although it is almost a totally preventable cancer. Cervical cancer is a type of cancer that occurs in the cell of the cervix. Okay, next slide. Okay. Okay, in 2020, more than 600,000 new cases of cervical cancer were reported World Health Organization. Next slide. Okay, next. And in Indonesia, there is an increase in case from 32,000 new cases, increasing to 36,000 in 2020. Next. Okay, to reduce the burden of disease, World Health Organization has recommended visual inspection of the cervix with acetic acid to primary screening cervical cancer. VIA is naked eye examination of the uterine cervix after application of 5% acetic acid and interpreting the result after 1 minute. This is a simple and inexpensive test for the detection of cervical precancer lesion and early invasive cancer. The results of VIA tests are immediately available and do not require any laboratory support. Next. But in VIA test, observation with the eyes only will be subjective and result can be different depending on the sharpness of the midwife vision, working experience, and training background. The subjective observation can affect the accuracy of the test result. Observation using direct eyes is lacking the image quality control. Okay. For the solution, we need innovative tool solution to improve the accuracy VIA test. The tool is Teropong Digital for cervical cancer screening. Okay, Teropong Digital is a tool to record cervical image that are connected to device such as mobile phone, laptops, or computer so that cervical image can be seen clearly and can increase the accuracy of VIA test. The image are in picture of the cervix captured by Teropong Digital during VIA test. There is look clear. Okay, next. Okay, this picture is an image in the same cervix without tool and use Teropong Digital. The result of analysis show that the p-value is 0.008. It means that significant of using Teropong Digital for the accuracy of screening result. Okay, next. Okay, this is the component of Teropong Digital. The first is camera with LED. You can control the lightness of the lamp, and the middle is console for system control and internal Wi-Fi, which can connect the capture from camera to view it on a mobile phone or computer. Okay. The study in this research are, the first study is theoretical study. We use a literature review to this study, and the conclusion of this study is technology tool needed in cervical cancer screening. The second study is file force analysis. We study about the strength and weakness various tools from screening cervical cancer, and the conclusion is Teropong Digital is excellent in the field. The third, empirical study with experiment design. There is a significant use of Teropong Digital with accuracy of the result of VIA test. Next study is acceptance study. This tool to midwife in Yogyakarta and Central Java, and the midwife receiving this tool for VIA test. And the last, the study is hilirisasi and review from Swayasa Prakasa Company. Okay, next. Okay, a study has been made a book. You can see the tutorial video from Scan Barcode. Okay, next. This is a patent of the project. Okay, beside that, I have socialized this project in webinar, expert lecture, and now in the international conference on ICHS. Okay, this project also used in community dedication in Yogyakarta and Central of Java and published at journal. This project has also been published at the newspapers and television. Okay, this is a short video testimony of the midwife who have used this product. Okay, I'm sorry, this is used bahasa from midwife. Okay.
Perkenalkan, nama saya Eri Mariati, saya bidan di Puskesmas Turi. Selama ini saya sudah melakukan pemeriksaan IVA selama kurang lebih 11 tahun. Selama ini cuma pakai kasat mata langsung ya, dilihat langsung mata hasilnya. Tapi untuk saat ini di klinik kebidanan Poltekkes Kemenkes, saya memakai teropong digital untuk screening kanker serviks. Alatnya luar biasa canggih ya, langsung bisa dilihat di kamera HP. Terus hasilnya itu juga bisa langsung dilihatkan ke pasien. Jadi seperti USG transvaginal itu, banyak rencananya mau, karena saya punya PMB, saya juga ingin memakai teropong digital screening kanker serviks agar pasien juga puas nantinya bisa lihat seperti apa porsionya, serviksnya, kondisinya. Jadi saya menerangkan tidak cuma, kan pasien biasanya cuma angan-angan aja ya, tapi ini saya bisa menunjukkan langsung hasilnya ke pasien gitu. Terima kasih untuk Poltekkes Kemenkes. Bu Nani.
Assalamualaikum warahmatullahi wabarakatuh. Saya Eni Fadilah dari Praktik Mandiri Bidan. Di sini saya akan memberikan testimoni tentang teropong digital. Jadi, alhamdulillah dari kebidanan sudah muncul inovasi adanya alat teropong digital yang mempermudahkan untuk melakukan pemeriksaan IVA ataupun juga kontrol IUD seperti itu untuk pemeriksaan benang. Nah, dengan adanya teropong digital ini kita bisa mengapersepsi. Jadi apa yang kita lihat antara pemeriksa satu dengan yang lain, adanya bukti autentik hasil pemeriksaan yang ada. Jadi tidak membuat diagnosa itu bingung atau hanya secara subjektif, tapi bisa dilakukan secara objektif juga seperti itu. Semoga dengan adanya terobosan ini kebidanan pelayanannya bisa lebih maju, kemudian alat yang diproduksi secara massal, dan semoga juga memberikan ilmu, memberikan banyak manfaat yang lebih banyak untuk pasien maupun untuk bidan sendiri seperti itu. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Ya, selamat siang. Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, saya Ika Gustina Sulistiani, bidan asalnya dari Purwokerto, dan di sini saya diberikan kesempatan khususnya dari Poltekkes Kemenkes Yogyakarta untuk mencoba alat inovasi baru untuk mendeteksi IVA ya, hasil dari pemeriksaan IVA yang di sini dinamakan teropong digital screening kanker serviks. Gitu. Alatnya sungguh sangat bagus sekali, terus simpel ya, untuk pemakaiannya juga tidak ribet, mudah, dan itu sangat membantu bidan dalam memberikan pelayanan IFA. Nanti bisa dilihatkan kepada pasiennya juga untuk hasilnya, terus kita juga dalam pembacaan hasil juga bisa lebih jelas, apalagi kalau kita membutuhkan konsultasi dari dokter spesialis atau untuk memastikan hasil ke teman-teman kita pun kita juga tidak ribet untuk meminta teman kita untuk melihat langsung ke pasiennya, tapi bisa melihat dari hasil teropong digital ini, disambungkan ke laptop, ke HP ataupun ke komputer, itu bisa terlihat sangat jelas. Begitu harapannya nanti ini bisa lebih bagus lagi, terus lebih berkembang lagi, terus segera diperbanyak ya untuk Poltekkes Kemenkes Yogyakarta. Sukses selalu.
Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, saya Anissa Bekti Karisma, bidan asal Magelang. Di sini saya diberi kesempatan oleh Polkesyo di mana mencoba alat terbaru. Di sini ada teropong digital, di mana ini fungsinya untuk membantu kami sebagai bidan dalam pemeriksaan IFA, gitu ya, dalam melihat screening terkait dengan kanker serviks. Sebelumnya saya dalam pemeriksaan ini hanya menggunakan mata telanjang saja ya. Di sini penggunaan atau pemeriksaannya kita tidak menggunakan alat secanggih ini, di mana saat kami diberikan kesempatan untuk menggunakan alat ini, kami merasa alat ini sangat mudah digunakan dalam penggunaannya. Kemudian saat melihatnya atau melihat serviks pun juga terlihat jelas, penggunaannya mudah. Kemudian alat ini juga bisa dilihatkan pada ibu, jadi hasil atau hasil pemeriksaan serviks yang ada pada ibu kita tahu, ibu pun juga tahu, jadi ibu juga puas dalam melihat hasil dari screeningnya, begitu ya. Jadi ibu juga tahu hasil pemeriksaan.
Okay.
Is the video finished?
No, not yet.
Not yet.
Okay, not yet.
But
Okay,
maybe-
okay. Next slide. Okay, next slide. In conclusion, teropong digital, the first answer the need of midwife to screening cervical cancer. The second, teropong digital is effective for the screening cervical cancer and prevent delay in diagnosis. And the fourth, support health transformation in Indonesia. The last, this is a digitalisasi of technology in midwife. That's all from me, Matur nuwun. Thank you so much for your attention. I hope what I have shared will be beneficial for all of us. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Yeah, thank you very much, Mrs. Nani Setiawati. It's very informative, interesting, I think, from your innovative devices. Yeah. So, dear participant, I forgot to describe a little bit about Mrs. Nani. She is a lecturer from midwifery department of the Polytechnic of Health of Yogyakarta, and this year she was elected as the most outstanding lecturer, and so she going to be a candidate for the election for the outstanding lecturer among Polytechnic of Health Indonesia. That the winner will be announced in November, related with National Health Days in November. So, finger crossed for Budani. Okay, I believe the participants have some question to the tools from Bunani, but we are waiting until the question and answer session. Now we are moved to the second speaker. She is Dr. Cynthia Wu. I will describe a glance about her curriculum vitae. Maybe I need help from. Yeah, so Dr. Cynthia Wu is from Polytechnic Hong Kong. She is the senior teaching fellow of School of Nursing of the Hong Kong Polytechnic University, and she has extensive experience in promoting community and public health over 20 years. So it is a long time. And she has been integrating the research evidence and current studies in teaching and practice. In 2015, she received the award of improving student experience through the HEARS empowerment program for secondary school. And after that, she has been collaborating with schools and community centers to explore the sustainability of the applied service model for the benefits of public community agencies and also university education. So she is collaborating between education and also the community services. I will greet Dr. Wu. Dr. Wu, have you been joined to our Zoom?
Yes, thank you.
Okay.
And thank you for the introductions. And how can I cannot upload the file? Can the organizer upload the file for us?
Sorry, I beg your pardon. I cannot hear you well. Maybe.
Yes.
Yeah.
Can you hear me well now?
Yes, it's clearer.
Yes. Oh, it's clear. Okay, thank you. Thank you for the introduction. And I cannot upload the file right here. Can the organizer upload the file for us?
So you mean this is the PowerPoint?
I see. Yes, it's a PowerPoint, and I've sent to the organizer.
Oh, okay. Okay.
Oh.
We will display the PowerPoint for you.
Okay, or I can use mine. If you don't mind, I can put it here right now. Yeah. Yes, I'm uploading the file now. I can.
Okay.
Okay, and then can you see it now?
Not yet.
Not yet. I think we need to share the screen. How about now? Can you see the screen now?
Not yet, Dr. Wu. Oh yeah, it's already seen. It's already seen.
Okay.
Okay.
Yes.
Yeah. Yeah.
Let me see.
Yeah.
It's quite different from mine.
So yeah, Dr. Wu will talk about the effect of TMI, robot-assisted program, on fall prevention. And your time is about 30 minutes to delivering your presentation, Dr. Wu. And after that, we will have the question and answer session. So you can start. You may start your presentation, Dr. Wu.
Yeah, thank you very much. Introductions, and it is our honor to be invited to have this opportunity to share with you all about our project in PolyU and School of Nursing. And also today I'm going to our student team, Darling and also Wai Yin, will share with you their project experience and also the result. Meanwhile, maybe perhaps the audience would like also to know about our background of this project and what is service learning model, and also how we can have the funding for the purchase of this robot, so that in future, maybe after the sharing, we can have some certain collaborations with all of you here in as audience, and also see how we can make it sustainable. Okay, this project we need to acknowledge is supported by the Service Learning Scholarship Fund from PolyU, and this fund is for the innovations to the community care service for the students' final year project. Therefore, the whole idea is to how we can make good use of the students' curriculum learning, as well as providing quality service to the community. And I'm acting as their mentor, and so that they can be well prepared for this program. I will walk you through about what is the whole idea, and therefore I will focus a little, maybe a few slides to run up about what is Surface Learning Scholarship and how PolyU make it into actions in the Hong Kong settings. And later on, our student team will talk about from the research perspective. Meanwhile, I will end the sessions for some discussions. Okay, we will make it briefly about this Surface Learning Scholarship. It's related to aim at promoting the global health and also empower the students in promoting the social responsibility and also the citizenship in the global world. And this whole idea is based on, in fact, very traditional sayings about surface learning is a term for the various pedagogies that link community service and academic study in addressing the complicated global health situations in real world. And the whole idea is to how we can support students and also teachers' development as well to make sense to our work and also to the world. And this framework is the scholarship is mainly supporting students to, after the surface learning, how could they extend the knowledge and initiate some new ideas, particularly, and to the healthcare in action. And I won't go through very in details because I know about the time. But anyway, we'd like to let the audience know about the overall background, how we prepare student scholars in PolyU from School of Nursing. And today we talk about the focus for elderly and also the citizens need, senior citizens need. But however, because we say that they need to create some new ideas, therefore most of our nursing students or also university students have experience to, in the surface learning, go through some of the global health topics, such as the digital literacy, the drug abuse, addiction, school hygiene, green school environment, and the use of technology in Temi robot. And the outcome is with public to enable them to have some lifestyle modifications, food label and food safety enhancement, and so that they can really work for themselves and having the contributing to also the society, not local, but also globally. Okay, how to integrate this? I think I will let the students to share with you so that you know about how we can put all this model into action. All right, and this is the action learning cycles that built in so that students can work together with the teachers and work out the research plan and also the some other ideas. Okay, and therefore, in preparing the student scholars, most of the time we make good use of the school settings, okay, and also make use of the playground, make use of the hygiene, hand washing stations, make use of the cover playground for some of these games and activities. And students, in order not only know how to reinforce health messages through the classroom sessions, PowerPoint, but we encourage them to use the interactive games to transfer the ideas into action and into some play and activities that engage the students, secondary school students, as well as the elderly in the community that will be shared by our students later on. And you can see about these examples of to prepare student scholars. In school, it is a more better environment for our university students as well as nursing students to interact, to talk with the school children, to the young generations. And so that you will see that they have can engage them more easily. Therefore, they can build our students' confidence when they sort of provide further care to the elderly in the community. And therefore, they most of the time, when we evaluate their learning outcomes, they say that they are able to increase the awareness of the primary health needs of the society, and they can also be able to empower the public in the health participations and also develop their social responsibilities. And with these ideas in mind, therefore, they are having received the scholarship in a voluntary basis to extend their service initiative throughout this whole ideas at identifying the service gap, relating the service experience to the global health, and ultimately, throughout the process of implementation, they are more able to establish the community partners with the stakeholders, that is the community centers as well as the elders. Okay, therefore, next I'll move on and invite my two student leaders and scholars, representative, to maybe briefly introduce their background of their ideas and also how they implement their research program in fall prevention, as well as empower the senior citizens to do the exercise for fall preventions later on. Okay, let us invite maybe Garlic first, so that you can let this audience know about your program.
Yes, thank you, Cynthia. Can everyone hear me?
Yes.
Yes, I can
Thank
hear.
you, thank you. Good morning, I'm Kaling and my partner is Wai Ying, and we are the students from the School of Nursing of the Hong Kong Polytechnic University. Today we are going to present our study, Effects of the TAMI Robot-Assisted Fall Prevention Program for the Community-Dwelling Older Adults. Let's start with the background of our study. Falls among adults aged 60 or above are prevalent. In Hong Kong, the incidence of fall among community-dwelling older adults aged 60 or above is approximately 25%. Among the falls, 75% of them got injuries, including head injuries and fractures. It was the most common cause of unintentional injury in 2018 among Asian nations and other countries such as Taiwan, Singapore, the US, Australia, and South African urban communities. The incidence or prevalence rate was 25% to 47.7%. Older adults suffered the greatest number of fatal falls, resulting in immobility, instability, incontinence, intellectual impairments, and iatrogenic complications, leading to serious injuries and deaths. First, primary education in fall prevention is crucial for older adults to reduce the consequences of fall. Next slide, please. Robot aesthetics and functionalities can affect older adults' acceptance of the technology. Higher acceptance of technology drives better learning performance. Hence, the acceptance of the technology is worth investigating as it may affect the learning outcomes. Next slide, please. The humanoid robots can be considered intelligent computers simulating voice, color, light, and screen displays to facilitate learning. The robots world, such as a TAMI robot, acts as a teaching assistant rather than a tutor. TAMI robot is produced by RoboTAMI, founded in 2016 with headquarters in New York and R&D lab in Tel Aviv. It is a telepresence robot featuring artificial intelligence and a system of sensors and camera. It can be utilized as an open platform for apps that provide interactions for games, education, or medical purposes, as well as connecting with smartphones and supporting remote control. In Israel, South Korea, China, and Hong Kong, TAMI robots are used in medical centers and elderly care facilities to facilitate healthcare workers to assess, monitor, and evaluate patients' conditions at a safe distance during COVID-19. For the literature review, mainly 4 databases are used. According to Oxford Home Study Center 2022, e-learning is the delivery of education and training through digital resources. Modern technology, including robots, connect students with course contacts and their tutors. It also refers to an educational method with the applications of information technology and communication to provide an opportunity for learners to access all the required education program and facilitate their learning. In our program, the technology includes TAMI robot and Kahoot. Falls are the events which result in a person coming to rest inadvertently on the ground or at a lower level and are the second leading cause of an intentional injury and deaths worldwide. Community dwelling older adults are individuals aged 60 or older living in community settings outside of nursing homes. Risk factors of 4 are categorized into physical, personal, and environmental. For physical factor, one at the previous slide, please.
Yeah, that's okay. Maybe we
Oh, okay.
people, yeah, because
Okay.
Yeah.
Table 4 shows our key findings on technology-assisted fall prevention programs in different countries, while Table 5 shows our key findings on fall prevention programs with intervention in Hong Kong. To conclude, please show the conclusion part.
Conclusion part, okay.
Yes, thank you. To conclude, the study has shown that the older adults can adapt to e-learning and the e-fall prevention program is effective for them. KP approach is applicable to evaluate the program. There is a limited technology-assisted fall prevention program in Hong Kong, so the effects of this type of program are worth investigating. Our study aims to increase the knowledge, attitude, practice on fall prevention through exercise training and environmental modification by technology-assisted approach on community dwelling older adults. And our objectives are to examine the difference between the older adults at knowledge, attitude, practice level, and to examine the difference between the older adults' acceptance of the technology-assisted learning before and after the program. May I now pass the time to Angie. Thank you.
Thank you, Carling. And our research is carried out by adopting pilot quality experimental design and a one-group pre-test post-test design. Convenient sampling is adopted with a sample size of 13. Subjects were recruited internally by the Health in Action in May this year. The inclusion criteria of subjects are being able to communicate in Cantonese, age 60 years or older, living in community settings, and able to walk independently with or without working aids. Exclusion criteria includes older adults with an altered mental status or cognitive impairment with marker lower than 26 marks. And here is our study flow chart. Thank you. 2 participants withdrew in the last lesson, resulting in 11 participants completing the whole program. Next slide, please. For program structure, each section lasts for an hour, including a face-to-face robot-assisted talk with interaction section and a follow-up section. A pre-test was held before the talk in the first lesson. In the last lesson, a post-test and an interview were done. The framework, next slide please. The framework of the program is modified from the fall prevention program created by Zhang et al. The table shows the content of our 4 lessons and was facilitated by Year 4 nursing students, supervised by the center registered nurse and an experienced community nurse. The program incorporated technology component. Tamil robot assisted face-to-face talk, and Kahoot was used as a quiz on the 3rd lesson. Next slide, please. Next slide, please. The program code content focused on 4 components: knowledge, exercise, training, environmental modification, and follow-up. These teaching contents are designed based on the information from the Department of Health in Hong Kong. Next slide, please. Environmental modification and different related health services were also introduced. Next slide, please. These are the details of our interview section and a brief interview guide. Next slide, please. The program outcome is to increase the KAP on fall prevention, thus reducing falls and related injuries. An increase in the acceptance to e-learning is also expected. Next slide, please. For data collection, a self-developing KAPA survey with tested reliability and validity is used. Reverse wording questions are used to reduce acquaintances and misinterpretation. Open-ended questions are used to evaluate participant acceptance of e-learning. Next slide, please. And the following are our survey questions. Yes, please, next slide. Next slide, please. And these are the Chinese version of our questionnaire. For the test and retest reliability, coefficient of the questionnaire is greater than 0.75, which shows a good stability of TSS in this sample. Next slide, please. The content validity of the questionnaire is verified by an expert panel with 4 healthcare-related professionals, and the content validity is considered as good with an index 0.909. Next slide, please. For data analysis, the qualitative data was analyzed by content analysis. The quantitative data was analyzed by SPSS 2.5.0 software. As for the descriptive data, such as mean and SD, will be used to summarize the demographics, characteristics of subjects, and the outcome variables. Next slide, please. We adopted paired t-test to analyze the data. For knowledge, we calculate the total marks of the test as the dependent variable, while for attitude and practice part, we adopt a 4-item Likert scale. A significant level smaller than 0.05 was employed. Next slide, please. However, our study has some limitation. No control group which may introduce bias. Small sample size may increase the likelihood of type 2 error and hence a false negative result. Self-reporting survey may arise social desirability and recall bias. Next slide, please. And our research has obtained the ethics approval from the Human Research Committee of the Hong Kong Polytechnic University. We obtained written consent from the participants and their rights of withdrawal and the autonomy was explained. No personal identifiable information was collected and all the data will only be accessed by the research team to maintain confidentiality. For the result, a few subject characteristics can be summarized. All participants are Chinese female and have a 4 history. Most of them, next slide please. Most of them have good body balance. The mean BMI and SMM are above normal range. Next slide please. And here comes to the result of KAP change. For the effect of the program on knowledge, there is an increase of 1 in mean score from T0 to T1. There is a significant difference as p-value is 0.013, which is smaller than 0.05. For the effect of the program on attitude, there is an increase of 0.1 in mean score. There is no significant difference as the p-value is 0.31. For the effect of the program on practice, there is a decrease of 0.2 in mean score. There is no significant difference as p-value is 0.855. Next slide, please. For the effect of the program on acceptance, there's an increase of 0.33 in the mean score. There's a significant difference as the p-value is 0.001, which is even smaller than 0.01. Next slide, please. And these are our interview questions. When we ask about the feelings towards Tammy robot, generally they think it is interesting, attractive, and funny. They also express their willingness to use robots or other technology to learn in the future and show no resistance. Next slide, please. However, when we compare the programs taught by humans and robots, they still prefer face-to-face programs or programs that combine both robots and humans. They think people need real communication, eye contact, and recognition from others. If they continue to use Tammy in the future, they want Tammy to be more eye-catching in color and facial design. Next slide, please. Lastly, we also ask about how Kahoot can help their learning. They think the excitement can stimulate their nerves and hand-eye coordination and increase their knowledge. Next slide, please. To conclude, the Technology Assisted Fall Prevention Program is successfully carried out. As for outcomes of KAP and acceptance towards e-learning will be further analyzed in the discussion. Next slide, please. For us, being the surface learning learners, our feeling towards the program is quite positive. Although the workload is a bit heavy, it provides us a chance to carry out our own project and contribute to the society. Next slide, please. We believe that the serving and being served are reciprocal and that one cannot really be one without the other. So it is a very precious chance and experience for us throughout our university life. For the significance of the study, first is to investigate the older adults' adaptation towards e-learning approach in fall prevention. Second is to explore the use of technology in assisting KAP change. Next slide, please. And third, next slide, please. is to provide further data in eHealth educational program. And this is the end of our research presentation. Thank you, and may I pass the time to our mentor Sylvia again.
Okay, yes. Hi. Okay, to round up, you may realize that the community-based health program is most welcome by the senior citizens and also by the community center. And center in charge also mentioned that they welcome other topics and then try out some others alternative mode in using the TAMI. And also the citizens also feel being empowered and also through the educations addressing their basic health needs, and also elaborate more about the internet resources, and they are more aware of the availability of the internet resources as well. And being able to working with the communities, and we are able to work with the students in addressing the individual, public, and the global health problems. And follow on this project and also some other service learning project, we aim at developing some sustainable strategies and for the communities. And at the same time, we are able to establish some long-term community health partnerships with the community organizations and also higher education institutions through this service learning and scholarship studies. At the end, we'd like to sum up some of the essential components and making this service learning scholarship program be sustainable. We are able to connect with the partners in long term as a community care organizations and the research partners from PolyU School of Nursing and other discipline. And also we encourage the inter-academic institutions, collaborations, and also the technology support from the department. Most also important is we set up some of the service learning fund, from the university level as well as the department level, and work towards some of the innovations projects for the community. And this and all components are already structured, and the related stakeholders welcome these ideas. And also, besides, we find that this service learning scholarship project can also enrich or actualize our program curriculum. As a whole, this is all the time our curriculum framework for developing our future nursing leaders, as well as undergrad level, as well as postgraduate level. And you will see that caring as a person from nursing perspective and also the healthcare perspective is always our ultimate goal. And from this research and scholarship project, we find out that students not only are able to develop their professional competence, they also realize how they can apply immediately from their learning to some of the evidence-based practice throughout the nursing research learning, as well as for their role and professional development. Last but not the least, we always bear in mind about this motto: if someone offers us an amazing opportunity and we are not sure we can do it or not, say yes, then we can learn it and make it sustainable. Okay, therefore, we also need to acknowledge the funding being available during this pandemic period for the use of technology for some online innovations practice, and also for our future development as well. Okay, thank you for listening and welcome further questions. And here are some of the participants, and they look forward to our next program. Thank you.
Okay, thank you, Dr. Wu, and also the research team member that have explained the project. So we are going to question and answer sessions. Participants that want to ask and discuss the topics from Mrs. Nani and also from Dr. Wu can raise their hand and maybe can type the question in the chat box. Maybe I need help from the committee too. Is there already any question from for the two speakers? Okay, and we are waiting for the question, but I have two questions for Dr. Wu.
Yes,
The
please.
first one is your experiences in linking the community needs, research, and also the education. Um, I just want to know: is there any in this term of the project, the fall prevention project, the robot assisted to fall the prevention? Is there any collaboration with other health profession outside
Yes.
the nursing faculty in the Polytechnic Hong Kong? And
Yes.
the second one is, I just want to know also how long the time needed for the elderly to become familiarized themselves with the robot, and also maybe because the characteristic among the elderly in Hong Kong and Indonesia may be quite different. Maybe can you give a little bit detail in the characteristic, whether the elderly is living alone or living with extended family or any other information?
Mhm.
Yeah,
Okay.
Dr. Wu, please.
Yeah, maybe addressing the first question, we collaborate with, yes, with the art department, the department of the chemical and technology department, because they have experts in talking about the nutrition and labeling. And we also have some offshore service learning, and they are mainly for some of these empowering the public for healthy eating, healthy living. And we have, in fact, collaborated with the university in Cambodia, in Indonesia, in fact, as well. And in fact, we look forward to some of the offshore settings after the pandemic, because meanwhile, we are having stopped all the offshore service learning. But I think we will resume it maybe in next year, early in March, and so that we can have more collaborations. Yes, we welcome collaborations, and in fact, locally and also globally, and not only in service learning, but also in some other research project with our students, particularly. Yeah. I don't know whether I answered your question about collaborations.
Yes,
Mhm.
I think so. Yeah, thank
Okay.
you very much.
Okay, regard about the Tammy robot, maybe afterwards, if don't know whether the students also add some further comments, but from my experience in using the Tammy, it is quite user friendly, and it really depends on how is the digital literacy level of the participants. Anyway, we can set the level of learning by ourselves. All right, it can be very simple as just like smartphone, just click on some of the button and they can really, the Tammy can share with some music preset by the participants. So therefore, every time when you want to listen some music, they just ask Tammy to turn on my favorite music. Therefore, they will play it. I mean, it's just like a smartphone. All right, this is a very simple level. If we want to have more advanced level, we can preset some of the transcript, some sort of install apps and so on. That would be more higher level. Therefore, it can have enable quite a wide range of the usage. Okay, I would say that. Okay, therefore it is and it's not so expensive. One Tammy, I mean, in Hong Kong budget is regarded as affordable. It's 50,000 per Tammy, per each Tammy, and then the maintenance fee is around 5,000 Hong Kong dollars, and so on. Okay, therefore we find that it is a realistic, a feasible budget, and with our students, they can play with the Tammy, and we plan to use the Tammy for other topics such as healthy eating, increase the water. In fact, we have used one project for the Tammy is encourage elderly in the nursing home to drink water, remind them to drink water. And therefore, we install the reminders in the Tammy, and the Tammy will walk around the nursing home, reminds the elderly to drink water regularly, and so on. Okay, therefore, I think we can have many functions with the robot. I mean, according to the focus and the outcome that we expect.
Okay, so the Tammy robot can be used also for the different target population, isn't it? Okay.
Yeah, that's true. We use it in the school as well. Just
Okay.
now I show you about we use it school for encourage them to do the hand hygiene, and because TAMI sometimes can sort of giving another way, another approach of receiving health message. Therefore, students like it, and once they like it, they remember the message. We want TAMI to work with us to reinforce health message. Okay, and therefore
Yeah.
we install the language in the TAMI, and also TAMI can speak different language. If you want them to speak Indonesia, it's also possible.
Okay. Okay. It's very interesting. Very interesting.
Yeah.
Thank you, Dr. Wu.
Yeah,
So,
thank you. Thank you.
is there any question in the on the chat? Maybe.
In the chat.
Okay. Our
What does the TAMI robot look like in details? Oh, okay. So just now, I think we can show you the pictures.
yeah.
Yeah, we have TAMI. Yeah, this one, TAMI look like this. This is TAMI. And then this is the sort of, sometimes we describe it as a walking tablet or walking smartphone. And here, because this is, I mean, how to say that, how to describe. This is, they use the GPS, internet, they can access to the internet. And then this, somewhat they can walk. Why they can walk is because maybe they have put some slides, I mean, of the settings. They can make it very smoothly, walking on the, not on the hard surface, but if the surface is smooth, they can really slide through. Therefore, make it walk. You can seems the TAMI is walking. Okay. Therefore, if they hear, I mean, if you say that TAMI, follow me, they will follow you. But of course, we need to install some of the language. Okay. Therefore, this is a just like similar to a tablet here as a head, and then this is something that they can scan or the geographical map so that they can walk. All right, this is something that is installed, and then I don't know whether there's a bigger.
So maybe the appearance of the robot can be tailored with the need of the user. Yeah.
Yeah, that's true. Therefore, some participants asked whether it can be more pretty in the next topic. But we plan to have some sticker, School of Nursing sticker on the body.
Yeah.
But it costs 5,000. Therefore, because of the budget, we don't do it this time. But maybe if we have more budget, we can have some sticker on, and make it more cheerful and more sort of unique for each topic. Yeah, this is the one.
Yeah.
And then because we have got two companies selling this TAMI, they sell the white one for the hospital, and then the black one for the education sectors.
Okay.
All right, and then because we are using it for community, therefore either white or black will do. All right, we have only two companies selling this TAMI at this stage. Yeah, okay, and you can see this is look like a tablet, right? And then at the back here, you can put something. Maybe if you want this tablet to bring something to a client, you can put the things over here. All right, and therefore ask TAMI, please go to bed number 4, and then they will go to bed number 4 to bring the item to the patient. Okay, this is how sometimes for the hospital that they have more space in the ward, they will use robot as such. Okay. But I don't know whether Indonesia hospital, if it is used in the Indonesian ward.
I
is it
myself,
possible?
up to now, that I I don't know whether the hospitals in Indonesia uses this kind of robot or not.
Okay, during the pandemic, because we want to have less contact,
Yes.
therefore they use it. But of course, always we welcome human contact, but just human contact is not possible. Therefore, we find this quite helpful in connecting people, and also have at least some virtual contact.
Yeah.
All right. We use this also in other projects for visiting the elderly in the nursing home, because we can't visit them in the nursing home during the pandemic, and therefore we give one robot to the nursing home, and then so that our students can visit the elderly through this virtual screen, and so that they can really talk over using the TAMI, and then they can talk in the online, all right? And then we call this as a virtual visit. That means not in person, but through the online settings. Okay, therefore we now try to use it in a different occasions, and it seems quite welcome by the senior citizens. You're right that at the beginning, just like student sharing, they perceive that the elderly does not welcome this, but at the end, they quite say that it's funny, it's interesting, and they welcome us to use more in future. But I think it's a blended mode. That means with our students, that means they can face-to-face as well as online. I think this is a more preferred model, all right? And this is what we mean the virtual visit, all right? Here we offer them the TAMI robot, and then they can see their families through the screen, all right? Therefore, I think it's better than without any contact, all right? But of course, we are not replace all this contact with human contact, but it's a complementary device, all right? As sort of supplementing the human contact time as well, the quality of the contact.
Okay, thank you, Dr. Wu, for your interesting added information. There is one question. I don't know, this is the question for Dr. Wu or Mrs. Nani?
Speaker.
Pardon?
Keduanya. The
For
speaker.
both. Okay. So there is a question from the audience here in the venue in Hotel Chokro for both speakers. So for Dr. Wu and also for Mrs. Nani.
The picture around not showing it. Oh, sorry, just now didn't show it. Oh, because I didn't show. Okay, maybe very quickly. Sorry.
Yeah, we have a question right from the venue here.
Venue.
Yeah.
Dr. Wu, nice to meet you. You can
Yes.
hear my voice. I am to be here at the venue, International Conference Health Science. I have a question for you. It is interesting presentation. How is the advantage of TAMI robot as education technology compared to the other methods informing knowledge, attitude, and behavior, especially in elderly education? But education often limitation in forming soft skill, psychomotor, and lack of interaction or contact gitu. Did you combine with the other methods?
Okay.
I think enough.
Can you mute
first
off
question.
the? Yeah. Maybe you can repeat the question.
Yes, I can address that. In fact, KAP. In fact, while we use a KAP model in this program as well, is we realize TAMI can help and support the KAP learning. K stands for knowledge, and how we can, as a teachers or educators, how we can ensure that the message can be remembered, can be delivered, or can be practiced after students' learning. And we find that TAMI can help to reinforce the delivery of knowledge. That means with the PowerPoint, as well as they can deliver it if second time by the TAMI or by some others video that installed in the TAMI, we can attract the learners to revise again the knowledge, because they think that it's an alternative mode, it's a second method of learning. Therefore, they are more intended to go and revise the knowledge. Okay, therefore, this is something that we need to attract our students' learning. Nowadays, young people, if there are no attractions, they don't bother to learn. Even you say that the knowledge is good for their health. All right, therefore, we need to use some sort of gimmicks and also some interesting cues for the elderly as well as for the young people to remember, all right, to how to consolidate their knowledge. Okay, that is the knowledge part. Regarding attitudes, yeah, that's true. Attitudes, it need to have a long-term interactions. Okay, we don't expect just a short moment, 4 sessions, we can change some attitudes. But however, we realize that the attitudes of some of the health promotions is related to the misconception. Okay, once the misconceptions can be changed from the knowledge, okay, the attitudes will change. Okay, therefore, sometimes we now having the observation that if we can dig deep to the attitudes, whether the attitudes is related to any misconception, if we change or clarify the misconceptions with some of the innovations using TAMI, could be more effective. Okay, it can make it also a better outcome. Okay, therefore, we think we will try again on this aspect. Okay, therefore, this is attitudes. Because I think, I don't know whether you agree with me or not, we rarely directly say to the client that you should change your attitudes. We don't use the word attitudes. We will use about knowledge more. But the word attitudes is our inner sort of perspective that we think something is maybe influenced by the attitudes, but we can't change people's attitudes, and we won't, in fact. Okay, but how we can dig deep to help them to realize how comes they have such attitudes, okay? Because attitudes has no right and wrong, right? We need to clarify. Okay, therefore it's more on the clarifications mode of understanding of people's attitudes. That is, TAMI cannot do it, that's true, okay? Regarding about the practice, the same, practice, if the video or some of the resource materials can be more easily accessible, that means if you want to read something, if you want to hear something, that help me practice. If I can get it, I will practice. It is our general observation. And therefore, TAMI also can do this. If we install some of the maybe water information, the healthy eating recipe, make it very easily to be accessible by using TAMI. They just touch a TAMI, catch a button, the information will appear in the community center. Therefore, it seems we try to make it very user-friendly and very accessible. Therefore, TAMI can help this. Okay, therefore, this is for the practice. Therefore, every level or every focus of learning, we need to sort of modify our delivery mode, and so that we can optimize the use of the TAMI.
Okay, thank you, Dr. Wu. Dr. Henny, is it clear?
Yes, it is clear, Dr. Wu. Thank you.
So you can move to the question for Mrs. Nani.
Yes, thank you, Mr. Agus.
Okay. And just now, this is the picture I mentioned. This is the virtual visit. You see the elderly, they say hi to their family, and therefore they can greet their families in virtually. All right, let's see how they use the TAMI in the nursing home for the virtual visit during the pandemic. Okay, and this is the one I mentioned. I say that it is a walking tablet because this is similar to the legs of robot. All right, and they can slide. That means they can walk. Therefore, okay, if you say TAMI, follow me, therefore he will follow you. Okay, and here is the one that I say that we can place the things here. The table, small table here behind this tablet. And if the nurse would like to put something here and then to bed number 1, for example, in the ward, therefore they will, TAMI go to the bed number 1, and therefore they can carry the things to the bed. All right, therefore save the nurse to walk to the bed if save time. Of course, provided the ward or the hospitals have space so that the TAMI can walk, all right, without any barriers. Okay, and this is how they use it. Okay, therefore this is the residents, the participants say that why don't we cover this with beautiful pictures or make it more interesting rather than a black body. Okay, this is what they need. All right. Next time, if we have more budget, we can purchase some budget for the sticker, or we intend to have a sticker look like a school uniform. I mean, the PolyU school students, they have got the uniform, and so that make it look like our students as well. Okay,
Yes,
that's our plan.
yeah.
But yeah, okay.
Yeah, thank
this
you,
is what
Dr.
we
Wu.
need. Yeah. Okay, thank you.
Well,
Thank you
yeah.
for your questions. Oh, very good questions. We can, based on this, to further improve our program as well.
Thank you, Dr.
Yeah, Dr. Henis?
Yes.
Please, your question to Ms. Nani.
Yes. Mrs. Nani, can you hear my voice?
Yes, Dr.
Yes.
Heni.
Yes.
Stop the
How are you, Mrs. Nani? You look fresh to this morning. Yes, it is interesting, innovative technology about teropong digital, and the technology have been waiting for many midwives. So for screening IFA, while as IFA for midwife do carry out with manually, and this technology is innovative and answers midwife demand to screening IFA. How about next plan for spreading to this product, develop the future about this product? And the second, how about specific different or advanced this product comparing with IFA carried with manually? I think my question, this Mr. Agus.
Yeah, thank you, Dr. Heni. Mrs. Nani, you can answer the question.
Okay, yes, Mr. Agus. Okay, thank you, Dr. Heni. I will answer your question. The first next about this product. I think I will to collaborate with company to hilirisasi in the mini hilirisasi this project to midwife in Indonesia. And the second, different from the okay, thank you. With this teropong digital, we can see cervix more clear, and we get a picture. The picture can we from to data of the patient. From diagnosis, we can to consult this picture to the doctor for diagnosis. And beside that, this teropong digital can use in midwifery student to learning about VIA test with the real experience. I think it's enough, Dr. Heni.
Yeah, I think it's enough. It's very clear. Thank you for the answer. So,
thank you.
Yeah, so all participants, I believe that you still have so many questions here because the two topics are very interesting, I think. Both technology-based in supporting health problems. But unfortunately, we have limited time, so we will, please keep your question, and maybe sometimes we can deliver the question to both speakers. Dr. Wu and Mrs. Nani, on behalf of the committee, I really thank for you, and I really appreciate for your coming and joining the our international conference today. And we really thank you and appreciate for the information that have been sharing to us. It's very interesting, very informative, and very insightful from both of you. And it's again, thank you very much for you joining us today. And also for me, I'm Agus Rubaya. Apologize for any mistake that have been made. I hand over the time to our Master of Ceremony. Certificate. Okay, we will display the certificate for both speakers. Yeah.
Thank you.
Okay, this is certificate for you, Dr. Cynthia Wu, and also best
Yes.
regard to your students, the research member. Good
Yes.
luck for the next project.
Yes, thank you. Thank you. Thank you very much. Thank you.
And the next one, the certificate for Mrs. Nani. This is the certificate was Mrs. Nani. So good luck for you, the outcoming elected, the most outstanding lecturer among Poltekkes Kemenkes in Indonesia. Bu Nani, good luck ya.
Okay. Thank you, Mr. Agus and the committee
Okay.
of DCHS.
Okay, so this is the certificate. So I will hand over the time to Master of Ceremony. For me is thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Okay.
Check. Check. Thank you, Dr. Agus Karmayana Rubaya, SKM MPH, for guiding us to an interactive session with Mrs. Nani Setiawati MKes and Dr. Cynthia Wu.
Ladies and gentlemen, coming up, the next presentation delivered by two speakers from American University of Sharjah, United Arab Emirates. The speaker is Miss Lisa Bardil Moscaritolo, PhD, and Leandro Loyola, PhD, with the topic of downstreaming of health product to support the acceleration of health transformation.
For this session, we will be guided by Mr. Uki Wulanggita, SST MSc. Mr. Uki Wulanggita, SST MSc, please come forward.
Good morning, all the participants of the 9th International Conference of Health Sciences Poltekkes Kemenkes Yogyakarta in 2022. Now we will continue to our second session. Here we have two speakers from American University of Sharjah, United Arab Emirates, ISS, Regional for Asia. They are Lisa Bardil Moscariato, PhD, and Leandro Loyola, PhD. Have you joined this Zoom? Is it audible? Dr. Lisa and Dr. Leandro? Okay,
Hi.
thank you.
I think my background's wrong. I'll change it. Does it look okay, the background?
Yes.
The background does not work for me, Dr.
Looks so good.
Oh,
I'm so sorry about
Okay.
Okay. But
Before
Leandro-
before we start our second session, allow me to introduce them by reading their curriculum vitae. All right, who will be the first speaker for this presentation? Oh, okay. Dr. Isabel Moscaritolo, she is Executive Director of Student Experiences at the American University of Sharjah. About her, passionate student affairs and services leader with extensive experience in aligning strategic goals with the university's vision and mission within a variety of function areas. Foster student engagement and foster an environment of inclusion through the innovative program and open communication. Promote a strong sense of community and collaboration among faculty, student, and staff. They like implements and measure student services and learning outcomes based on the best practices in the student affairs. Continue to lead the numerous global projects in student affairs through the various overseas locations as well as the international publication. And it is her experiences at American University of Sharjah, Executive Director of Student Experience and Vice Provost Student Life, and then Secretary General in ISS and adjunct profession. Also Associate Vice President for Student Affairs and Dean for Student in Pace University and Dean Student Life. Her education, she graduated her PhD or Doctoral of Philosophy, Education, Learnership and Administration General in 1999 at Berry University, and a Master of Science in Mental Health and Counseling or Counselor, also at Berry University, and also Master of State University, Higher Education Administration or Student Personnel. And here she got a license and certification from UNESCO, WHE C 2022 participant in UNESCO. Okay, Dr. Lisa, are you ready?
Actually, Dr. Leandro Loyola is going to start. Is that okay? Can you introduce him next, or do you want?
Oh, okay.
And then I'm going.
Okay. Dr. Leandro?
All right.
Is it
Hi
audible?
everyone. Good morning.
Okay, good
Yeah,
morning,
can
Dr.
you hear me?
Leandro. Okay, allow me to read your curriculum vitae, Dr. Leandro. A moment, please. Okay, he is Dr. Leandro Loyola, Associate Professor of Department of Management and Organization, Ramon Fidel Rosario College of Business de La Salle University. About him, he equipped with expensive experiences as a leader and manager, handling supervisory and managerial position for 16 years. Adapt in different functions of management, especially in strategic management, quality of assurance and compliance, organizational development and innovation management. His experiences at De La Salle University as Associate Professor full-time and Director of College Student Affairs, and also at De La Salle College of Saint Benil, Head Student and Involvement Office, also Head Office of Student Behaviors. His education, he finished his Doctor of Philosophy at Colegio de San Juan de Letran, Calamba, in management in 2019, and also he got his master degree in business administration, MBA business and administration and management general in Adamson University. His skills is program development, organizational development, and innovation management. I think it is his brief CV that we can see together. Are you ready, Dr. Alejandro?
Yes, thank you. Thank you for that generous introduction. Dr. Lisa and I are actually very happy to be with you today and to be part of this International Conference on Health Sciences. Please bear with me with my voice today. I am kind of having some sore throat. I think it's the weather here in Canada that's not really helping me with my situation. But I will try my best to still be audible and to be more understandable so that we'll be able to listen very well to what we will be sharing with you today. Well, to be honest, what we have prepared would be to introduce to you our association, the International Association of Student Affairs and Services. Let me just share the screen. All right. Can you see my screen right now?
Yes.
Okay. So when we were invited to the conference, we were actually thinking of how we can actually provide a relevant, discussion or topic for the conference itself. But we have decided that we would probably start by introducing the association and what we do as an association. So that because we believe that many of the participants are actually coming from the education sector. And it is very important that we also, while we try to understand the technicalities of health and sciences as the main topic of your conference or the main purpose of your conference, we also would like to highlight the importance or contribution of student affairs and services in what we do in the university or in the educational institutions. And one mover or a prime organization that we can consider that really looks into the welfare of students, and not only the students but also the practitioners of student affairs and services. And we value the importance of health services as a very important component of student affairs and services. That's why we believe that it is also important that you get to know more about what we do as an association and what student affairs and services is all about. So just to give you an overview, our association, the International Association of Student Affairs and Services, was founded in Belgium in 2013. It was actually a collaboration of different heads and deans and administrators of student affairs and services who have decided to come up with an association that will, really focus on the welfare and of course, the development and the welfare of the students in the campus. So in the terms of a structure, we are actually existing in 7 regions in the world, and we have our board and leadership team coming from different universities and institutions from around the world, from Europe, from Asia, from Africa. Actually, almost all the 7 continents are represented, right, Dr. Lisa, except for Antarctica, of course. But at least we make sure that we are very much represented by people coming from different parts of the world, so that we'll be able to, of course, address also and get to listen to their concerns and be able to learn also from what they are experiencing. In terms of our mission, IASAS acts as a global advocate for students engaged in higher education, student affairs and services practitioners, and for the profession itself. And we do this by providing a global platform for improving multi and intercultural communication and understanding, which is very much the core of the association, coming from of course, the structure wherein we would really want people to be represented and to be coming from different parts of the world, so that we get to learn from each other and we get to help each other improve how they handle student affairs and services, all for, of course, the purpose of ensuring that our students will be able to meet their success, and at the same time for our practitioners to become the best that they can be. We also would like to strengthen and diversify cooperation between individuals and organizations working in student affairs and services worldwide. This is what I was telling you about in terms of benchmarking, of sharing best practices. We get to strengthen we get to hone our skills, and we get to develop new learnings coming from our colleagues in different parts of the world. We also promote both the profession itself and the welfare of students at an international level through advocacy with governmental and higher education organizations. Because we do not just stop in talking, in having conversations, there are a lot of actions being taken by the association, and this involves also coordinating with different international organizations and making sure that our voices are being heard and that and that we are actually contributing in, like for example, in crafting policies, in coordinating very much with UNESCO, with the United Nations, and things like that. So there's really an action being taken on the things that we get to discuss and talk about. In terms of membership, we have about 1,829 members all over the world. And you can see that a majority of them are coming from the North and Central America and the Caribbean, with 944 members as of present. But also a big number comes from Asia, which I know where Indonesia belongs. No? And that's one reason why I'm also here with Dr. Lisa, because I am currently the regional director for Asia of IASAS. And we hope that after this session, we get to invite more members coming from the educational institutions in Indonesia to be part and to be a member of our association. All right. And one of the highlights of what the association does every year would be the Global Summit. And for the past 2 years, it's been so very successful. Having the Global Summit last 2020 and 2021, I mean, in the midst of the pandemic, we were still able to continue and come up with a Global Summit that was held in Canada and was co-organized by the Caucus, which is a professional association representing and serving those individuals who work in Canadian post-secondary institutions in student affairs and services. It was hosted by the University of Toronto, and we were able to gather virtual participants of 120 attendees representing the 6 regions. And during that time, the theme was Student Affairs and Services Advancing SDGs in Universities. And the most recent Global Summit that was conducted was the one in Cork, Ireland. It was hosted by SAI, Student Affairs Ireland, and the University College Cork. And we conducted the summit in a hybrid platform with 100 in-person participants and 50 virtual participants. The theme during that time was cultivating graduate attributes to empower and sustain educational development. So the rest will be discussed and shared with us by Dr. Lisa. Dr. Lisa?
Sure, thank you, Leandro. Okay, thank you. So we're excited to be here. I want to say hello to, I'm a little bit earlier than you all. I think I'm 3 hours behind, but it's great to be here from the American University of Sharjah, representing my university, and also the International Association of Student Affairs and Student Services. And thank you for inviting us today. So one of the things that, as Leandro said, we are somewhat young as a profession, and one of our goals is to really elevate what we do in student affairs. And we do this obviously from writings and working with larger bodies like UNESCO. And this is a book we completed. This is the 3rd edition of a book we did on student affairs and services in higher education. One thing we realize is that there are different people supporting students on our college campuses throughout the world. And sometimes they're faculty, sometimes they're practitioners, sometimes they're contracted consultants that are working to provide services for our students on college campuses and help them be supported. And so this book, with about over like 50 different authors from different parts of the world, really shares about what student affairs and services is about and our foundations from different parts of the world. So this is free download on our website that anyone is able to resource. Thank you, Leandro. Next slide, please. If you don't mind while you're there. Awesome. So one of the other things, and how I met Leandro, was when he was also very engaged with his association in the Philippines, Student Affairs. And one of the things we try to do is, we know that our work is more rich if we all work together to support students and understand what's happening with our students in different times, part of the world. So during COVID, obviously, this was a hard situation for all of us to adapt, whether you were in teaching academically or supporting our students in other ways. So we wanted to know what was happening and supporting each other. So there are many associations around the world that support students in different functions, whether it's from healthcare, whether it's from counseling, mental health associations, general associations of student affairs and student services, housing, whether it's academic advising, any of these associations. So we called an association meeting for the first time virtually during COVID. And we had, as you can see here, 21 different organizations participating from different continents that represent the association. And here, our first meeting was really, as you could imagine, was around COVID-19 and the impact and how we are supporting students. So this is a little bit about some of the work we do. Ian, thank you. So one of the things that we were happy about since our founding, we've been trying to work with our founder, Roger Ludman. When he started the association, we knew that we wanted to be more involved with UNESCO. So in 2000, I think it was in 2009, we went to the first World Conference. We weren't invited as an invitation, but we were invited through another network. And so what that allowed us to do is we found out that we were not, the voices of how we support students was not involved at the UNESCO in 2009 World Higher Education Conference. So we worked to better our relations and explain what we do in student affairs and student services. And then we were so happy to be invited they hold the conferences every 10 years, but because of COVID, it was 12 years. So IASIS received an invitation to be part of UNESCO's World Higher Education Conference. And as you can imagine, some of the goals here is for us to work together, transform higher education, and have it be accessible to everyone. And also, so they're concerned about accessibility and equality in higher education, because we know that's what will move us forward in the world and meeting some of the goals that the United Nations program and the Sustainability Development Goals set out. Thank you, Leandro. So we are now, crazy to think about this, but we will be celebrating now our 10-year anniversary this summer. And if you would like to hear more about it, we're going to look at the role of universities and student affairs and services, looking back and then looking forward on what has been accomplished and what we need to think about as we move forward as an international body working to support our students. So that will be happening in the future. Is there another slide I could share some other? Oh, yes, thank you. So one of the things that's really important is the association is to get as many different countries represented in our membership so we could do more further research. Because to elevate what we do, it's important that we also do research. And at this point, we have 99 different countries represented in our membership, which helped us to consider doing some research. I've been able to work with 3 others, and with the blessing of the association and its board, they have allowed us to complete 2 research projects and to reach as many people in our field to understand what was happening around COVID-19 and student affairs and student services. So our first project was started in March 2020. We've been able to reach, gosh, I think we had a sample of 1,000. After cleaning up, we were a sample of 800 practitioners to understand the impact of COVID-19 on student affairs and student services. We have been able to write in 5 to 7 different publications about the impact from Africa to the Journal of from the Journal in Australia, New Zealand, and also through the University World News on what we learned from that study. And then recently, if there is time, I could talk a little bit more about the research we did around student affairs and services. So SAS here is student affairs and services, and the sustainability development goals that we're asked to aspire to and to make a difference in the world for a better planet that we live on. And I think you guys will find it interesting that obviously since we're talking to the health science folks here, during COVID-19 and our research, that the number one or number two services that were so important during COVID-19 was healthcare and counseling. And I know I listened to it a little bit and saw your program for this conference, and I think it fits very well on some of the things you're talking about, especially telehealth, became very much more important as well during this time, and I'm excited to see what will happen in the future. Listening in this morning on the conversation. And then also during our SDG work, we found, no surprise, but the SDG that was extremely more relative and very important to the work we do. There's 17 SDGs, and the second one that was most important was good health and well-being after quality education. So that is not probably that much of a surprise, but that was something that really shined in our study when we asked student affairs and services practitioners about their work with sustainability development goals and how they were using them. In Asia, we heard a lot of case studies about concentrating on well-being, concentrating on health, and mental health was a piece of that, and educating the students. Because one of the things the student affairs and service professionals believe is that we are educating students outside of the classroom to make them stronger when they graduate. So the attributes they need is to understand about the sustainability development goals. And one of them that is really important is obviously health and well-being of our students. That's very important. And we want them to know that health and well-being is an important priority for our communities as well in a larger focus. So again, these research projects we're proud of. Go back one more, Leandra, to make sure I covered any. Okay, one more. So anyway, so one of the things, I think I already mentioned the University World News. So yes, so one of the things since we are speaking to the Asian in our region, Asia's huge. So in our region, it makes up many countries, but we do try to work in regions, and we have regional directors, and Leandro, or Dr. Loyola, is our regional director. And he works with student affairs associations in Asia to market what we do in IASIS, and also individual practitioners. At this point, we don't know of an Indonesia Student Affairs or Student Services Association in Indonesia. If there is one, we would love to be more involved. And if you can let us know, we're always looking for regional coordinators as well. So if you have interest in being a regional coordinator and working with Dr. Loyola and also the board, please let us know. And really one of the beautiful things about the International Association, and I know you guys do this in your work as well with other people from other countries, is the experience that we get by working with a colleague in South America on supporting students and learning different ways that we could focus our work and be more successful. I will end with just saying the other important thing about the International Association of Student Affairs and Student Services and why it was founded is we know our students around the world are very mobile. And even though I'm here at American University of Sharjah, I have students from 90 different nationalities. So it's important for us as student affairs practitioners to understand and be more globally aware of what's happening in different parts of the world, because our students are coming from different parts of the world and studying on our college campuses. So thank you so much for allowing us to be here. I would like to open up, we might be a little bit early, but I'd like to open up for questions maybe, if that's possible next.
Thank you so much, Dr. Lisa. To participants who would like to ask, you can do a raise hand in meeting Zoom. Or you can write, okay. We have a question from a participant in our conference in hotels. So please.
Okay. Good morning, Mrs. Lisa.
Hi.
Hi. Okay, thank you for giving me the opportunity to ask some questions, because this is the first time that I heard about ISAS, and it's very new for me. But I'm very interested in your explanation, especially about the area coordinator, or what it's called. I don't remember it, but it's kind of the coordinator for the area. And as you told us that maybe in Indonesia you haven't got any coordination with the government. But my question is, the first thing is ISAS is having relationship with the countries, the governments, or with the organization, a private organization. And if we are from the Polytechnic, is a higher educations, is it possible for us to being the coordinator of the ISAS here? And then how is the condition to be the coordinator? That's the second questions. And then the other one, is it possible for individuals to be include or engage in the ISAS program? So that is my 3 questions for you, and hope that you can give us more insightful information about it. Thank you.
Okay, okay, I'll try, and then Leandro, if I missed one of Amira's questions, I think it's Amira Satasari, is that who? I want to make sure I got the, okay. So the International Association for Student Affairs and Student Services has members that are individuals, so they might be working with supporting students individually. So yes, you could become a member. If you want to get more engaged in a leadership role, that's a possibility as well. And like one way, like I said, is becoming a regional coordinator, possibly working with Dr. Loyola. And we have, well, it's kind of fluid because we work a lot virtually, as you could imagine. We do have sometimes where we all meet together, like at global summits. But one of the things is, like, for example, we have a regional coordinator in China, and we have quite a lot of membership in the Philippines as well. And we, so one of the things is, if you were interested in being involved, you could be part of our meetings. We're a young association, so you can help us create new knowledge and new ideas. I know that I'll let Leandro talk a little bit about some of his thoughts in the future with getting folks together in Asia, because Asia is a huge region, and sharing best practices, networking. One of the things we realize is that we need to also look regionally at how we can work together, because there's so many differences. So if there was someone that was interested in being involved and they're with a university, that is absolutely a possibility, or an association or an organization like Polytechnic. So yes, we would love for you to get engaged with us. And we could send you our email addresses, or I could put my email address in the chat as well for IASIS. As Secretary General, I get most of the emails. Now, did I answer most of the questions? Leandro, do you want us to add anything or say more? I might have missed.
Probably just to be very specific, Dr. Lisa, because I think the question also is about how they can possibly be, directly coordinated with us. Because what we do is we usually coordinate with the association, with the Student Affairs Association in the country, if it's already organized. But if it's not, then we are also open in coordinating with individual members who would be interested to help us in really organizing the student affairs sector in the country or in the region. So if you are interested to become a regional coordinator, you are expected to coordinate with your fellow student affairs practitioners in the country and be able to bring membership to the association and, of course, engage them with the activities and the programs that we will be having. And if you would like to know more about our association, I have already put in the chat box our website, and you may also send us an email so that we can, be connected, and we can start. We are very much willing to help you start up your association, or at least the group of student affairs coming from Indonesia. So just let us know.
Thank you, Leandro. You helped me. I'm a little early. I'm waking up here.
No worries, Dr. Lisa.
Thank you so much for the explanation. Is it clear enough, Mrs. Happy?
Yeah, it's very clear. Yeah, and
Okay.
I'm going
Thank
to
you.
visit their website soon.
Okay.
Okay, and email me so we can follow up. Thank you.
Okay, thank you, Miss Lisa.
We still have one question from one participant, Mrs. Almira Sita.
Okay, thank you, Pak Uki. Thank you for the opportunity. May I ask question about the service of ISS? Does ISS also provide service to postgraduate students? I mean, in terms, based on my experience, some student affair, it is common to give services to undergraduate students, not for postgraduate students. How about for the postgraduate students? Is it also ISS also provide services to postgraduate or maybe postgraduate to be students? Thank you in advance.
Leandro, do you want to take what we do on our campuses with graduate students? I'm not sure if you're talking on our campuses or if you're talking as an association services we offer graduate students. Should we talk about both? Maybe that would be helpful.
Maybe we can talk about both, because I would like to probably consider what we do in IASS, Dr. Lisa, as a collective effort. So we don't really look at undergraduate or postgraduate students. We look at all students, inclusively. So regardless whether they are undergraduates or postgraduates, because what we are actually doing in IASS is that we talk about the programs, the activities, and the services that are being provided to all students by the different educational institutions. So, but it really varies on the different educational institutions. Some are very much concerned with the undergraduate because they feel that they really need to be assisted and to be given such, programs for development as compared to the postgraduate, because they are already, more matured or something like that. But regardless, most of the universities, most of our member educational institutions would always have programs and services both for the undergraduate and for the postgraduate students. Dr. Lisa?
Yeah, absolutely. And we support the academic programs. So absolutely. So I would agree with everything Dr. Loyola said. As an association, what we have done recently is we do have another signature program that kind of was put on hold during COVID-19, and that is we do do a student leader global summit because we know a lot of student affairs and service practitioners work very closely with student leaders. They could be graduate students, they could be undergraduate students, but we coordinate and work with them to help support their dreams and what they want to accomplish on their campuses. And one thing is leadership is a very important piece for all of our students. So one of the things we did, I think we've had 4 student leader global summits where we bring students from around the world together in one location. We're hoping to do that with our 10th anniversary. And so we'll bring, it's a small group of students, but the idea is we bring, students can apply and hopefully their institution helps supports them. And then we find a host. And this summer, it's going to be in Rome, Italy. Our last one was 2018. Wow, that seems so long ago.
Yeah.
And that was in, 2019, I'm sorry.
Yeah.
That was in South Africa. And we spoke about mental health and well-being from a student leadership focus. And this one is probably going to be on climate action and some environmental sustainability issues, looking at how the other SDGs impact, like how health impacts climate and environmental. So we do that as well as a larger picture. We come together and do some of that. So if that answered your question, I hope it did.
If I may add also, Dr. Lisa, I just remembered about our mentoring program, because that's also one of the services that we have. We used to have this mentoring program wherein those who are studying student affairs in the master's or the PhD level are actually being mentored by the practitioners, by the administrators coming from different educational institutions around the world. So you get to have a perspective of how student affairs and services works in other countries, and how you can actually apply some of those services being provided to your own country. And you get to learn to interact and also to understand the value of student affairs and services and how they are actually contributing to the growth, not only of the student, but also the community and the institution.
Yes, thank you for adding that about our mentor program.
Yeah.
Can I ask one more question?
Okay.
Okay. Can I ask one more question?
For
because
sure,
as
Mrs.
I seen, because as I seen nowadays, PhD students and also master degree students are suffering from mental health. So, do you have any kind of activities to help the PhD students, especially who suffer from mental health during their study?
Especially when it's time to write the dissertation.
Leandro is probably going through a little PTSD because he just finished his. What was it, a year ago, Leandro?
2019.
Oh my gosh, it was 2019, I feel like.
Yeah.
Anyway, yeah, we all feel that, we all remember that stress, I hate to say. But I would say that that's what we try to do as an association is we try to have webinars about how different parts of the world are dealing with the stress of the students. We don't actually have specific services for students like through the International Association. However, we talk about best practices, and like Leandro said, we're all feeling the well-being and how important mental health is to us. And if COVID-19 did not show us around the world how important that is, then we miss something for anyone, even if they're outside of the higher education sector. So I think one of the things we do in our association is we try to look at practices, promising practices or best practices that help in that, if that answers your question.
And I think that is Almira, I think that is a good suggestion because we are also, what we try to do now is we want to localize also the webinars that we do, like in regions. We would like to be more responsive to what the region really needs.
Yes.
That is why we would really like to, reach out to the members in the region so that we get to know what they need, what are the students' concerns, so that we'll be able to help them address these concerns through the association, through certain, sharing of best practices, webinars, or even the simple, getting together and just saying, like just checking in with each other of what you
Yeah.
are experiencing so far and things like that. So that would be, I will be taking note of that because we are already planning, to organize a small group session for the Asia region so that we can just catch up and touch base with the members in the region.
Yeah, and actually, Leandro brought up another point. One of the things we did over during COVID was collegial conversations, and we did that with professional practitioner staff that are supporting students, whether faculty, staff, staff or graduate students, because we have graduate students that are also supporting students in different parts of the world as well. And one of the things we did besides that is when we sent that out, we had some students that were part of our database students, and they said, we want a session. So we held 2 collegial conversations with students, just talking with them and hearing them and listening to each other on how they were managing things during COVID-19 with their peers. A lot of them were student leaders. So we can do more. And I failed to mention, we don't have like a central office. So we all are volunteers. So we all work because we're passionate about what we do in our work, whether it's in our regional associations or at our institutions. So we come together to also look at making this more regional conversations and then global conversations. So we could do whatever anyone's interested or helping. So please do get engaged with us, and we would love to have you work with us further.
Thank you, Dr. Lisa, and also Dr. Leandro.
Great questions. Thank you so much.
I think because of the limitation time, we have to end this session and continue to another next session. And thank you so much for your very interesting topic presentation and give us a new insight about ISS.
Well, thank you.
Thank you very much.
Thank you. We hope we'll see you in next event.
Okay, thank you.
Bye,
Take care.
thank you.
Bye.
Thank you, Mr. Uki Wulanggita, SST MSc, for guiding us to interactive session with our distinguished.
Very good morning, everyone. Thank you so much, Prof. Singh and her team for giving me this opportunity to speak at this wonderful forum. My sincere apologies, I can't be here today in person because I'm attending another course, but I'll do my best to finish this presentation in 20 minutes. And the topic given to me is parenting research. And I'm sorry, Prof. Singh, I didn't ask you, but I have added a small clause to it, my journey. So I would be sharing with you what I've done around parenting research here in Singapore. So let's, without further ado, begin with today's presentation. As we all know that parenting journey itself, especially transition to parenting, is a stressful transition period for our new parents, especially first-time parents, and they face numerous challenges, physical, emotional, psychological. And if there's a limited support for them, or if they receive conflicting advice, evidence has shown that it cause a lot more distress to them and lead them, or rather higher chances for them to have, emotional stressors, for example, getting into mental health needs and also affecting their confidence level, especially self-efficacy. So the question is that how we can support parents in Singapore. And that was a question I had all my clinical years whenever I see parents, because we all know that despite of the wonderful support we have for our parents in Singapore, early hospital discharge post childbirth is common, is not uncommon. And we also see that because of nurses and midwives, scarcity of the healthcare providers, this doesn't have enough time for parents to receive that one-on-one, even though there is that, but it's often is not enough for parents to receive that needed support. And many educational pamphlets and booklets are available, and most of the time parents feel so overwhelmed when they go to their, bring the baby home, that they don't know where to look for, what to do. And there comes the question then, how we can support the parents. And I remember often I've been asked by, budding young researchers coming into parenting research that, how did you know what to support and how to support parents? So my answer is by listening to the parents, because that's what I have done. I remember in my clinical days when I see, parents need to be supported, and doing all my ways to, give them that support during that stay. But when they go home, especially in Singapore until today, our continuity of parenting support is something which is a bit dejected. For example, parents normally have, hospital visits with the obstetricians or with the newborn doctors, neonatologists, but we don't have, continuity of care like from the community nurses or midwives like we have very well established in Nordic countries or even some parts of the West. And there comes the question then that what are the parents' needs? Because whenever I bring this up, it was always like, but I think we have very well, supported parents. And that's when I started, and during my PhD, I wanted to actually explore what are the parents' needs and how do they feel that the support we are provided. That's just we feel that is best and it's all evidence-based, but how parents feels about the support we are providing them. And I remember I couldn't find much local evidence during that time. And I remember somebody, very wise person I have met in my learning journey, who said that if it is not published, it is not done. So I think since then I have taken that responsibility on myself and ourselves. We all should have that, if we are doing something, it is good to bring it out, disseminate it, share with the like-minded individuals like we are doing here today, so that we can learn from each other's, mistakes, and also can learn from each other's strengths, collaborate to give the best support and put the best foot forward for our local parents. So my journey started, though the first publication came in 2014, but way before the work was being done, and we did a lot of exploratory work from qualitative in-depth interviews to questionnaire surveys. And we started in the beginning with the first-time mothers, and then experienced mothers, even fathers, and recently I've also started working on grandparents. So a wealth of knowledge I have actually, and all thanks to all these beautiful parents out there who have given me a lot of information themselves that how they can be supported. And another thing I felt that when we were doing, me and my team, we were working on understanding parenting needs. A lot more was also done by very, very passionate individuals overseas around the world. And that's when I saw the need that we need to have a consolidated evidence to see the best practices around parenting research. And that's where I started exploring into systematic reviews by consolidating the available evidence. And it has been regularly published, and regularly we are learning about what is available around parenting intervention, especially. And even the specific focus is now I'm learning around as the parenting needs are evolving. Especially, I started with the first-time parents. You will see in my subsequent slides, there are the first-time mothers, and then gone with the parents with the children before, then fathers, and so forth. And all this information I have gathered over the years, I have. Thanks to many people in my research team along the way, and also the grantors that we managed to develop our intervention programs for parents. So I'll be sharing with you the 6 RCTs which have been concluded in the recent years in my team. And it started with the postnatal psychoeducation program, PPP, and then the subsequent one. Now, as you can see, and I've especially highlighted certain colors or italicized certain words, what you would see that I started with the very humble beginning by supporting parents, because if you remember, I said that the continuity of support is something I felt was lacking. We don't have community nurses or midwives visiting parents and seeing what are their needs. It's always an opt-in thing when parents will be bringing their child or they will be coming back to see the doctor. So I thought that home-based intervention is something we lack and we should start with. And that's where my first intervention came in, and it was focusing on only first-time mothers and in the postpartum period. And then we went into slowly engaging first-time mothers and fathers. Then we started engaging, like I mentioned earlier, primiparas, that means mothers who are first-time pregnant, and then the mothers with the children before. And then we started with just focusing on healthy mother-child diet and also looking at their, for example, confidence, social support kind of parenting outcomes, and then started looking into, more specific outcomes around mental health. And very recently, I have started working with the newborns as well. And if you can look at the left side of this slide, that also the delivery platform of these interventions, they also evolved over time. It started with home-based and then went to web-based, and then we started engaging parents via mobile health apps. So again, I have about 20 minutes to finish my presentation, and I have all these 6 RCTs here, which is impossible for me to give all the details around them, but I have added all my papers. All these RCTs, except the last one, which is ongoing, has been published. And if you have any questions around them, I'm sorry, I know there's a Q&A time given, but during that time, I will be having engagement here in my program. So I won't be there physically present, but I'm leaving my email and other contact details. Feel free to reach me if you have any questions along the way. So again, the first program was PPP, postpartum postnatal psychoeducational program, and it was all focusing on parenting self-efficacy and the interrelated components like outcomes like social support and depression. I developed the program based on Bandura's self-efficacy theory, and as you can see from the 4 important components according to self-efficacy theory is important to enhance the parenting confidence. Now, the thing is this is why I ended up and how I know that I need to engage like Bandura's self-efficacy theory, because when I was hearing from moms, I remember vividly one of the moms shared that, I have attended all kind of programs, antenatal programs and all that, but they're delivered by experts. And I know, okay, yeah, I think I can handle. But the reality set in when I hold my baby and bring home, So all that, because there's no kind of hands-on practice and all that, they felt lack of ability and confidence to carry on those tasks. So that's why I ensure in my programs that they have ample time and opportunity to practice certain skills they feel that they need to focus on. It can be as basic as bathing the baby to verbal persuasion, which is giving them feedback, how they can improve, vicarious experience. This is another thing which we have learned from our parents out, that when we provide information as healthcare providers, it comes like a top-down approach and they really listen and they follow. However, I think for them to be a little bit more comfortable in adapting certain things and also feel, in order for them to be better, confident in taking care of their own needs or baby's needs, when the information comes from similar others, but they know that it's a credible information, that really, open up the parents to try out different things. And of course, having a good physical, mental, and psychological well-being. So PPP has 2 components. We had home visits and then we had an educational booklet. Again, I'll be a bit fast because of the time. And this is just a snippet of what the book looked like. And it has different chapters, a lot more, I think about 9 chapters. And we focus on self-care. We specifically focus on breastfeeding. And because that's something, when I hear from both fathers and mothers, that was something, common concern parents have, and also a care on, how they can take care of the newborn with different milestones and all that. But the focus was just first month after childbirth. And we have published these papers. And again, you will have my contact details at the end if you have any questions. Now, when I finished PPP program and I presented to my clinical stakeholders and parents, moms especially, because focusing on first-time moms, they just loved the program. They were like somebody coming to, they're all positive. You can see from the papers when I, interviewed them, they were like, this should be continued. Hospitals should offer it as a standard care, so and so forth. But when I presented to the clinical stakeholders, they felt, how is that feasible logistically? We all know there's a manpower crunch always. And how and where are we going to find those nurses and midwives going to the parents' house and supporting them like this? Which is very true. And that's where we decided the same program to be offered as a web-based program. In fact, very recently we have published a paper where we are comparing the web-based with the home-based, and parents have the similar, experiences. So I think that's a good news that we can go away from the home visit and only required if it is, a specific needs of parents, those who are probably from psychosocial disadvantages backgrounds. Yeah, but otherwise, I think a healthy parent and child diet, they will benefit from online interventions. So when web-based postpartum was evaluated, another thing I noticed is that in almost all my programs that, yes, we have, significant p-values and the program is working, is effective and all that. But the interviews and that's why I strongly believe, and I'm very thankful to Cochrane especially, because normally they used to publish only meta-analysis and now they have started publishing qualitative systematic review, meta-synthesis. So because I personally do believe that in order for us to have a holistic view about any program, it should go beyond just questionnaires and objective data, but also hearing from parents what works and what didn't. And that's when I realized that when parents started saying that with the web-based, moms especially, they have to be stick. They have to find a special place and gadget to be there to get this information. And during that time, when the interviews were ongoing, we also saw the big influx of our health industry with the mobile health apps. And that's where I introduced Home But Not Alone. And not many people know the name Home But Not Alone. It actually came from one of the quote from my mother, the participants who I interviewed, because she wanted something that she doesn't feel at home alone, when she's looking after the child, especially during the confinement period, or if those people who are don't know what is confinement periods, doing the month, which is commonly seen in our maternity publications. So for Home But Not Alone, we introduced a mobile health app. At the same time, we started introducing new parenting outcomes, for example, parenting satisfaction. And most importantly, all this while, my God, I was guilty. We kind of didn't focus our intervention for fathers. It was always just focusing on moms. So that's where the fathers were brought in for HPNA, and we had educational content. And the highlight of this HPNA was we were providing this periodic push notification to the parents, which means that on a daily basis for the first month of child's birth, and again, in this case, the focus one on the postpartum period, moms or the parents were receiving a notification. Like, for example, and they were very upbeat notifications. Hey, today is day 3 of your childbirth. Your baby is, 3 days old, and you should be seeing him doing this, or her doing this, that sort of stuff. And we know, especially this was important because, we know blues set in at day 7 to 10. So we kind of prepare some moms, don't feel guilty if you're feeling this, reach out. Also, any breastfeeding issues, because some moms get I don't see anything and I don't think so I can, give enough to my baby. All those things, these push notifications were helping us solve. And at the same time, we were very busy in this intervention. We had an asynchronous communication where a nurse or a midwife on a daily basis answering parent queries. So very quick one, these are just some details on HPNA. We had educational materials which were uploaded as PDF files. We had videos, and I'm not sure many of you are aware of. Some mothers don't feel comfortable, or rather they are not allowed to watch video or read something during the month of confinement period, because I think the hearsay is that it will affect their eyesight. So specifically because of parenting, these experiences I have, hearing their experiences, we develop audio files so that moms can just listen to them on the go and get the all evidence-based information. So this is just a snapshot of how the HPNA app looked like. These are some snippets of the videos we have developed. We get a fair bit of attention in the media with the HPNA. We publish our papers. In fact, this is one of my highly cited RCT paper. And yeah, so basically this gave us confidence. Yes, this app is the way to go, and especially because we were able to engage fathers. So I thought that was a fantastic thing to move forward. However, if you notice, and I've mentioned just now, my focus remained on just the postpartum period. And that's where we started feeling, and I am guilty missing out parents with children before. So it was only until SCPP in my interventions, I started focusing not just on the first time parents, but also with the parents with children before. And many a times, and in fact, literature in the West, and here we thought that, first-time parents, they don't have any experience before, they're overwhelmed, they need more support and all that. But when I started interviewing parents, mixture of parents, especially those with the kids before, we realized that they have a unique needs and they are often sidelined, and often even the people around them, this is your second child, this is your third child, you know what to do. So every child has, the parent has their unique needs. So that's why we felt that they need a specific program for themselves itself. So there was certain educational content was developed, especially like how to prevent, sibling rivalry and how to assimilate a new child to your family, so on and so forth. So that was how SEPP took birth. And also we had, especially at this time, I had a collaborator from overseas, and we felt that parent-child bonding is something we are not paying attention to, and it needs to be looked into. And SEPP has content, telephone-based educational session during the pregnancy, and then immediately after childbirth, and then 1 month access to an app. Again, if I'm not sure anybody is wondering that, okay, yeah, you're developing education program, understand your probably the delivery platforms have changed, or even population and so forth and all this stuff, but how different can you do? I mean, I know some very beautiful people have told me that, but parenting is not rocket science. Yeah, my only answer is that it is. And I often tell this to even parents. Sometimes they themselves feel that, oh, why I'm, feeling so overwhelmed and all that, or even husbands telling the mom that, my mom had 3 kids and you are just overwhelmed with the one. I mean, come on, this and that. So I think we need to be very sensitive towards parenting needs. Every child parent has individual needs. So I think we need to be more understanding, we need to be more empathetic, and we need to have all kind of resources for them. And I often tell in my way to all the parents that, you and your child, you're a limited edition. So don't compare with anybody and do your best each day. So to answer those, if you have any question like how I'm engaging and developing these education programs further, is that whenever we hear from after every RCT, if you can see from my publication, I will share the next one here. There's always a qualitative part to it, and hearing, and especially I have process evaluations done on my RCTs to know from parents where we can improve. And simple things like a video, which is on, for example, just show me how to change a diaper and all that. And for a first-time father who has not done and first time doing it, it can be a big task. And then over the years, they felt that they like more animated videos, especially during pregnancy, giving a vision to them that how a baby probably is feeling inside. And all those stuff, because of time, I couldn't add some videos here, but please write to me. I can share those videos if you would like to incorporate or see. It's very beautiful. And often whenever I present, and especially such animated videos, are very well appreciated by the parents. So again, then we reached to this stage where Gusto studies were coming up. And I know you will be hearing from Prof. Chong. He's presenting, I think, on this forum. And he's a lead PI on Gusto. And it was shown that how mom's mental health is actually influencing, baby's outcome, especially when a child is between 7 to 10 years old. So I think it was also a policy paper written that, moms, the mental health, especially if they are at any risk for depression, it should be evaluated. And that's where I felt that, okay, this is something, because even though postnatal depression was part of educational program, and it was but a secondary outcome. I didn't really focus very specific educational content or support around postpartum depression. And over the years, as I learned from parents, we felt that peer support is something. Remember Bandura's self-efficacy theory, the vicarious experience is very important for parents to, if they have seen somebody else who has gone through this journey and they are there today, I think it gives some hope to the parents. So that's when PIP was born and incepted, and we had immediate postnatal support as well as all the way until 4 weeks. Again, you will say that while you're going back, we have learned that peripartum period is something the parents should be supported, but for PIP, you're going back to just postpartum. Logistical concerns because of the funds. With the limited funds, we could only develop a good program just for the postpartum. And then these are the peer volunteers which were trained in PIP. And who are these people? They are actually, I think half of them are our NUHS staff. And then through them, word of mouth, we did, snowball sampling, we got other colleagues. And we have, I think 50% of these beautiful ladies are still with me on my current project. And those 50% who have left for whatever reasons, they have introduced this program to other mothers. Or in fact, any mother who has received the program, they get so excited and they felt so benefited that they want to give back to the mothers around. And they are coming back as volunteers to my next program. And special shout out and thanks to this beautiful lady in yellow, if you can see in the center, is Dr. Cornelia Chi. My long-term collaborator, very supportive psychiatrist from Psych Medicine and UH. And we develop our educational booklet, PIP, and just a little bit of our content inside. I know you can't see. So basically, what I wanted to highlight was it was not just about how to look at depression and da-da-da. We also know that peer volunteers can feel burnout. Peer volunteers can feel too stressed, especially when they're dealing with the, parents or participants with emotional needs. So that's when we provided a proper, they had our training with us, a day training, but we also had this booklet to reinforce the content and also reach out to us every now and then. We had regular meetings with our peer volunteers. And again, we got a little bit of a media attention and also the papers are published. Not many know, I'm not sure how much time I can't really see here. Oops, but very quickly, yes, I'm finishing. But I think I just want to share this because I'm not sure who is tuning in to listen to my presentation today, and especially for those young scientists, young researchers who are thinking whether on parenting research or children research or any kind of research you are venturing into. Sometimes we work, research is a very lonely journey. We work in beautiful teams, but mostly it's kind of a very limited context we have when we are doing something. And how we know we are doing well, other than publishing and getting invited on such forums, is this particular example I would like to share with you. This beautiful lady here. So for the peer volunteer, just a quick one, we did our best to actually match peer volunteers with the moms in a way that, socio-economic backgrounds, or even if a mom is the first time, we link it with the peer volunteer who has one child. And there is one or two, because this was one of the very unique, beautiful case where this mom, she has the lady in blue, she has a child with development need, and then she was then paired with another mom or peer volunteer who has a child with a special need. And then I didn't know the program meant and all that stuff. This mom participant actually reached out to media somehow, and I was actually called, or rather, interviewed, because they said that somebody has reached out to who has participated in your program. So that was, wow, this was really a very, very beautiful and pleasant surprise. And this story I often tell people that because many times when we do our work, we don't know how many people are benefiting. So I just want to give with this example a hope that I think we are not sure how many people are benefiting. Yes, we can see from experiences and the papers and the interviews and all that. But sometimes I feel that if we can do anything with our best intentions and do our best and give our best, even if we can make a change in one person's life, I feel that we have achieved what we have achieved or want to achieve. So on that note, stay hopeful and continue to do your good work, everybody. And the same message I'm giving to myself. And on that note, a very quick one, my last program, which is Supportive Parenting App. Very, very thankful to NMRC. I managed to get this grant in 2019, and a big shout out to all my collaborators who have worked over the years with me. Special thanks to Prof. Chong and also Dr. Evelyn. I know she's also presenting here, because with Supportive Parenting App, I managed to now, because all this while I was looking at parents and all perinatal period. However, with the SPA, we are coming up now, yes, supporting parents across perinatal period, but we are also looking at the infant outcomes. And that's something I'm going beyond my little bit away from my comfort zone. And that's why I was saying very thankful to all the beautiful collaborators who are guiding on that, how we can evaluate infant-related outcomes. So this SPA, because of COVID, we are a little bit on an extension period now. Recruitment has been ended. We have developed a very beautiful app, interactive app. It is, I can safely say, it's a one-stop, center for parents to get all, related knowledge they need for their own self-care or for the infant care. So we are at for this program, we are collecting data all the way until child is 12 months old. So it's quite a heavy program and a long follow-up. So that's why the program is still being evaluated. Parent-childs are now between 6-9 months, and few of them have already completed 12 months of follow-up with us. So I have only a little bit of a development study on this, and we are now started to evaluate our current data. What is different in this SPA program is that as opposed to whatever I have done, and as you can see, I have developed most of my program, or rather all my programs based on a theory, Bandura, Bowley's attachment theory, so on and so forth. But whatever my information around technology is all self-study, or very thanks to my beautiful collaborators. And my main role, I realized throughout these, my research study, especially which is tech-based, remained on content, expert, like providing a content, or experience, like over the years, hey, parents prefer this should be done, this and that. I didn't know much about technology. And with SPA, I took a baby step by using, information system research framework with the proper UATs done, user acceptability tests, and a constant evolvement of the app. But when I was doing this, I felt that a lot needs to be done. Yes, we need to have an interactive evidence-based app, and they should be effective, which I'm trying to do my best over the years. But apps, or rather MET technology, should not be just effective, it should also be sustainable. It should also be translated. So that's why I am I'm very fortunate to be inducted into this fellowship under Singapore Stanford Biodesign. And in fact, I'm away today because of this fellowship boot camp I'm attending for 1 week. And I hope through such programs, I will be able to give better for our interventions, like I mentioned earlier, not to be just effective, but also sustainable and translated. And I'm also very grateful to MSF, Ministry of Social and Family Development, because over the years, I have collaborated with them, and almost all my educational programs, especially the videos, have been adapted by them, and it is available on their baby bonus parenting portal. And of very recently, I have been now working with MSF actually to train community dwelling parents as peer volunteers. And this is my second last slide. Thank you for bearing with me. So based on what I have done over the years, I feel there's a lot more needs to be done in parenting research, especially I think preconception period. I think we need to examine and provide needed support to the couples, creating a positive pregnancy and perinatal experiences, not just for the healthy parent-child diet, but also those who come from certain psychological and social disadvantages. And then maternal sensitivity and attachment is another big area I think we can work on, and especially looking at then sleep patterns and all that, father-specific interventions, and lastly, accessibility of these interventions through evolving technology. As you can see, I started from homes all the way to apps, and probably Elon Musk know another 10 years down the road what we will be doing. But yes, I think the mindset of continues to evolve with the healthcare needs. And this is my personal reflection. I feel that the way forward for us in parenting research, especially in Singapore, is engaging in and collaborating with the multidisciplinary teams. And I'm very thankful once again to Prof. Singh for bringing us all together through this forum and having a multi-center testing of our programs, learning from each other, and especially looking at the cost effectiveness and sustainability. Hopefully, I'll be able to come back after this biodesign fellowship to develop better sustainable and translated kind of medtech programs, and then sharing probably the second forum Prof. Singh will be organizing, and then involvement of family members. I think there's one very beautiful group of people, grandparents, which I feel we have not tapped in our local context. A lot more can be done with them and engaging them in parenting. And lastly, translating into our clinical and community settings. So once again, thank you very much for listening to me, and let's stay connected. These are my social media handles and my emails, and I look forward to connecting with you and also collaborating with you. Thank you.
Thank you very much, Dr. Sefali Sore from Associate Professor of National University of Singapore.
Ladies and gentlemen, to get acquainted with our 8-year process organizing International Conference on Health and Science 2022, we are proudly present you various videos about the journey. But before that, let us show you some videos from our co-host and partner of the conference.
Health Polytechnic Manado is being presented as professional medical personnel education institution, which formed based on Ministry of Health and Social Welfare, Decree number 290, 8 from April 16, 2001. Based on the assessment of National Accreditation Body for Higher Education or BANPT, Health Polytechnic Manado has successfully achieved B accreditation according to Decree number 206 of 2020. The assignation of Health Polytechnic Manado by Ministry of Health as the government agency that applies the Public Service Agency's financial management pattern has been registered according to Ministry of Finance's Decree number 399 of 2019. At this time, Health Polytechnic Manado has 7 majors, consists of 13 study programs that have been accredited by Indonesian Accreditation Agency for Higher Education in Health or LAMPTKS, such as Nursing Department, Environmental Health Department, Nutritional Science Department, Midwifery Department, Pharmacy Department, Dental Health Department, and Medical Laboratory Technology Department. Nursing Department consists of 4 study programs that has been accredited by LAMPTKS, such as Nurse Study Program, a 4-year diploma nursing study program, 3-year diploma nursing study program, and a 4-year diploma health promotion study program. 4 study programs in nursing department excel in their own respective field. Nurse study program and a 4-year diploma nursing study program excel in emergency unit nursing. A 3-year diploma nursing study program excels in cardiovascular emergency unit nursing, and a 4-year diploma health promotion study program excels in health behavior and promotion. Environmental health department consists of 2 study programs that has been accredited by LAMPTECAS, such as a 4-year diploma environmental sanitation study program and a 3-year diploma sanitation study program. 2 study programs in environmental health department excel in their own respective field. A 4-year diploma environmental sanitation study program excels in vector control and waste management. The 3-year diploma sanitation study program excels in vector control and liquid waste management. Nutritional science department consists of 2 study programs that has been accredited by LAMPTECAS, such as a 4-year diploma nutrition and dietetics study program and a 3-year diploma nutrition study program. 2 study programs in nutritional science department excel in their own respective field. A 4-year diploma nutrition and dietetics study program excels in utilization of local food and nutrition intervention management, and a 3-year diploma nutrition study program excels in food science technology. Midwifery department consists of 2 study programs that has been accredited by LAMPTECAS, such as a 4-year diploma midwifery study program and a 3-year diploma midwifery study program. 2 study programs in midwifery department excel in their own respective field. A 4-year diploma midwifery study program excels in quality midwifery care in the midst of crisis and emergency management. A 3-year diploma midwifery study program excels in local culture innovation in midwifery services. Pharmacy department has 1 study program, which is a 3-year diploma pharmacy study program that excels in traditional medicine and pharmaceutical service. Dental health department has 1 study program, which is a 3-year diploma dental health study program that excels in preventive oral health care and health promotion. Medical laboratory technology department has 1 study program, which excels in lung tuberculosis diagnostic and comorbidities. All those 3 study programs also have been accredited by LAMPTECAS. Based on data from the last 3 years, the total of students applying for Health Polytechnic Manado is 11,463 students. Consists of 9,155 applicants for a 3-year diploma study program and 2,308 applicants for a 4-year diploma study program. Now the total number of students since 2018 until 2020 is 7,341, which consists of nursing department 1,763 students, environmental health department 1,231 students, nutritional science department 1,179 students, midwifery department 1,148 students, pharmacy department 653 students, dental health department 568 students, and medical laboratory technology department 773. Number of lecturers at Health Polytechnic Manado is 109 people with master and doctoral degree from well-known universities both in country and abroad. Furthermore, the human resources of Health Polytechnic Manado is powered by instructor, librarian, and administration staff. In providing education with good quality, Health Polytechnic Manado is located in 3 strategic locations, which Campus A located at Jalan RW Monginsidi Malalayang 2 Manado, Campus B located at Jalan Parigi 7 nomor 22 Malalayang 1, and Campus C located at Jalan Manguni 20 Kelurahan Malende. Implementing its activities, the departments are managed by Directorate Management, which led collectively by Director, Director of Academics, Director of Finance, General Staff and Administration, and Director of Students Affairs and Cooperation. For the sake of convenience and continuity of teaching and learning process, Health Polytechnic Manado provides representative facilities and infrastructures. The supporting facilities provided are classes, laboratory, workshop, technical implementers unit of health services, discussion room, library, auditorium, and an information system, Siakat Cloud, which integrated with MLS Edlink, journal portal that has been accredited by Dikti. Let's join Health Polytechnic Manado, and together we make Health Polytechnic Manado as an excellent, independent, and cultural vocational health education institution.
Indonesia, known as Nusantara, consists of thousands of tribal islands and millions of diversity, bring millions of hopes and dreams. Here is the place where passion and hopes meet from across the archipelago to nourish the nation. Politeknik Kesehatan Kementerian Kesehatan Yogyakarta, established in 2001, is a fusion of 6 health academies in Yogyakarta, establishing itself as the leading college of health workers in Indonesia. Politeknik Kesehatan Kemenkes Yogyakarta, or Polkesyo, is a state university under the Ministry of Health, known as university that upholds cultural values, nationality, and upholds diversity and prioritizes the interests of the nation. Polkesyo, with various works and achievements, we have proven ourselves to always serve tirelessly to produce competent health workers who can carry out their professional performance to make the healthy nation. Polkesyo, which is located in the special region of Yogyakarta, or referred to as a student city, creates a learning climate and academic atmosphere that supports student achievement. Polkesyo continues to grow and develop to become the leading, best health college in Indonesia, and aspires to be global by cultivating, implementing, and utilizing education, research, and community service, which are the main goals of higher education in Indonesia, or the Tridharma of higher education, by always being guided by Pancasila values. We carry out education, conduct research, and provide community service by improving science and technology in health sector that is beneficial to society, nation, and state. This is where the nation's best sons and daughters from various backgrounds and variations are given the widest opportunity to gather and build an intellectual community to solve health problems in Indonesia. By mutually enriching the repertoire of knowledge and human values, exploring knowledge from history, processing today, and researching for the future. Polkesyo has 6 departments and 17 study programs, namely Diploma 3, Applied Bachelor, and Professional Education. Supported by 1 professor and more than 149 lecturers who have experience teaching and research in various disciplines of health science and technology, and support from education staff. Polkesyo always develops quality education processes, which national and international standards, producing graduates with global competitiveness. To support competence, knowledge, skills, and attitudes of students, Polkesyo provides various laboratories with sophisticated and modern equipment and technology, so that a strong research culture continues to develop, marked by various innovative discoveries that are useful for society. Polkesyo has pioneered and developed the Science Techno Campus as a manifestation of its ability to create and commercialize various innovative health technology products. As support for conductive learning, in addition to other facilities and infrastructure, Polkesyo has established itself as a healthy campus by creating a green campus that is comfortable, environmentally friendly, and pollution-free with a well-maintained layout. The various existing facilities support the development of student talents through student activity units and are encouraged to realize their dreams. To improve services to the community, Polkesyo is given flexibility in financial management based on the economic and productivity principles and the application of sound business practices by establishing
Ladies and gentlemen, the next session is oral presentation. We kindly remind the participant to join the room that will be divided into main room, Borobudur. Presentation will be guided by Mr. Budi. Breakout room 2, Mendut. Presentation will be guided by Mr. Furaida. Break room 3, Plaosan. The presentation will be guided by Miss Naris. The room each participant need to enter could be seen on the screen right now. To all the participants, please pick your topic and room right now.
Good morning, all the participants. Good morning, Mrs. Narini. Based on the schedule, we have 15 minutes for each presenters. So before we start from the first one, allow me to read the rundown for this special event. On Wednesday, October 26, 2022. The first presenter, the title, The Effect of Individual Characteristic and Role of Social Environment on Drug-Resistant Tuberculosis Patients, Adherence Treatment During Pandemic COVID-19 Era. The authors, there are 4 authors. The first one, Mistry Sri Arini. Second one, Revino. The third one, Sumardiono, and the last one, Harsini. And then the second one will be the aspect of communication that may affect community decision making in the management of COVID-19. The author is Mistress Ida Magdalena. The third one will be the influence of audiovisual animated film media counseling on brushing knowledge in deaf children in extraordinary school in Banjarbaru City by Mistress Elida Sari. And number 4, we will have the use of gadgets on the mental emotional problem of the preschool children during the COVID-19 pandemic by Dr. Heni Puji and Mistress Diana Padma Putri. And then number 5, we have 3-dimension book for improving the hand washing knowledge and behavior of school children by Siti Han Istiqomah and Muhammad Mirza Fauzi. The last one, sorry, not the last one. I mean the number 6 or the 6th will be the glycemic index of Gayam, Inocarpus fagivorous cookies as a high dietary fiber food. The author are Agus Wijanaka, Nur Tifauziah, A.N. Dewi, Lili Setyaningsih, and Weni Mufitasari. Number 7, we have analysis of anatomical characteristic in predicting difficult in intubation according to the Wilson risk sum in general anesthetic patient by Kania Ratna Yustiana Olva and Tri Widyaningsih. The last one, reduce of the number of germs in the room air with red beetle leaf disinfectant by Nadia Saumi. Okay, now move to the number one. Mrs. Arini and authors, are you ready?
Ready.
Okay, you can. Well, we will have a 15 minutes, 10 minutes will be the brief explanation, and then 5 minutes will be Q&A. Time is yours. Thank you.
Oke, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thanks for Mas Uki. I will to presentasi my research. The title is the effect of individual characteristic and role of social environment on drug-resistant tuberculosis patients adherence treatment during pandemic COVID-19 era. Introduction. According to Global Tuberculosis Report, recently drug-resistant tuberculosis continues to be a threat to public health. There are 24,000 drug-resistant tuberculosis cases every year in Indonesia. The treatment coverage rate in special region of Yogyakarta and Central Java 82.7% and 85.1%, which still below the treatment coverage target. Meanwhile, treatment dropout rate in 2011-2015 continued to increase from 25% to 30%, which lead to the increase to loss to follow up. Various efforts have been conducted to control LTFU. This means LTFU, loss to follow up. In many countries, it was found the psychological emotional problems such as feeling of depression, stigmatization, isolation, and poverty that obtains as the impact for drug-resistant tuberculosis became one of the great reasons of drug-resistant tuberculosis patients inadequate treatment adherence. Therefore, emotional support in form of family support and environmental support is needed. Some mental health problems such as job loss, comfort of residents, and other social discrimination also affect a patient's motivation to take the treatment. Hence, drug tuberculosis in patient drug-resistant tuberculosis with good mental health would have a greater chance for healing. I am research methods. This study is to examining factor that influencing the drug-resistant tuberculosis treatment adherence and as seen from individual internal and external factor, socio-demographic, and socio-environmental factor. And study design use cross-sectional design, total sample obtained with 150 patients from DIY and Central Java. Instrument used study was a modified questionnaire from Mars, medical adherence rating scale questionnaire combined with the 5 dots treatment strategy. Data analysis use Stata 17. Study concept in my research use independent variable, individual internal factor, individual external factor, and social environmental factor. Two dependent variable, drug resistant tuberculosis treatment adherence. It says health status, good, failed, finished treatment, and default LTFU or stop. Ethic and dissemination with Faculty of Medicine, State University of 11 Maret, Surakarta. Result and discuss. Result and discussion is main result. Table 1 of distribution of drug-resistant tuberculosis patient by district of resident in DIY and Central Java region, total sample 156 patients, and result scored total 130, and not good 26. In the table 1, it's known that mostly the drug result tuberculosis respondent who live in Central Java region is mostly live in Klaten with the total 25 respondent. And so result determinant of individual internal factor of drug resistant tuberculosis treatment adherence is variable, and result of p-value and significant for age and knowledge motivation. The table shows a result person G-square test, variable age, knowledge, and motivation have a significant value. And patient age from over 45 years have a higher cure rate because they still have a high motivation to fight the disease rather than elderly. And therefore important to motivating patient social environment to be more caring and supporting the patient to improve their health status. And determinant of individual external factor on drug-resistant tuberculosis treatment adherence and p-value significant, and variable socio-economic, occupation status, and significant value. Result and of person Chi-square test, variable socio-economic and occupation have significant value, well socio-demographic and not significant. And can be concluded economic and occupation are affecting the drug-resistant tuberculosis treatment adherence. And then apart from the occupational status, also determines the level of compliance, because patient's recovery is more effective when the patient is staying at home, focusing during their treatment and minimize the drug-resistant tuberculosis transmission itself.
because era pandemic COVID. Determinants of social environment factor on drug-resistant tuberculosis treatment adherence. Its p-value significance is variable family support, social support, and stigmatization support. The table shows result of a person T-square test variable of family support, social support, and stigmatization support have a significance level and means they are effective the drug-resistant tuberculosis treatment adherence. Well, the social support have an effective and effects as increase the defense against stress, changing affective states, increasing self-efficacy, and influencing to change their negative behavior and become more confident to recover. The drug-resistant tuberculosis patients who are stigmatized by people around them no longer have attribute and a characteristic their social identity. Therefore, it is necessary to invest to reduce and stigmatize toward drug-resistant tuberculosis patients to improve the level of treatment adherence well. And then result of multivariate analysis. The result of logistic regression show that most dominant variable influencing treatment in drug-resistant tuberculosis patient is family support when on odds ratio 27.9. Research finding drug-resistant tuberculosis patient recovery influenced by the level of adherence and treatment. And two, the correlation of knowledge, social support, family support, and stigmatization. And this research conclusion, treatment adherence is influenced by individual internal factors, age, knowledge, motivation, individual external knowledge, individual external factor, socioeconomic and occupation, and social environmental factor, family support, social support, and stigmatization. During treatment period, the drug-resistant tuberculosis patient age 45 years had a higher cure rate than the elderly. Patient with high level to knowledge of TB will increase the patient motivation to the treatment, implementing clean and healthy behavior and preventing drug-resistant tuberculosis transmission. Therefore, the existence of family support and surrounding environment followed by good social economic condition will affect the quality of the patient's life during the treatment. And this study family support was the most influencing factor in drug-resistant tuberculosis treatment adherence with odds ratio 27.9. Thank you.
Thank you so much for the interesting topic research. So I would like to give the time to audience. Is there any question from the audience from Zoom? Okay, We have 5 minutes left. Okay, thank you so much, Mrs. Arini. Maybe that's all for your presentation because no question from the audience here. Okay, now we continue to the second topic about the aspect of communication that may affect community decision making in the management of COVID-19. The author is Mistress Ida Magdalena. To Mistress Ida Magdalena, the time is yours.
Yes, thank you very much, Mr. Uki. Assalamualaikum warahmatullahi wabarakatuh. That my voice, can you hear my voice?
Yes, it is audible.
Yes, I would like to share my screen. That is clear? My screen, can you see?
Yes, it is clear enough.
Yeah. Assalamualaikum warahmatullahi wabarakatuh. Hello, how's it going? I hope everything is okay. Honorable all the 9th International Conference on Health Science Poltekkes Kemenkes Yogyakarta participants. First of all, in the name of God, Allah Subhanahu wa Ta'ala, who has given us mercy and blessing, we can hear in the Zoom without any obstacle and trouble. Let me, on this occasion, present the result of our research. Me, Ida Magdalena, Wahyuni, Wastuningsi, and Handayani. Entitled aspect of communication that may affect community decision making in the management of COVID-19. Okay. Based on WHO information on the 25th of October 2022, as we know, COVID-19 has covered 234 countries with as many confirmed patients as possible, 624,235,272. From that, the confirmed patient, 6,555,270 people dying. Okay, next. Yeah. In Indonesia, on October 2022, there are 6,469,276 confirmed case with 158,416 people die, while for the province with the most active case is Jawa Barat and Jakarta. The most case of death are Jawa Tengah. Until October 2022, our country, has vaccinated with a cumulative number of as many as more than 235 billion person. Okay, research background. Data published on COVID-19, there are, I explained before, in Yogyakarta, a total of 2,030 and 75 confirmed case, 28.63% people were treated, 2.57% people died, and 68.80% people were declared cured from total case. The coronavirus disease pandemic has caused a crisis. Communication is one of the 8 pillars that must be built by a country to control health event and emergency. One of the important strategy for implementing pandemic influenza risk management is that central and local government communication must provide understandable, timely, transparent, and coordinated information before, during, and after a health emergency. Based on the experiences of other countries that have been relatively successful in dealing with COVID-19, we can conclude that the communication factor is a very important aspect in dealing with COVID-19 until now. Research purpose is to analyze aspects of communication that may affect people's behavior to prevent the spread of COVID-19. We know Indonesia is one country that success for prevent the spread of COVID-19, we know. Material and method design. This study uses qualitative with a phenomenological approach. The research will be conducted on the natural condition of the object. No intervention is given to the informant. About sample, people from Yogyakarta special religion who are willing to participate. The number of sample used in the study was 12 participants. The sample to be used in this study was selected using a purposive sampling method. Data collection. The data collection techniques used include in-depth interview, observations, and documentation studies. The interview guide include 10 questions, items about aspects of communication that influence people in making decisions about COVID-19. The credibility test was conducted using the triangulation method and confirmability test. The result of this study that aspect of communication that may affect community decision making in the management of COVID-19 are based on 5 main themes. The theme of the result of the study we can explain as follows. Theme number 1, informants provide information that can be concluded from the communication aspect that is important in making decision is a source of information about COVID. There are divided two amount of information and type of information. We conclude the important aspect in making decision is a source of information about COVID. Okay, number 2 of theme is the second theme that we can conclude from the result of interview with informant about the communication aspect is the information media use. Some information use a poster and leaflet like a print media, and some of participants use TikTok, Instagram, Facebook, and website as audio-visual media. That we conclude media is an important thing to can affect the community when they choose something decision to prevent about COVID-19. Okay, now time number 3 frequency of access of information about COVID-19 from informant that representing the community, divided into two parts, early access and frequent access. Frequency of access is a part of important thing when the community make a decision for what they're going to do. And number 4, theme number 4, what we found from the result of interview with informant is that the content of the information they receive will affect the action they take next. Yeah, next. What we do next depend on information that they take from content of from information that maybe a government give, like a COVID-19 case, a new variant type of COVID-19, health protocol, self-isolation procedure, etc. And the last theme, or number 5 theme, that the aspect of communication that influence decision-making regarding to prevention of COVID-19 in the community are barrier to overcoming COVID from the community, like not obey or difficult to access information. Yeah, like hard to obey, do not wear a mask, crowded, difficult to access information. Theme number 5 are barriers to overcoming COVID-19. Conclusion, the result of this study obtained 5 main themes, namely source of information about COVID-19, information media about COVID-19, frequency of access to information about COVID-19, and next, fill in the information about COVID-19 that is accessed and the obstacle to overcoming COVID-19. Crisis is characterized by a chaotic situation or chaos, abnormal and very dangerous if no intervention is carried out to fix the current situation. The current crisis is caused by communication. Wahyuni, 2020, communication is an important part in dealing with disaster, including COVID-19. Nur Ayuningtyas Prihatiningsih 2020. The result of this study are in line with Porter and Samovar, who state that dynamic communication will increase public understanding of the information provided. One of the strategy to obtain behavior change, according to WHO, is to provide information to increase knowledge to improve health status. The provision of this information must adapt to the characteristic of the community and adapt to the media and the content of the information. I think that's enough. Thank you very much. Mr. Luki.
Thank you so much, Mrs. Ida. Is there any question from the audience? Okay, yes.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Bu Ida, is it quite clear, my voice?
Yes, I can hear your voice clear.
Okay. Yeah, Bu Ida, I have a question according to the result of your research. Yeah, as it was mentioned in your presentations, that the result of the study, that aspect of communication that may affect community decision making, based on 5 themes. That's right, yeah. Based on
Yes.
5 themes. How do you get these 5 main themes? Because according to the methods, it was written that the data collection techniques, it is written that interview guides include 10 questions. How can you try to take the conclusion or the result from these 10 questions become 5 themes of the result? Because I haven't seen the question.
Yes.
Okay, thank you, Wida.
Yeah, thank you very much, Ms. Sefi, for your question. In this research, we use 10 questions to trigger the question for the participant, and every participant can talking. I'm sorry. Wait for a minute.
Yes, we can have a break until the adhan is finished. Three minutes is enough, I think.
Maybe we can continue ya. Soalnya it's long for azan in here.
Okay.
Yeah,
Yes.
Miss Sefi, 10 question for trigger the answer from informant. The informant can free to talk about the aspect of communication that affect they prevent COVID-19, and we every word they talk to me, talk to us. We conclude the same thing that the conclusion of the word is can divide into several themes. That the end of this research we find 5 theme that paling berpengaruh ya, can paling berpengaruh pada in communication that we found data. It's clear, Miss Sefi?
Yes, Budia, thank you.
Yeah, thank you. You are welcome.
Okay, thank you so much. Okay, we have a question from a chat box. Could you please share the question?
Okay, from Mr. Budi, how we can prevent our information from fake information? Thank you for your question, Mr. Budi. We talk about aspect to prevent spread of COVID-19. Maybe the informant tell me about her or his life that not tidak berhubungan ya, not that topic. The information, the fact information we exclude. We just take the true information about COVID-19. Maybe it's for me. Thank you very much, Mr. Uki.
Thank you so much, because limitation of the time also. Okay, warmly inform you the participant of this in this workshop, I mean the presenter, we have 15 minutes with 10 minutes for the the presentation and 5 minutes for question and answer. And the third one, we will continue to the influence of audiovisual animated film media counseling on brushing knowledge in deaf children in extraordinary school in Banjarbaru City. The author is Mrs. Emilda Sari. Have you joined with us, Mrs. Emilda Sari?
Hello, good afternoon. Hello, am I audible?
Yes, you're audible. Yes,
Okay.
you can start your presentation.
I will share my PowerPoint.
Okay.
Can you see my PowerPoint now?
Yes, it is clear.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone, and welcome to my presentation. My name is Emil Dasari from Dental Nurse Department in Poltekkes Kemenkes Banjarmasin. First of all, I want to say thank you for giving me such a good opportunity to talk about my research today. As you can see on the screen, our topic today is the influence of audiovisual animated film media counseling and brushing knowledge in deaf children, extraordinary school in Banjarbaru City. My presentation will take about around 7 minutes. There will be time for question and the end of my presentation. Okay, then I'll go to the next slide. This is the data behind on why I choose our topic today to discuss or my presentation. In 2010, the World Health Organization, the number of children with special needs in Indonesia was around 7 until 10% of the total number of children. And Ministry of Health of Indonesia say the characteristics of the type of disability are mostly visually impaired, deaf, and a small part of learning disorder. Behavior of children with special needs, such as the habit of brushing their teeth 2 times a day, approximately 70% and 50 until 75%. It allows without the help of others. In 2007, Central Statistic Agency, the number of children with special needs in Indonesia was 1.6 million people. In 2018, it showed that the proportion of disability at the age of 5 until 70 years is 3.3%, the age group of 5 until 9 at the least 2.5%. Age 10 until 14 years as much as 3.5% and 50 until 70% as much as 4.2%. For the province of South Kalimantan in itself, the proportion of disability at the age of 5 until 70 years is around 3.6%. From Harry Giuliani, in order to maximize the use of the sense and increase knowledge of dental and oral health in students, dental health counseling with methods that can attract interest and maximize the use of student science. The eye is the most dominant sense of deaf children. According to Ali 2011, animated, animated films are very important for learning motor skill because they provide an opportunity for learners to see the performance of skill that cause speed of thinking. In this research, I choose the design. The design of this study is pre-experimental with the design of one group pre-test, post-test. And for the research lab, this research was conducted at the extraordinary school of Banjarbaru City with an address on Jalan Abadi 3, Wengga, Guntung Manggis, Landasan Ulin District, and at extraordinary school to Martapura City, Banjar, South Kalimantan. Next, I will explain about this research result. Based on this table, the Wilcoxon rank test result is known as a symptom size to tell is worth 0.000. Then the interpretation is there is an influence of audiovisual media counseling for animated films on grasping knowledge in deaf children in extraordinary school in Banjarbaru City. Sorry. This shows that the use animation method is effective in improving of dental health knowledge of deaf children. According to the Ministry of Health of the Republic Indonesia in 2008, the factors that greatly affect health counseling are in the aspect of selecting method, tools or media, and the number of target groups. Meaning to get results from counseling by maximizing this, their factor is very influential. In order to maximize the use of the sense and increase knowledge of dental and oral health in students, dental health counseling is needed with methods that can attract, interest, and maximize the use of students' sense of interest, like stated by Harry Giuliani 2002. Through animated film, it is able to provide stronger visual display of various phenomena and abstract information that play a very important role in improving the quality of learning, like stated by Higley 2004. So conclusion of this research, it can be concluded as follows. Number one is the knowledge of brushing your teeth before counseling using audio visual media of animated film in school is extraordinary which is not good. And number two, the knowledge of brushing your teeth after counseling using audiovisual media of animated film in school is an amazing category of good. And conclusion number three, there is an influence of animated film, audiovisual media counseling on brushing knowledge in deaf children in school. This research, I have Haki too for jenis ciptaan karya rekaman video. And for the video, I want to show you my video. Okay. Share screen.
Kok rasanya nyeri gitu? Aduh, mama.
Cara mencapai benar oleh mendasari TNKes dan Siti Salama.
Ngantuk. Tidur ah. Bacanya dilanjutin besok siang aja deh. Kan besok libur. Aduh, gigiku kenapa ya? Clara, ada apa denganmu? Hei, coba lihat. Ini pasti kan? Iya, Bubu. Semalam aku baca buku. Ya udah, aku tidur aja. Aku harus sikat gigi sebelum tidur. Nah, saat tidur, air liur di dalam mulut akan berkurang. Jadi kuman-kuman dapat dengan mudah merusak gigi. Selain itu, sikat gigi sebelum tidur dapat mencegah bau tidak sedap di pagi hari. Karena kuman-kuman dalam mulut berkembang biak kalau kita tidak sikat gigi. Setelah kita makan malam atau menerima sisa-sisa makanan yang menempel akan menjadi rumput yang hangat bagi kuman-kuman jahat. Bayangkan kalau kita tidak sikat gigi sebelum tidur, itu pasti akan senang sekali berkembang biak hingga membuat gigi rapuh ataupun gigi berlubang. Jadi, itu ada yang berlubang tuh. Mungkin saja begitu. Lebih baik kamu ke dokter saja, Clara, untuk memastikan apakah gigimu ada yang berlubang atau tidak. Kalau ternyata gigiku ada yang berlubang, gimana, Bu? Aku nggak nambal gigimu. Lebih baik kamu ke dokter gigi agar bisa segera ditangani. Dan jangan malas lagi sebelum tidur. Iya, Bu Gina. Sesudah sarapan dan sebelum tidur. Iya deh. Ya udah, kalau gitu aku mau mandi dulu. Iya. Terus aku mau bilang ke Mama kalau gigi sakit. Supaya Mama antar aku ke dokter gigi. Oke, Clara. Semoga cepat sembuh ya.
Mana cerita Clara yang sakit gigi? Nah, anak-anak, bagaimana cerita Clara yang sakit gigi karena malas menyikat gigi setelah makan dan sebelum tidur? Menarik bukan? Kali ini Ibu akan mengajarkan cara menyikat gigi yang baik dan benar agar bukan tidak bohong dan sakit seperti Clara. Yang perlu kalian perhatikan saat hendak menyikat gigi
Excuse me,
adalah
Mrs.
yang pertama, kalian
Emilda,
harus
warmly remind you that we have 5 minutes left.
Okay. I think it's enough.
Okay, thank you. I would like to give the time to audience. Is there any question that would you like to ask to Mrs. Emilda? Okay, I would like to ask a question about the population and also samples that you got from your research. How did you got the sample? I mean, it is a total population or do you have any other samples criteria to get your samples? Thank you.
Okay. For a sample, of course, my sample is all of deaf children. So, in extraordinary school, the deaf children is not too much. Just some they have kind of category of deep of extraordinary and like Nanetra and the other. So we use total population of deaf children in 2 schools in Banjarbaru. The location is extraordinary Banjarbaru and extraordinary school Martapura because we need much sample. So we use all of population, so it's total sampling.
Okay, thank you so much for your explanation. It was very interesting topic. Because the limitation of time, we have to move to the next presenter. So the title of the fourth one is Use of the Gadget on the Mental Emotional Problems of Preschool Children During the COVID-19 Pandemic. And the author are Dr. Heni Puji and Diani Padma Putri. Okay, the time is yours, Dr. Heni.
Thank you. Mr. Uki, for chance given to me to the presentation. Good afternoon for everybody which is joining us with in this room. Before starting our presentation today, let me to introduce myself. I am Heni as a first authors from Midwifery Department. Polytechnic of Health of Yogyakarta, and I'm now still in Borobudur Ballroom, which is the IGHS venue. The title paper is The Use of Gadget on Mental Emotional Problems of Preschool Children During the COVID-19 Pandemic. First, I will share my screen. I will explain to you about introduction of my paper. The coronavirus disease COVID-19 pandemic has created the need and necessity for social distancing, and these efforts are made with the aim that the healthcare system is not overwhelmed by the increasing number of patients who must be served. One of the many government efforts to reduce the spread of COVID-19 is implementing policies to suspend all educational activities and implementing alternative educational processes for student and student online. In this era, pandemic, people are required the use gadget, especially in doing learning. However, nowadays many parents are less concerned when their children use gadgets. Many parents leave children using gadget at the age of younger children because parents think so that their children not crying or fussing if use the gadget. According to Asian parents, psychologists say the ideal time to give gadget to children is 12 years old. But ironically, nowadays gadgets have been recognized by children age until less than 8 years, who should not be worthy of using gadget. Indeed, on the one hand, the use of gadget provides benefit to children because children can learn so as to stimulate children's visual and auditory abilities. But on the other hand, continuous use of gadget in early childhood can also have a negative impact on children's behavior pattern in the daily life and will become dependent. According to several research, there is a relationship between smartphone addiction and children's mental emotional problems. According to the result of a preliminary study conducted preschool children in rural district Sleman, Yogyakarta, Indonesia, the majority of students use gadget. There were students who already use gadget. The teacher said that in keeping the learning going, the teacher used gadget facilities for online learning, but some parents said that their children sometimes had problems such as difficult to talk to, often daydreaming and miss lesson. The study, the method of study, the method used, the study is analysis observational study with a retrospective cohort study design. The population of this research is preschool children in rural district Sleman, Yogyakarta, Indonesia. The sample in this study was preschool children, age 36 until 72 months at preschool children in rural and urban district Sleman, who meet the criteria. And the sampling technique used was purposive sampling technique. The inclusion criteria in this study were willing to become respondent, and the exclusion criteria were children with mental and psychic physical disabilities. The type of data used in this study is primary data. Data analysis use univariate analysis, bivariate analysis, and multivariate analysis. Bivariate analysis using chi-square test and relative risk test, and multivariate analysis using logistic regression, PET analysis, and PET analysis. Based on the result of calculation using a ratio of 1:1 plus 10%, so that the total subject is 140 subject, 70 subject from the sample exposed to gadgets, and 70 subject from the sample not exposed. The result of univariate analysis we saw at the table 1 that 62.9% of children have mother with higher education, and 76.4 children have father with higher education, and 76.4 children mother have working status. And 60% of parents have income more than the minimum, and the majority of children get parenting democracy from their parents as much as 64.3. This study analysis have 11 variables consisting of mother education, father education, mother work status, parent income, parenting, gadget usage, parental assistance, exposure time of using of gadget, health status, activity restriction during the COVID-19 pandemic, and children emotional mental. Then bivariate analysis was carried out to see the significance of the relationship between variable, independent and dependent variable. Use of gadget exposed to increase occurrence disturb mental emotional preschool children. Based on result bivariate analysis of the relationship between parental characteristic and mental emotional preschool children, it is known that the variable of mother education, father education, mother employment status, parents' income, parental assistance, length of expose of gadget, health status, and activities restriction during pandemic have relationship with children mental and emotional with p-value less than 0.05, then this mean are significant. Meanwhile, parenting does not have a significant relationship with mental emotional in children. And variable that have p-value less 0.25 were analyzed by multivariate modeling. All variables that have a p-value more than 0.1 are excluded from the model one by one, starting from the variables that has the largest p-value. The first multivariate modeling is follow. You can see at the table 4. And based on the result obtained, the Lakers p-value is parenting, so that the first one excluded from the first modeling is parenting. The analysis was carried out up to stage 6 modeling or 6 step. The result of the latest modeling are as follows. We can see at the figure at the table 5. And based on the multivariate analysis, the variables that were significant related to child mental emotional state were father education, mother employment status, use of gadget, parental assistance, and health status. Then the result of the PAT analysis shows the goodness of fit measure or goodness of fit model of PAT analysis is shown in figure 1. As shown in figure 1, which shows the model fit measurement, that the CMIN fit index is 4.027, and FI normed for fourth index 1000, and more 0.90, and CVI comparative fit index more 0.90, and for a root mean square error of approximation 0.146, which means that the empirical model meets the specified criteria and status in accordance with empirical data, so that this research can be continued in the next stage. Then from result of pathway analysis, we know that there is direct and indirect relationship between 12 variables on children mental and emotional. Variables that have a direct relationship to the quality of life of children are health status, activity restriction, exposure time, parent assistance, parent income, and mother job. About indirect influence is a variable activity restriction, exposure time, mother job, mother education has correlation indirect influence to quality of life through health status. And then exposure time, parent assistance, gadget usage, mother job, father education, mother's education have indirect influence to quality of life of children through activity restriction. This is discussion from my paper in the results of the distribution of respondent characteristic. It is known that respondent whose experience mental emotional disorder are 70 respondent, and 74 of whom are exposed to gadget, and 66 of them are not exposed to gadget. So in this one by one exposed group versus non-exposed group. Other factors that influence the emotional mentality of children that the research examined in this study were parent education, parent occupation, parent income, and parenting pattern. In the result of the study, the distribution of parental assistance and the use of gadget was mostly in the category of providing assistance, as many as 124 respondents. And then with assistance, parent can consider how much time is allowed for preschoolers to play with gadgets, because the total length of use of gadget can affect children development. The results of the study are in line with a research conducted by several research before. Is one of the factors that influence of the formation of behavior. A good level of education for parents will result in better parenting for children. Mother's knowledge will clearly influence mother in providing parenting styles to children. Mother who have good knowledge will provide good care for children, so that their child development will be good. So the conclusion of this paper, there was a significant relationship between the use of gadget in children and the child emotional mentally, and there is no significant relationship between parents' education, parents' occupation, parents' income, and parenting pattern with emotional mentally in children. Children in the category of being exposed to gadget under risk of experience mental emotional disorder. 2.187 times risk higher than children in the category of not being exposed to gadget. Thank you very much for your great attention. The time I will back to Mr. Uki. Thank you.
Thank you so much. It is very interesting topic about gadget. To audience, are there any question? Please feel free to ask. Okay, I think it is enough. Okay, we have to continue to the fifth paper from the author Miss Siti Hani Istiqomah and Mr. Muhammad Mirza Fauzi. The title is Leave the Flap Book for Improving the Hand Washing Knowledge and Behavior of School Children. Okay, to Miss Siti Hani Istiqomah, can you start the presentation? Are you ready?
Ready, I'm ready.
Okay,
Hello,
thank you.
Mr. Uki. Okay. I will share my screen. Mbak, tolongin Mbak. Mbak, tolongin Mbak. Hello, Mr. Uki.
Yes.
Okay, I'm ready.
Okay. Now you can start.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. I would like to say thank you for coming for our presentation today. It's great to see you all. Let me introduce myself. My name is Hani and I'm from Yogyakarta. On this occasion, I would like to presentation Leave the Flap book for improving the hand washing knowledge and behavior at school children. Recent background, health problems related to infectious disease are still high, such as diarrhea, worm, and jungle hemorrhagic fever. Hand washing behavior is still influenced by many things, including the lack of knowledge, education, and awareness of the behavior of washing hand with soap. Next, behavior of washing hand with soap reduced the incidence of diarrhea disease by 45, and Burton et al. Washing hand with soap is more effective in transferring germ than washing hand only with water. Hand washing with soap is the simplest most affordable and cost-effective preventative intervention for reducing the burden of communicable disease, including the COVID-19. And have next research question: what the Lift the Flap educational hand washing book model change hand washing behavior in elementary school? Research purpose: the purpose of this study was to find out the Lift the Flap book, Lift the Flap book model hand washing education, which is designed attractively, can change the behavior of school children so that they can prevent diseases that are transmitted by hand. Benefits: prevention of transmission of diarrhea disease, dysentery, hepatitis, prevention of helminthiasis transmission, and cultivate children's interest in reading. Research urgency: infectious diseases such as diarrhea are still quite high. So children's knowledge about hand washing is still very little. There are still a few books for children about health. And research design, quasi-experiment with pre-test or post-test design with control group. Time and place. The time of the research is June to November 2019. This research was conducted in Yogyakarta City. Population: there are 65 excellent schools, and 15 of which are excellent favorites. The sample used in this study, 30% of the favorite school, as many as 4 schools, were taken randomly. Sample, the number of sample was taken with the criteria that children aged 6 to 8 years. Second grade students were 2,044 students. Treatment: SD Serayu, SD Sapen, and control SD Tumbuh 1 and SDIT Lukman Hakim. Data analysis use descriptive and statistical analysis, SPSS. Table 1, hand washing knowledge level, students who answer hand washing time. And table 2, hand washing behavior of respondent, treatment and control. Student who can wash pillars 7 in sequence. And the result of the main with non-part test analysis are the different between before and after being given treatment. Discussion: hand washing knowledge level. The level of knowledge of respondent who received treatment, namely reading the flap books, that was hand with shot. There was a difference between treatment and control respondent. The pre-treatment values has a value of 5 to 7 when washing hand, as many as 64 respondent mean good already understand when to wash hand. Next, in the treatment that has a good level of knowledge, that is from 64% to 94%. When in the control, 61 to 91. Increase in the treatment by 30% and control by 20%. Treatment materials are provided when to wash hand and hand wash demonstration and reading the flap book. The picture reading the flap book from SD Sapen and SD Tumbuh. Next, the intervention carried out by Zhang et al. In Uganda also showed that the promoting of hand washing is important and has the potential to reduce the risk of diarrhea disease in children. Hand washing behavior, a control group of ex-respondents were able to practice hand washing 5 to 7 steps, meaning that from the start the control was better. The result of the main Whitney non-part test saw a value, meaning that there was a difference in hand washing behavior between respondents who were trained to reading the flap book plus a 7-step hand washing demonstration with control, which only demonstration hand washing. The average respondent who has a very good behavior in the treatment group is 67%, namely being able to wash their hand with 3 to 4 steps. Hand washing behavior, next hand washing behavior, promotion of hand washing behavior, improvement of clean water quality and environmental sanitation have been shown to reduce the incidence of gastrointestinal disease, respiratory disease, and reduce student absenteeism in developing countries. Conclusion, the level of knowledge of when the wash hand sound the tree was an increase before and after being given treatment. That is 72 respondents, now increased by 27 respondents, and 1 respondent disguised. Hand washing behavior showed that there was an increase before and after being given treatment, namely 71 respondents, not increasing by 2019 respondents. There is a difference in the level of knowledge in critical time of hand washing and behavior about hand washing and second grade school children before and after reading the book Lift the Flap in second grade in the Superwell Elementary School in Yogyakarta. Suggestion, washing hand with soap starting from the lowest class, so that is useful for preventing infectious disease through hand media. Can use the media Lift the Flap book, Let's Wash Hand with Soap for community service in elementary school, PAUD, and TPA. In picture, reading Lift the Flap book from SD Tumbuh, SD IT, and SD Sapen. Respondent fill out the questionnaire, hand washing practice, report for school. Okay, thank you very very much
Thank you
for
very
your
much for the
ladies
very
and
interesting.
gentlemen.
Yes, I would like to give the audience question. If is there anyone that would like to ask a question to Ms. Siti Hani Istiqomah and and Mr. Miza Fauzi from Zoom? No. Have you registered? Have you had registered your book leaflet to Haki or maybe something like PUI from our institution, Mrs. Siti Hani Istiqomah?
Yeah, I have Haki on the left, the lift the flap book. I have Haki.
Oh, I see. Thank you so much. It was very interesting topic. We have to continue to the next presenter. Thank you so much, Mrs. Siti Hani. And then the sixth one, yes, will be the glycemic index of Gayam, Inocarpus virfos cookies as a high dietary fiber food. The author are Mr. Agus Wijanarko, Nur T. Fauziah, A.N. Dewi, Lili Setianingsih, and Weni Mufitasari. Mr. Agus Wijanarko, have you joined with us? Maybe still muted. I'm sorry, we cannot hear your voice.
Okay, thank you.
Yes.
Thank you, Pak Uge.
Yes, it is audible.
Yes.
Could you please start your presentation, Mr. Agus?
Okay. Okay. I want to ask to the committee for us to share my slide. Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Salam sehat and good afternoon, ladies and gentlemen. I'm Agus Wijanarko from Polkesio. Today, I would like to present our paper entitled The Glycemic Index of Gayam Cookies as a High Dietary Fiber Food. The author of this paper are Ibu Nurti Fauziah, Mbak Lilis Suryaningsih, Mbak Weni Mufitasari, Mbak Anissa Nirmala Dewi, and me, Agus Wijanarko. The next slide. Sorry, the next slide.
Recording in progress.
Okay. First, we talk about Gayam.
Recording stopped.
Gayam, it has a number of local names, such as Gayam in Yogyakarta and Central Java. In Bali, Gatet in Java, Bosua, Boheng in North Sulawesi, and Ganyong in Maluku. Globally, Gayam has a number of use names in this several paper called Tahitian chestnut or Polynesian chestnut. Yeah. Gayam is underexploited and underutilized. Yeah. The material in the form of flour can be used as a basic ingredient for making cakes, making bread, or making cookies. Yeah. Gayam seed is a material that contains high dietary fiber. Categories high dietary fiber is 21%, yes, is 21%. We know that the dietary fiber is a material that cannot be absorbed in the small intestine and maybe fermented in the colon. Yeah. It was reported that dietary fiber have a full physiological effect, healthy effect, mainly including smart blues. And then consumption of the dietary fiber will have increased insulin sensitivity in the type 2 diabetes. According several authors, fiber content affect the glycemic index, GE, glycemic index glycemic. Yeah. Okay. This type of food has a low GE. Yeah. Gayam has high dietary fiber, and then gayam has low glycemic index. Okay. This kind of material can be used as a food to prevent diabetes. Food with a low glycemic index will have undergone digestion slowly. So that while the carbohydrate digestion and glucose absorption, absorption in the small intestine occurs slowly too. Okay. And then the next slide. My objective in this paper, this research, was to evaluate the nutrient composition, dietary fiber, and glycemic index of gayam cookies. This material, this product, this kind of product can be used as a food to prevent diabetes. Okay, the next. In the slide here, the material in my study, gayam seed were obtained from Pandak, Bantul, Yogyakarta. Okay, Bantul, Yogyakarta, Indonesia. And these are the characteristics from gayam. Yeah. And in laboratory analysis, we use enzyme and other chemical were analytical grade. Yeah. Okay, next. This slide shows some step of preparation of gayam brown. Yeah. From the raw material, then it is boiled unpeeled, tidak dikupas, tanpa kupas, ya, at 100 Celsius for 30 minutes. Okay. Actually, the step boiled unpeeled to eliminate the enzyme browning. After boiling process, the material are peeled, sliced, and dried in cabinet dryer. Then the material are graded and sieved into flour. Okay. Next. This slide show parameter and methods analysis of chemical properties, moisture, protein, fat, carbohydrate, and then analysis for dietary fiber use enzymatic method according ASP et al. And the next slide shows, and the next slide. The next slide, so there are several steps of glycemic index measurement according Marsono, Wollever, and Brown. The first step, volunteers were asked to fast for 10 hours, overnight fasting, except for butter. Yeah. 10% volunteer, 10% volunteer. In the morning, 50 microliter blood sample was taken using the finger prick capillary blood sample. Aku cek ya, like aku cek ya. The carbohydrate and content, dietary fiber content, so that the sample are at content total available carbohydrate equivalent to 50 gram of sugar. This is according Marsono, Bolivar, and Brown. Okay, and half an hour after the meal was finished, a blood sample was taken again, and the glucose level was measured. Blood sample were taken for every half hour until the second hour. Okay. The next slide. Okay. This is Gayam cookies. Use a mixture of wheat flour, tepung terigu, and Gayam flour, respectively 65% wheat flour and 35% Gayam flour. Well, all the main ingredients for control cookies use wheat flour. Additional ingredients for making cookies are butter, margarine, and sugar, egg yolks, water mix, and baking soda. Cookies are made by mixing ingredient and baking at 160 Celsius for 20 minutes. Cookies has sweet flavor and brown color. Okay. The next slide. Okay, and the result shows the chemical composition of wheat cookies and Gayam cookies. We can see that the chemical composition in Gayam cookies has higher total fiber. Okay. Gayam cookies has higher total fiber than wheat cookies and and several authors called the food of dietary and very high in dietary fiber if each contain 2 gram or 4 gram and 6 gram of dietary fiber per serving. These Gayam cookies are classified as high in dietary fiber. The next slide. The number of sample of cooking given to volunteer which between 87 and 91 gram. Sample with these weights were relatively realistic amount for consumption. Yeah. Then the number of sample of Gayam cookies equivalent to 50 gram of carbohydrate and have range 47 to 90 gram. Okay, the next slide. This slide shows change of the blood glucose level of the volunteer after consuming glucose, or reference foods. In this research, glucose used reference food and wheat cookies and sample Gayam cookies. We can see that as in the glucose response, it was seen that good cookies, wheat cookies and Gayam cookies had an increase in blood glucose level below in the standard glucose. Next, the glycemic index was calculated as the area of the curve for the increase in blood glucose level after consuming the glucose standard for food and test food. The next slide. Okay, according to Wollever, the classification of the glycemic index value of food using glucose standard, yes, is low glycemic index if under 55, medium if 55 to 69, and high glycemic index if upper 69. Cookies made from Gayam flour make the product high in dietary fiber and low glycemic index. Gayam cookies has dietary fiber, high dietary fiber and low glycemic index. And then Gayam cookies can be used as food to prevent type 2 diabetes. Cookies, we know cookies are also cookies which popular food and durable product food. Yes. Okay, the next slide. Okay. From the study, we can conclude the glycemic index of Gayam cookies is 43, and it's in the low glycemic index category. Gayam cookies have high dietary fiber content and low glycemic index, which can be used an alternative snacks in controlling blood glucose level to reduce the risk of diabetes or diabetic. The last point, it is necessary to conduct the further clinical research on type 2 diabetic or pre-diabetic patient is needed to evaluate the hypoglycemic effect of Gayam cookies. Okay, thank you very much for your attention. Terima kasih Pak Uki.
Thank you, Mr. Agus. I would like to give the time to the audience. Is there any question from audience? Maybe I would like to ask a question, Mr. Agus. What is the target from this product? I mean, is it for children or maybe for adult or elderly? Because this product is very, how can I say this, very important for change the basic material to create a product of food.
Okay, Pak Uki. Okay, like this, my product, Mas Uki, Pak Uki. Okay, and this is Gayam flour. Okay, Gayam flour. Target from products, usually cookies consume baby until adult. Okay, but diabetics or diabetes usually patient have 40 years or 30 years, upper. So my product targets for adult group. Okay, thank you, Mas.
Thank you so much, Mr. Agus. Because the limitation of time, I think we have to move to the next presenter. We have the analysis of anatomical characteristic in predicting difficult intubation according to the Wilson race, some in general anesthetic patient from Kania Ratna A and Justia Olfah, and also Tri Widyaningsih as the authors. To Mrs. Kania Ratna, have you joined with us?
Yes. Am I audible?
Yes, you're audible.
Okay. I would like to share my screen.
Okay.
Mm. Does my screen is already visible?
Not yet. Okay, now it is.
Okay. Can I start my presentation right now? Sir?
Yes, for
Sir?
sure.
Okay. Assalamualaikum warahmatullahi wabarakatuh. My name is Kania Ratna Rimbi, and as the representative of the following authors, today I would like to deliver my research entitled Analysis of Anatomical Characteristic in Predicting Difficult Intubation According to Wilson-Risk Sum in General Anesthetic Patients. First thing first, I would like to talk about the background of my research. As we all know that all of the anesthesia actions are greatly affect perioperative morbidity and mortality. Therefore, it is necessary to do the difficult airway management. The airway management itself can be conducted using a face mask, laryngeal mask airway or LMA, or endotracheal tube or ATT. But among of the following way that have been mentioned, endotracheal tube is chosen as the most safety way to do the airway management itself. As the American Society of Anesthesiologists, or we usually called with ASA, reported there are 70% of adverse events, with 85% of them causing death and brain damage, while 21 until 90% of them causing sore throat. The data about difficult intubation itself is actually still rare in Indonesia, and have been found in RSUP NGM, or the Rumah Sakit Umum Pusat Nasional Cipto Mangunkusumo. There are 61.4% difficult intubation occurred, while in the RSUD Penden Pekalongan, there are 64.1% occurred. Difficult intubation itself closely related to serious complications such as permanent brain damage, aspiration, hypoxia, and about 25 until 30% can cause mortality. So that's why in every pre-anesthesia assessment, it is necessary to carry it out and focusing on anatomical characteristic intubation. And in this research, I'm using Wilson-Risk Sum because it has sensitivity about 82.5%. My research method, the aim of this research is to determine the most difficult anatomical characteristic during intubation process in patients under general anesthesia. While the study design is, this is a descriptive study used cross-sectional design. The samples were taken using total sampling method and obtained about 45 samples in IBS RSUD Dr. Sudirman, Kebumen. And the instruments that we used in the study were observation seats, Wilson-Risk Sum table, and modification Malampati parameter as the gold standard of difficult intubation prediction. And the data were analyzed bivariately using percent chi-square and multivariately using logistic regression. And my study concept, there are independent variables such as weight, head and neck movement, jaw movement, receding mandible, and overbite. And there are dependent variable, which is modified Malampati, as I mentioned before, that this is the gold standard for the difficult intubation prediction. This research has received a statement of ethical feasibility for the Faculty of Nursing, Poltekkes Kemenkes Yogyakarta, with the following number. And the results of this research, first thing first is the frequency distribution. As we can see on the screen that there are about 45 patients undergoing the elective surgery program, about 80%, and while the 20% of them undergoing the CETO surgery program.
And the incidence of difficult intubation itself occurred about 26.7%. First, let's talk about the correlation of difficult intubation. The result of this study showing that weight has the effect on difficult intubation. And the results of this study are in accordance with the theory, according to Saminan, that overweight patients put additional burden on thorax and abdomen, which can accumulate the fat mass in the neck and which causes a short neck. In this study, majority of respondents who has the weight more than 90 kilograms tend to have the short neck and Mallampati score more than 3, which this can also affect the laryngoscopy visualization. As Wang stated on his research, that patients with Mallampati score more than 3 tend to have difficult laryngoscopy visualization, and patients who has BMI more than 25 tend to have difficult intubation. And the second result is the correlation between the neck and head movement to the difficult intubation. The results of this study showing that head and neck movement have a significant correlation in difficult intubation. Again, these results of this study are also in accordance with the theory of Kurniata, which stated that head and neck movement determine the difficult intubation. In this study, respondents' head and neck movement, where majority below than 90 degrees, will tend to have difficulty when doing sniffing position. The average respondent has a theomental and hyomental distance below than 5 centimeters. While Stetsky stated that short theomental distance will allow for difficult intubation, while the hyomental distance is very helpful in predicting difficult intubation. There are significant relationship between hyomental distance and difficult intubation. For the third result is the jaw movement in the effect of difficult intubation. The interincisor cap itself must be at least 5 centimeters to prevent difficult intubation. And in the study, according to the Pearson chi-square result, it showed that the jaw movement have a significant effect on difficult intubation. Majority of respondents were able to open their mouth below than 5 centimeters with subluxation is 0. Therefore, they were susceptible to have difficulty in laryngoscopy visualization process and tend to have obstacle when inserting the ethatam and lead. And this will lead to the difficult intubation. And the fourth results is about the correlation of receding mandible to difficult intubation. As stated on the many studies that protruding anatomy of maxillary anterior teeth can interfere with the laryngoscopy and ATT insertion process. Patients with a small mandible have a risk of airway obstruction because they tend to have large tongue size. But in this study, receding mandible doesn't have significant relation in the difficult intubation because the average respondent in the study who has moderate level of mandible can open their mouths more than 5 centimeters. And the last result is the correlation between overbite and difficult intubation. As Stetsky stated on the research that the more severe the degree of overbite means the more difficult it is to extend the mandible, which increases the difficulty of intubations from 10% up to 60%. Overbite has more than 85% accuracy in predicting difficult intubation. But in the study, overbite couldn't predict the difficult intubation because of the ULBT or the upper lip bite test is lack reliable, and also in patients in this respondent with moderate to severe overbite, we use a smaller plate of laryngoscopy. So that's why the the overbite itself doesn't have the significant correlation with difficult intubation. Moving to the multivariate analysis, the result of the logistic regression itself shown that the most influencing variable on intubation difficulty was body weight, body weight with the odd ratio 33.105. With the conclusion that difficult intubation is influenced by body weight, head and neck movement, and jaw movement. Patients with BMI more than 25 tend to have accumulation fat in their neck, which this also make it hard to do the sniffing position for laryngoscopy visualization. This will also affect the patient's inner incisor cap and causing difficult intubation to insert the entity. Therefore, it can be concluded that the most influencing factors of anatomy in predicting difficult intubation was body weight with the odd ratio 33.1. And the limitation of this research is the ULBD test itself. It's not really reliable because in Asia, we don't have a protruding maxilla like the European or the American people have it. That's why in the study, the overbite and the receding mandible itself doesn't have significant correlation with difficult intubation. That's all from me. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Mrs. Kania. I would like to give the time to audience. Are there any question from Ms. Kania? Okay, I think it is clear enough, Mrs. Kania. Ms. Kania. We have to continue our next session. Thank you so much for your presentation. The last one, we have Mrs. Nadia Saumi as an author. Her research is a reduce of a number of germs in the room air with red beetle leaf disinfectant. Miss Nadia, are you ready to present your presentation?
Yes, sir. Before we start, am I audible?
Yes, you are.
I will try share my screen. Am my screen visible? Sorry.
Yes, now it is visible.
So I will start my presentation now. Assalamualaikum warahmatullahi wabarakatuh. My name is Nadia and I'm from Polytechnic of Health Jambi. So today I'll be talking about the reduce the number of germs in the room air with red betel leaf disinfectant. In fact, they are more loyal with us than a lover. That is germs. Germs are basically known as a microscopic organism that can cause various types of disease in humans. They can live in everywhere, and one of them is in the air. Germs can affect the air quality in the environment. The more germs in the air will make the high potential to cause disease. There are many types of disease caused by germs in the air, and one example is COVID-19, which is currently a problem in Indonesia and also throughout the world. COVID-19 virus is known to spread through direct contact with sufferers, and it's also known that the virus is droplet, which means it can land on the objects contaminated with COVID-19 virus particle droplets by sufferers for some times. Efforts are being made to overcome this problem is by using disinfectant. However, the disinfectants that are often used by us is chemical-based disinfectants. And these chemical-based disinfectants can leave residues in the room, which can cause new problems in the environment. For the reason, the natural disinfectants, such as red betel leaf, are needed. So why we use the red betel leaf disinfectant? So the red betel leaf or Pipercoricatum contains phytochemical compounds such as essential oils, alkaloids, saponins, and tannins, and flavonoids. And other chemical constituents found in red betel leaf are hydroxycavical, cavical, and etc.
So this content known have antibacterial or antiviruses to can be applied to be a disinfectant. So the type of this research is a use a quasi-experimental design with one group pre-test post-test design, and also for the object in this research is microbes or the germs or the microorganism in the air room. And this research was carried out starting from planning, implementation until the end of the preparation, was held on November 16 until 33, 2020, and it's held at the Environmental Department of Health Polytechnic of Jambi. So this is the concept of this research. There are room air and will applied with red betel leaf extract with concentration 10% for room A and 20% for room B and 30% concentration of red betel leaf extract for room C. And the purpose or the final of this research is we know about the number of germs in the air after applied red betel leaf disinfectant. So this is the results of this examination of the number of germs in the air before disinfection. In the room A, we know there are 9.4 culture the bacteria, and also for the room B and room C. This is the result of the examination of the number of germs in the air after the disinfection with red betel leaf extract. So this is the result of this research. We know that there was a decrease in the number of germs in the air in the room with variations in concentrations. So for the concentration, 10% was applied at the room A, have the decrease of number of germs, 164 colony forming unit with the percentage 57%, and the p-value of t-test is 0.025, and for the concentration 20% red betel leaf extract was applied in the room B, have a decrease of number of germs in the room air is 142 colony forming unit with the percentage 58%, and the t-test for p-value of t-test is 0.025, and for the concentration 30% was applied in the room C, have a decreasing number of germs is 99 colony forming unit, and the percentage is 85%, and for the p-value of t-test is 0.001. So the antifungal power of these leaves may be due to the presence of alkaloid compounds, flavonoids, tannins, and essential oils. And alkaloids are active substances from plants that can be as a drugs and strong activators for immune cells that can destroy bacteria, viruses, fungi, and cancer cells, according to Olivia et al. 2004. And in addition, tannins from this red betel leaf play a role in the body's defense for antioxidant and antiseptic activity, according to Sirait and Mulyati research. So as antifungals, flavonoids have genistein compounds that function to inhibit cell division, and this compound binds to microtubule protein in cells and interferes with the mitotic, and so that some flavonoids are used by medicine for human. So that's all about my presentation about reducing the number of germs in the room air with red betel leaf extract. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, sir. Thank you very much for your presentation. It was very great presentation. I would like to give the time to the audience that maybe have a question. Please feel free to ask the question from Zoom meeting maybe? Okay. Is it easy to get the lift in Jambi? Is it in Jambi?
Yes, sir.
Yes. Is it easy to get the lift?
Get the leaf? Yes, of course. The leaf is found a lot in our college, and also it can be growth in everywhere like that. They can merambat in dinding, in the wall, and also it can grow easily.
I see. And also, what is the most important compound that that we can extract from the leaf and make it a specific compound that can disinfect it or clean all the bacteria or germs in the air from your discovery? May I know?
Okay, sir. Maybe for the important contents that can we use to kill or avoid the germs in the air as a disinfectant is such as alkaloid, flavonoid, saponins, tannins, and also the essential oils. And for some disinfectant are contain that content too for decomposition like that.
Thank you so much for your explanation. Okay,
Thank you,
I
sir.
think that's all for 8 participants. We are very glad and also very um, welcome to have you all in this seminar. So maybe that's all for me. I am Mr. Uki Wulanggita. I would like to give back the schedule to the Master of Ceremony. Thank you so much.
Ladies and gentlemen, after this we'll be having a break until 1:30 before we announce the best presenter, favorite presenter, and best participant. So let's begin our break. Every participant in the room is every participant in the room is able to enjoy your session right now. Thank you.
Halo teman-teman Nusantara, saya Muhammad Hafiz Ansari selaku perwakilan produk inovasi kesehatan dari Poltekkes Kemenkes Yogyakarta dalam Indo Health Fair tahun 2022 bersama rekan tim saya
Muhammad Burhanuddin, saya Bima Priyananda Nugraha,
saya Wahyu Adi Pertama.
Tuberkulosis atau TB telah menjadi permasalahan kesehatan di dunia. Berdasarkan WHO TB Report pada tahun 2020, Indonesia termasuk dalam 3 besar negara dengan kasus TB terbanyak di dunia setelah India dan Cina. Di Indonesia sendiri, kasus angka kematian akibat kasus TB mencapai 11 kematian per jamnya. Menurut Menteri Kesehatan Bapak Budi Gunadi Sadikin, mencanangkan agar Indonesia bebas dari kasus TB pada tahun 2030.
Kompetensi ATLM dalam pemeriksaan TB belum sepenuhnya memenuhi standar kompetensi dalam pemeriksaan. Hal ini disebabkan oleh minimnya sertifikasi yang berfokus pada pemeriksaan TB.
Padahal, menurut rekomendasi WHO, penegakan diagnosis TB harus dilakukan secara cepat dan tepat dengan berdasarkan pemeriksaan basil tahan asam atau BTA pada dada untuk menentukan langkah pengobatan.
ATSZN hadir menjadi inovasi baru instrumen laboratorium dengan konsep robotika yang bertujuan untuk menggantikan metode konvensional dalam pemeriksaan TB. ATSZN memiliki dimensi 95 x 45 x 38,5 cm dengan material ABS plastik plus dan akrilik. ATSZN terdiri dari beberapa bagian, diantaranya drying container, alcohol container, methylene blue container, carbofusion container, aqueous container, dan heater container. ATSZN berbasis microcontroller yang dikemas dalam satu kontrol panel dengan LCD, sehingga user dapat mengoperasikan alat ini dengan mudah. Inovasi heater container yang terintegrasi termostat, maka dapat membuka dinding lemak bakteri, sehingga badan bakteri akan menyerap cat warna dengan sempurna. Berikut langkah pengoperasian alat ATSZN. Pertama, hubungkan kabel power dengan listrik. Nyalakan alat ATSZN dengan menekan tombol power. Kedua, tuang ZNA, ZNB, ZNC, dan aquades pada kontainer hingga batas tera. Ketiga, abusan dahak yang sudah difiksasi diletakkan pada carrier object glass. Lalu pilih menu Start Staining pada layar display. Keempat, alat akan bekerja ketika aquades mencapai suhu 65 derajat Celcius. Jika proses pewarnaan telah selesai, maka alat akan mengeluarkan bunyi alarm dari buzzer. Kelima, proses pewarnaan telah selesai. Objek gelas dapat diambil dari carrier lalu dilakukan proses pengamatan menggunakan mikroskop dengan perbesaran 1000 kali. Pengamatan mikroskopis dapat dilakukan dengan mikroskop konvensional, mikroskop digital, dan adapter yang telah peneliti buat.
Kami sangat mendorong dan memfasilitasi serta menjadi pembangkit lahirnya produk-produk inovasi mahasiswa One Student, One Product untuk masyarakat, untuk program-program bidang kesehatan.
Saya mengucapkan selamat kepada Mas Burhan, Mas Wahyu, Mas Hafiz, Mas Bima atas keberhasilannya menyusun, membuat, dan menciptakan alat sebagai penunjang diagnostik TB.
Menjadi bagian dalam eliminasi TB di Indonesia merupakan ibadah yang tak terhingga.
Dari Jogja untuk Indonesia.
Halo teman-teman semua, kenalin, ini Niko, mahasiswa Poltekkes Kemenkes Yogyakarta. Sebagai anak muda penerus bangsa, Niko selalu menjaga kesehatannya, tentu saja PHBS, caranya, perilaku, hidup bersih, dan sehat. Nah, hari ini Niko ingin berbagi cerita tentang kesehariannya. Sebelum beraktivitas, Niko selalu mencuci tangannya dengan sabun dan air mengalir. Berikut ini 6 langkah mencuci tangan. Langkah yang pertama, basahi tangan dengan air mengalir, lalu ratakan sabun ke telapak tangan. Langkah yang kedua, gosok punggung tangan dan sela-sela jari. Langkah yang ketiga, gosok punggung jari kedua tangan dengan posisi tangan saling mengunci. Yang keempat, gosok ibu jari dengan memutar dalam genggaman. Nah, yang terakhir, usap ujung kuku tangan dengan diputar di telapak tangan, kemudian bersih deh. Setelah mencuci tangan, Niko mengonsumsi buah-buahan. Karena buah-buahan mengandung banyak vitamin, mineral, dan serat yang dibutuhkan oleh tubuh kita. Bahkan, buah-buahan sangat disarankan untuk dikonsumsi setiap hari. Nah, aktivitas selanjutnya adalah bersepeda. Dengan berolahraga, tubuh kita akan terasa lebih baik. Olahraga juga menjaga kekebalan tubuh kita. Tapi jangan lupa, keamanan tetap yang utama ya. Aduh, capek juga ya. Langsung aja deh, minum air putih agar tubuh tetap terhidrasi. Nggak perlu banyak-banyak kok, cukup 2 liter per hari. Loh, Niko, stop. Ayam Bangkok, ayam Jawa. Dua-duanya dimakan buaya.
Cakep.
Stop rokok, hindari nafsa. Dua-duanya nggak ada gunanya. Aktivitas terakhir, tapi tak kalah penting, yaitu istirahat yang cukup, minimal 7-8 jam per hari. Dengan durasi istirahat yang cukup, tubuh kita akan segar kembali dan siap melakukan aktivitas yang telah menanti. Halo, gimana? Terlihat susah ya? Tapi, dengan tekad dan konsistensi, lama-kelamaan akan menjadi kebiasaan kita dalam sehari-hari. Negara kita membutuhkan sosok anak muda yang dapat berkontribusi dalam memajukan negara, meski dengan cara yang sederhana. Akhir kata, saya mengajak teman-teman semua untuk menjadi anak muda penerus bangsa yang berguna bagi Indonesia.
Polytechnic Manado is being presented as professional medical personnel education institution, which formed based on Ministry of Health and Social Welfare, Decree number 290, 8 from April 16, 2001. Based on the assessment of National Accreditation Body for Higher Education or BANPT, Health Polytechnic Manado has successfully achieved B accreditation according to Decree number 206 of 2020. The assignation of Health Polytechnic Manado by Ministry of Health as the government agency that applies the Public Service Agency's financial management pattern has been registered according to Ministry of Finance's Decree number 399 of 2019. At this time, Health Polytechnic Manado has 7 majors, consists of 13 study programs that have been accredited by Indonesian Accreditation Agency for Higher Education in Health or LAMPTKS, such as Nursing Department, Environmental Health Department, Nutritional Science Department, Midwifery Department, Pharmacy Department, Dental Health Department, and Medical Laboratory Technology Department. Nursing Department consists of 4 study programs that has been accredited by LAMPTKS, such as Nurse Study Program, a 4-year Diploma Nursing Study Program, 3-year Diploma Nursing Study Program, and a 4-year Diploma Health Promotion Study Program. 4 study programs in Nursing Department excel in their own respective field. Nurse Study Program and a 4-year Diploma Nursing Study Program excel in Emergency Unit Nursing. A 3-year Diploma Nursing Study Program excels in Cardiovascular Emergency Unit Nursing, and a 4-year Diploma Health Promotion Study Program excels in Health Behavior and Promotion. Environmental Health Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Environmental Sanitation Study Program and a 3-year Diploma Sanitation Study Program. 2 study programs in Environmental Health Department excel in their own respective field. A 4-year Diploma Environmental Sanitation Study Program excels in Vector Control and Waste Management. The 3-year Diploma Sanitation Study Program excels in Vector Control and Liquid Waste Management. Nutritional Science Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Nutrition and Dietetics Study Program and a 3-year Diploma Nutrition Study Program. 2 study programs in Nutritional Science Department excel in their own respective field. A 4-year Diploma Nutrition and Dietetics Study Program excels in Utilization of Local Food and Nutrition Intervention Management, and a 3-year Diploma Nutrition Study Program excels in Food Science Technology. Midwifery Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Midwifery Study Program and a 3-year Diploma Midwifery Study Program. 2 study programs in Midwifery Department excel in their own respective field. A 4-year Diploma Midwifery Study Program excels in Quality Midwifery Care in the midst of crisis and emergency management. A 3-year Diploma Midwifery Study Program excels in Local Culture Innovation in Midwifery Services. Pharmacy Department has 1 study program, which is a 3-year Diploma Pharmacy Study Program that excels in Traditional Medicine and Pharmaceutical Service. Dental Health Department has 1 study program, which is a 3-year Diploma Dental Health Study Program that excels in Preventive Oral Health Care and Health Promotion. Medical Laboratory Technology Department has 1 study program, which excels in Lung Tuberculosis Diagnostic and Comorbidities. All those 3 study programs also have been accredited by LAMPTKS. Based on data from the last 3 years, the total of students applying for Health Polytechnic Manado is 11,463 students. Consists of 9,155 applicants for a 3-year diploma study program and 2,308 applicants for a 4-year diploma study program. Now, the total number of students since 2018 until 2020 is 7,341, which consists of Nursing Department 1,763 students, Environmental Health Department 1,231 students, Nutritional Science Department 1,179 students, Midwifery Department 1,148 students, Pharmacy Department 653 students, Dental Health Department 568 students, and Medical Laboratory Technology Department 773. Number of lecturers at Health Polytechnic Manado is 109 people with master and doctoral degree from well-known universities both in country and abroad. Furthermore, the human resources of Health Polytechnic Manado is powered by instructor, librarian, and administration staff. In providing education with good quality, Health Polytechnic Manado is located in 3 strategic locations, which Campus A located at Jalan RW Monginsidi, Malalayang 2, Manado, Campus B located at Jalan Parigi 7, nomor 22, Malalayang 1, and Campus C located at Jalan Manguni 20, Kelurahan Malende. Implementing its activities, the departments are managed by Directorate Management, which led collectively by Director, Director of Academics, Director of Finance, General Staff and Administration, and Director of Students Affairs and Cooperation. For the sake of convenience and continuity of teaching and learning process, Health Polytechnic Manado provides representative facilities and infrastructures. The supporting facilities provided are classes, laboratory, workshop, technical implementers unit of health services, discussion room, library, auditorium, and an information system, Siakat Cloud, which integrated with MLS Edlink, journal portal that has been accredited by DICTI. Let's join Health Polytechnic Manado, and together we make Health Polytechnic Manado as an excellent, independent, and cultural vocational health education institution.
Indonesia, known as Nusantara, consists of thousands of tribal islands and millions of diversity, bring millions of hopes and dreams. Here is the place where passion and hopes meet from across the archipelago to nourish the nation. Politeknik Kesehatan Kementerian Kesehatan Yogyakarta, established in 2001, is a fusion of 6 health academies in Yogyakarta, establishing itself as the leading college of health workers in Indonesia. Politeknik Kesehatan Kemenkes Yogyakarta, or Polkesyo, is a state university under the Ministry of Health, known as university that upholds cultural values, nationality, and upholds diversity and prioritize the interests of the nation. Paul Casio, with various works and achievements, we have proven ourselves to always serve tirelessly to produce competent health workers who can carry out their professional performance to make the healthy nation. Paul Casio, which is located in the special region of Yogyakarta, or referred to as a student city, creates a learning climate and academic atmosphere that supports student achievement. Paul Casio continues to grow and develop to become the leading, best health college in Indonesia, and aspires to be global by cultivating, implementing, and utilizing education, research, and community service, which are the main goals of higher education in Indonesia, or the Tridharma of higher education, by always being guided by Pancasila values. We carry out education, conduct research, and provide community service by improving science and technology in health sector that is beneficial to society, nation, and state. This is where the nation's best sons and daughters from various backgrounds and variations are given the widest opportunity to gather and build an intellectual community to solve health problems in Indonesia. By mutually enriching the repertoire of knowledge and human values, exploring knowledge from history, processing today, and researching for the future. Paul Casio has 6 departments and 17 study programs, namely Diploma 3, Applied Bachelor, and Professional Education. Supported by 1 professor and more than 149 lecturers who have experience teaching and research in various disciplines of health science and technology, and support from education staff. Paul Casio always develops quality education processes, which national and international standards, producing graduates with global competitiveness. To support competence, knowledge, skills, and attitudes of students, Paul Casio provides various laboratories with sophisticated and modern equipment and technology, so that a strong research culture continues to develop, marked by various innovative discoveries that are useful for society. Paul Casio has pioneered and developed the Science Techno Campus as a manifestation of its ability to create and commercialize various innovative health technology products. As support for conductive learning, in addition to other facilities and infrastructure, Paul Casio has established itself as a healthy campus by creating a green campus that is comfortable, environmentally friendly, and pollution-free with a well-maintained layout. The various existing facilities support the development of student talents through student activity units and are encouraged to realize their dreams. To improve services to the community, Paul Casio is given flexibility in financial management based on the economic and productivity principles and the application of sound business practices by establishing it as a public service agency work unit in 2011. Paul Casio has been given the title of corruption-free area as a manifestation that Paul Casio has met most of the criteria in implementing the 6 areas of reform of the bureaucratic reform program and has been able to prevent corruption, collusion, and nepotism. To provide quality assurance and quality control of education, as well as improve the competitiveness of graduates, Paul Casio has received accreditation recognition both from the government through BAN PT The year 2020 is the toughest year for all countries in the world and has an impact on the joints of life, including educational activities. All the face-to-face learning activities must be stopped, student activities cancelled, and people work and worship from home. The world of education has no other choice so that learning can run effectively, namely by making maximum use of information technology. The utilization and development of information technology is a necessity for Paul Casio by adding supporting facilities by continuously adapting and creating online learning applications. As part of the Ministry of Health, Paul Casio is required to participate in efforts to overcome the COVID-19 pandemic by participating directly, forming an officer unit, conducting training for health workers, becoming a vaccination center, and deploying health volunteers. Various challenges that occurred have led Paul Casio to continue to innovate and change the mindset to maximize information technology for optimal development facilities. This is in the line with the strategy carried out by the Ministry of Health by making efforts for Digital Health Transformation 2024. Success is a journey that requires hard work, smart work, and thorough work, together embracing all potential and diversity into energy for the future for the progress of the nation, country, and the world. Poltekkes Kemenkes Yogyakarta. Together, we are ready to transform to heal the country. Paul Casio, excellent, cultured, and worldwide.
Halo teman-teman Nusantara, saya Muhammad Hafiz Ansari selaku perwakilan produk inovasi kesehatan dari Poltekkes Kemenkes Yogyakarta dalam Indo Health Fair tahun 2022 bersama rekan tim saya
Muhammad Burhanuddin,
saya Bima Priyananda Nugraha,
saya Wahyu Adi Pertama.
Tuberkulosis atau TB telah menjadi permasalahan kesehatan di dunia. Berdasarkan WHO TB Report pada tahun 2020, Indonesia termasuk dalam 3 besar negara dengan kasus TB terbanyak di dunia setelah India dan Cina. Di Indonesia sendiri, kasus angka kematian akibat kasus TB mencapai 11 kematian per jamnya. Menurut Menteri Kesehatan Bapak Budi Gunadi Sadikin, mencanangkan agar Indonesia bebas dari kasus TB pada tahun 2030.
Kompetensi ATLM dalam pemeriksaan TB belum sepenuhnya memenuhi standar kompetensi dalam pemeriksaan. Hal ini disebabkan oleh minimnya sertifikasi yang berfokus pada pemeriksaan TB.
Padahal menurut rekomendasi WHO, penegakan diagnosis TB harus dilakukan secara cepat dan tepat dengan berdasarkan pemeriksaan basil tahan asam atau BTA pada dada untuk menentukan langkah pengobatan.
ATSZN hadir menjadi inovasi baru instrumen laboratorium dengan konsep robotika yang bertujuan untuk menggantikan metode konvensional dalam pemeriksaan TB. ATSZN memiliki dimensi 95 x 45 x 38,5 cm dengan material ABS plastik plus dan akrilik. ATSZN terdiri dari beberapa bagian, diantaranya drying container, alcohol container, methylene blue container, carbofuscin container, aqueous container, dan heater container. ATSZN berbasis microcontroller yang dikemas dalam satu kontrol panel dengan LCD, sehingga user dapat mengoperasikan alat ini dengan mudah. Inovasi heater container yang terintegrasi termostat, maka dapat membuka dinding lemak bakteri, sehingga badan bakteri akan menyerap cat warna dengan sempurna. Berikut langkah pengoperasian alat ATSZN. Pertama, hubungkan kabel power dengan listrik. Nyalakan alat ATSZN dengan menekan tombol power. Kedua, tuang ZNA, ZNB, ZNC, dan aquades pada kontainer hingga batas tera. Ketiga, abusan dahak yang sudah difiksasi diletakkan pada carrier object glass.
lalu pilih menu Start Staining pada layar display. Keempat, alat akan bekerja ketika Aquades mencapai suhu 65 derajat Celcius. Jika proses pewarnaan telah selesai, maka alat akan mengeluarkan bunyi alarm dari buzzer. Kelima, proses pewarnaan telah selesai. Objek gelas dapat diambil dari carrier lalu dilakukan proses pengamatan menggunakan mikroskop dengan perbesaran 1000 kali. Pengamatan mikroskopis dapat dilakukan dengan mikroskop konvensional, mikroskop digital, dan adapter yang telah peneliti buat.
Kami sangat mendorong dan memfasilitasi serta menjadi pembangkit lahirnya produk-produk inovasi mahasiswa One Student, One Product untuk masyarakat, untuk program-program bidang kesehatan.
Saya mengucapkan selamat kepada Mas Burhan, Mas Wahyu, Mas Hafiz, Mas Bima atas keberhasilannya menyusun, membuat, dan menciptakan alat bagi penunjang diagnostik TB.
Menjadi bagian dalam eliminasi TB di Indonesia merupakan ibadah yang tak terhingga.
Dari Jogja untuk Indonesia.
Halo teman-teman semua, kenalin, ini Niko, mahasiswa Poltekkes Kemenkes Yogyakarta. Sebagai anak muda penerus bangsa, Niko selalu menjaga kesehatannya, tentu saja PHBS, caranya, perilaku, hidup bersih, dan sehat. Nah, hari ini Niko ingin berbagi cerita tentang kesehariannya. Sebelum beraktivitas, Niko selalu mencuci tangannya dengan sabun dan air mengalir. Berikut ini 6 langkah mencuci tangan. Langkah yang pertama, basahi tangan dengan air mengalir, lalu ratakan sabun ke telapak tangan. Langkah yang kedua, gosok punggung tangan dan sela-sela jari. Langkah yang ketiga, gosok punggung jari kedua tangan dengan posisi tangan saling mengunci. Yang keempat, gosok ibu jari dengan memutar dalam genggaman. Nah, yang terakhir, usap ujung kuku tangan dengan diputar di telapak tangan, kemudian bersih deh. Setelah mencuci tangan, Niko mengonsumsi buah-buahan. Karena buah-buahan mengandung banyak vitamin, mineral, dan serat yang dibutuhkan oleh tubuh kita. Bahkan, buah-buahan sangat disarankan untuk dikonsumsi setiap hari. Nah, aktivitas selanjutnya adalah bersepeda. Dengan berolahraga, tubuh kita akan terasa lebih baik. Olahraga juga menjaga kekebalan tubuh kita. Tapi jangan lupa, keamanan tetap yang utama ya. Aduh, capek juga ya. Langsung aja deh, minum air putih agar tubuh tetap terhidrasi. Nggak perlu banyak-banyak kok, cukup 2 liter per hari. Loh, Niko, stop. Ayam Bangkok, ayam Jawa. Dua-duanya dimakan buaya.
Cakep.
Stop rokok, hindari nafsa. Dua-duanya gak ada gunanya. Aktivitas terakhir, tapi tak kalah penting yaitu istirahat yang cukup. Minimal 7-8 jam per hari. Dengan durasi istirahat yang cukup, tubuh kita akan segar kembali dan siap melakukan aktivitas yang telah menanti. Halo, gimana? Terlihat susah ya? Tapi, dengan tekad dan konsistensi, lama-kelamaan akan menjadi kebiasaan kita dalam sehari-hari. Negara kita membutuhkan sosok anak muda yang dapat berkontribusi dalam memajukan negara. Meski dengan cara yang sederhana. Akhir kata, saya mengajak teman-teman semua untuk menjadi anak muda penerus bangsa yang berguna bagi Indonesia.
Polytechnic Manado is being presented as professional medical personnel education institution, which formed based on Ministry of Health and Social Welfare, Decree number 290, 8 from April 16, 2001. Based on the assessment of National Accreditation Body for Higher Education or BANPT, Health Polytechnic Manado has successfully achieved B accreditation according to Decree number 206 of 2020. The assignation of Health Polytechnic Manado by Ministry of Health as the government agency that applies the Public Service Agency's financial management pattern has been registered according to Ministry of Finance's Decree number 399 of 2019. At this time, Health Polytechnic Manado has 7 majors, consists of 13 study programs that have been accredited by Indonesian Accreditation Agency for Higher Education in Health or LAMPTKS, such as Nursing Department, Environmental Health Department, Nutritional Science Department, Midwifery Department, Pharmacy Department, Dental Health Department, and Medical Laboratory Technology Department. Nursing Department consists of 4 study programs that has been accredited by LAMPTKS, such as Nurse Study Program, a 4-year Diploma Nursing Study Program, 3-year Diploma Nursing Study Program, and a 4-year Diploma Health Promotion Study Program. 4 study programs in Nursing Department excel in their own respective field. Nurse Study Program and a 4-year Diploma Nursing Study Program excel in Emergency Unit Nursing. A 3-year Diploma Nursing Study Program excels in Cardiovascular Emergency Unit Nursing, and a 4-year Diploma Health Promotion Study Program excels in Health Behavior and Promotion. Environmental Health Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Environmental Sanitation Study Program and a 3-year Diploma Sanitation Study Program. 2 study programs in Environmental Health Department excel in their own respective field. A 4-year Diploma Environmental Sanitation Study Program excels in Vector Control and Waste Management. The 3-year Diploma Sanitation Study Program excels in Vector Control and Liquid Waste Management. Nutritional Science Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Nutrition and Dietetics Study Program and a 3-year Diploma Nutrition Study Program. 2 study programs in Nutritional Science Department excel in their own respective field. A 4-year Diploma Nutrition and Dietetics Study Program excels in utilization of local food and nutrition intervention management, and a 3-year Diploma Nutrition Study Program excels in food science technology. Midwifery Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Midwifery Study Program and a 3-year Diploma Midwifery Study Program. 2 study programs in Midwifery Department excel in their own respective field. A 4-year Diploma Midwifery Study Program excels in quality midwifery care in the midst of crisis and emergency management. A 3-year Diploma Midwifery Study Program excels in local culture innovation in midwifery services. Pharmacy Department has 1 study program, which is a 3-year Diploma Pharmacy Study Program that excels in traditional medicine and pharmaceutical service. Dental Health Department has 1 study program, which is a 3-year Diploma Dental Health Study Program that excels in preventive oral health care and health promotion. Medical Laboratory Technology Department has 1 study program, which excels in lung tuberculosis diagnostic and comorbidities. All those 3 study programs also have been accredited by LAMPTKS. Based on data from the last 3 years, the total of students applying for Health Polytechnic Manado is 11,463 students. Consists of 9,155 applicants for a 3-year Diploma Study Program and 2,308 applicants for a 4-year Diploma Study Program. Now, the total number of students since 2018 until 2020 is 7,341, which consists of Nursing Department 1,763 students, Environmental Health Department 1,231 students, Nutritional Science Department 1,179 students, Midwifery Department 1,148 students, Pharmacy Department 653 students, Dental Health Department 568 students, and Medical Laboratory Technology Department 773. Number of lecturers at Health Polytechnic Manado is 109 people with master and doctoral degree from well-known universities both in country and abroad. Furthermore, the human resources of Health Polytechnic Manado is powered by instructor, librarian, and administration staff. In providing education with good quality, Health Polytechnic Manado is located in 3 strategic locations, which Campus A located at Jalan RW Monginsidi, Malalayang 2, Manado, Campus B located at Jalan Parigi 7, nomor 22, Malalayang 1, and Campus C located at Jalan Manguni 20, Kelurahan Malende. Implementing its activities, the departments are managed by Directorate Management, which led collectively by Director, Director of Academics, Director of Finance, General Staff and Administration, and Director of Students Affairs and Cooperation. For the sake of convenience and continuity of teaching and learning process, Health Polytechnic Manado provides representative facilities and infrastructures. The supporting facilities provided are classes, laboratory, workshop, technical implementers unit of health services, discussion room, library, auditorium, and an information system, Siakat Cloud, which integrated with MLS Edlink, journal portal that has been accredited by Dikti. Let's join Health Polytechnic Manado, and together we make Health Polytechnic Manado as an excellent, independent, and cultural vocational health education institution.
Indonesia, known as Nusantara, consists of thousands of tribal islands and millions of diversity, bring millions of hopes and dreams. Here is the place where passion and hopes meet from across the archipelago. To nourish the nation. Politeknik Kesehatan Kementerian Kesehatan Yogyakarta, established in 2001, is a fusion of 6 health academies in Yogyakarta, establishing itself as the leading college of health workers in Indonesia. Politeknik Kesehatan Kemenkes Yogyakarta, or Polkesyo, is a state university under the Ministry of Health, known as University that upholds cultural values, nationality, and upholds diversity and prioritize the interests of the nation. Paul Casio, with various works and achievements, we have proven ourselves to always serve tirelessly to produce competent health workers who can carry out their professional performance to make the healthy nation. Paul Casio, which is located in the special region of Yogyakarta, or referred to as a student city, creates learning.
Thank you to all participants for keep staying on the main room. Ladies and gentlemen, now we come to the last session of the 9th International Conference on Health and Sciences, the closing ceremony, live from Grand Chokro Hotel, Yogyakarta. Before we start it, we would like to inform you the agenda of this closing ceremony. First, the announcement of the best presenters, favorite presenters, and best participant. And second, closing speech and officially closing of the 9th International Conference on Health Sciences from the Vice Director on Academic, Health Polytechnic, Ministry of Health, Yogyakarta.
Ladies and gentlemen, the 2 days conference has arrived at the last moment. We have learned and participated in the serious but joyful part of the event. To appreciate what the participant and the presenter contribute to the success of the conference, we would like to announce the best presenter, the best favorite presenter, and the best participants. Please welcome our General Chairman of the committee, Dr. Agus Karmayana Rubaya, to announce the winner.
Assalamualaikum warahmatullahi wabarakatuh. Thanks God, finally, after 2 days full academic atmosphere, we come to the end of our conference, the 9th International Conference on Health Sciences. So as has been mentioned by the Master of Ceremonies, we are the committee, appreciate your involvement, so we will give some awards to some of you. We will start from the best participant. So, the best participant, all the awards is taken from each breakout room. So, the best participant goes to, the first one is Dismo Katiandago. And the second is Rifki Pasha Wisnuwardana. And the third one, is Tiara Cahyadini Siva. And for favorite presenter, For first presenter, the award goes to the first one, Bahrul Ilmi, and then also goes to Juliet Tangka. Yeah, and the third goes to Dionysius S. Also to Evi Marlinda. And also congratulate to Heni Puji Wahyuningsih. And the last one for the category the best presenter, the award goes to, the first one is for Ari Kusuma. The second one goes to Kania Ratna Arimbi. The third one goes to Evi Marlinda. The fourth to Lale Budi KD. And the last one goes to Naris Dia Prastiawati. So congratulations for all the awardees. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Dr. Rubaya, for the announcement, and congratulations for the best and favorite participant and presenters.
Ladies and gentlemen, it is time for the speech and officially closing of the conference by Dr. Heni Puji Wahyuningsih, SSIT MKEP, the Vice Director of Academic of Health Polytechnic, Ministry of Health Yogyakarta. Dr. Heni Puji Wahyuningsih, please come to the podium.
Assalamualaikum warahmatullahi wabarakatuh. The Honorable all of the speakers, co-hosts, participants, and committed member of the 9th International Conference on Health and Science 2022 of the Polytechnic of Health of Yogyakarta. Thank you very much for your participation, attention, and all of the support for the international conference that we held annually. We are very happy for the presence of invited guests and hundreds of participants from several countries to the conference that this year STEM, innovation and applied technology for the acceleration of health transformation. We hope this academic activity contributes and takes part to the implementation of health transformation launched by the Ministry of Health of Indonesia. Also, we as an educational institution can move one step forward to achieve our vision, namely excellent culture and worldwide. And hopefully among the all health polytechnics in Indonesia. We can place ourselves as one of the role models for the development of health science. We really hope that by this ICHS we can share to each other our experiences, enhance our knowledge, and can contribute to a better health condition. We also look forward for another collaboration or partnership in the future. Thus, the 9th International Conference on Health and Science 2022, we formally close with a great gratitude to the Almighty God. And finally, thank you and see you again in the 10th International Conference on Health Science in the next year. Billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Dr. Heni Puji Wahyuningsi, for the remarkable speech.
Ladies and gentlemen, again, we remind you that the certificate of participant who registered through the website can be received and downloaded through the Serpo Poltekkes Yogyakarta starting on November 4, 2022. Meanwhile, book of abstract can be downloaded at https://s.id/BOA_ICHS 2022.
Ladies and gentlemen, we do thank for being great partners and participants during the event. Wish you a wonderful time. I'm Raihan and my partner
Nilam Pratiwi
from Grand Cokro Hotel Yogyakarta. Thank you very much and see you on the next International Conference on Health and Sciences. Wassalamualaikum warahmatullahi wabarakatuh.
Polytechnic Manado is being presented as professional medical personnel education institution, which formed based on Ministry of Health and Social Welfare, Decree number 290, 8 from April 16, 2001. Based on the assessment of National Accreditation Body for Higher Education or BANPT, Health Polytechnic Manado has successfully achieved B accreditation according to Decree number 206 of 2020. The assignation of Health Polytechnic Manado by Ministry of Health as the government agency that applies the Public Service Agency's financial management pattern has been registered according to Ministry of Finance's Decree number 399 of 2019. At this time, Health Polytechnic Manado has 7 majors, consists of 13 study programs that have been accredited by Indonesian Accreditation Agency for Higher Education in Health or LAMPTKS, such as Nursing Department, Environmental Health Department, Nutritional Science Department, Midwifery Department, Pharmacy Department, Dental Health Department, and Medical Laboratory Technology Department. Nursing Department consists of 4 study programs that has been accredited by LAMPTKS, such as Nurse Study Program, a 4-year Diploma Nursing Study Program, 3-year Diploma Nursing Study Program, and a 4-year Diploma Health Promotion Study Program. 4 study programs in Nursing Department excel in their own respective field. Nurse Study Program and a 4-year Diploma Nursing Study Program excel in Emergency Unit Nursing. A 3-year Diploma Nursing Study Program excels in Cardiovascular Emergency Unit Nursing, and a 4-year Diploma Health Promotion Study Program excels in Health Behavior and Promotion. Environmental Health Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Environmental Sanitation Study Program and a 3-year Diploma Sanitation Study Program. 2 study programs in Environmental Health Department excel in their own respective field. A 4-year Diploma Environmental Sanitation Study Program excels in Vector Control and Waste Management. The 3-year Diploma Sanitation Study Program excels in Vector Control and Liquid Waste Management. Nutritional Science Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Nutrition and Dietetics Study Program and a 3-year Diploma Nutrition Study Program. 2 study programs in Nutritional Science Department excel in their own respective field. A 4-year Diploma Nutrition and Dietetics Study Program excels in utilization of local food and nutrition intervention management, and a 3-year Diploma Nutrition Study Program excels in food science technology. Midwifery Department consists of 2 study programs that has been accredited by LAMPTKS, such as a 4-year Diploma Midwifery Study Program and a 3-year Diploma Midwifery Study Program. 2 study programs in Midwifery Department excel in their own respective field. A 4-year Diploma Midwifery Study Program excels in quality midwifery care in the midst of crisis and emergency management. A 3-year Diploma Midwifery Study Program excels in local culture innovation in midwifery services. Pharmacy Department has 1 study program, which is a 3-year Diploma Pharmacy Study Program that excels in traditional medicine and pharmaceutical service. Dental Health Department has 1 study program, which is a 3-year Diploma Dental Health Study Program that excels in preventive oral health care and health promotion. Medical Laboratory Technology Department has 1 study program, which excels in lung tuberculosis diagnostic and comorbidities. All those 3 study programs also have been accredited by LAMPTKS. Based on data from the last 3 years, the total of students applying for Health Polytechnic Manado is 11,463 students. Consists of 9,155 applicants for a 3-year diploma study program and 2,308 applicants for a 4-year diploma study program. Now, the total number of students since 2018 until 2020 is 7,341, which consists of Nursing Department 1,763 students, Environmental Health Department 1,231 students, Nutritional Science Department 1,179 students, Midwifery Department 1,148 students, Pharmacy Department 653 students, Dental Health Department 568 students, and Medical Laboratory Technology Department 773. Number of lecturers at Health Polytechnic Manado is 109 people with master and doctoral degree from well-known universities both in country and abroad. Furthermore, the human resources of Health Polytechnic Manado is powered by instructor, librarian, and administration staff. In providing education with good quality, Health Polytechnic Manado is located in 3 strategic locations, which Campus A located at Jalan RW Monginsidi, Malalayang 2, Manado, Campus B located at Jalan Parigi 7, nomor 22, Malalayang 1, and Campus C located at Jalan Manguni 20, Kelurahan Malende. Implementing its activities, the departments are managed by Directorate Management, which led collectively by Director, Director of Academics, Director of Finance, General Staff and Administration, and Director of Students Affairs and Cooperation. For the sake of convenience and continuity of teaching and learning process, Health Polytechnic Manado provides representative facilities and infrastructures. The supporting facilities provided are classes, laboratory, workshop, technical implementers unit of health services, discussion room, library, auditorium, and an information system, Siakat Cloud, which integrated with MLS Edlink, journal portal that has been accredited by Dikti. Let's join Health Polytechnic Manado, and together we make Health Polytechnic Manado as an excellent, independent, and cultural vocational health education institution.
Indonesia, known as Nusantara, consists of thousands of tribal islands and millions of diversity, bring millions of hopes and dreams. Here is the place where passion and hopes meet from across the archipelago to nourish the nation. Politeknik Kesehatan Kementerian Kesehatan Yogyakarta, established in 2001, is a fusion of 6 health academies in Yogyakarta, establishing itself as the leading college of health workers in Indonesia. Politeknik Kesehatan Kemenkes Yogyakarta or Polkesyo is a state university under the Ministry of Health known as university that upholds cultural values, nationality, and upholds diversity and prioritizes the interests of the nation. Polkesyo, with various works and achievements, we have proven ourselves to always serve tirelessly to produce competent health workers who can carry out their professional performance to make the healthy nation. Polkesyo, which is located in the special region of Yogyakarta, or referred to as a student city, creates a learning climate and academic atmosphere that supports student achievement. Polkesyo continues to grow and develop to become the leading, best health college in Indonesia, and aspires to be global by cultivating, implementing, and utilizing education, research, and community service, which are the main goals of higher education in Indonesia, or the Tridharma of higher education, by always being guided by Pancasila values. We carry out education, conduct research, and provide community service by improving science and technology in health sector that is beneficial to society, nation, and state. This is where the nation's best sons and daughters from various backgrounds and variations are given the widest opportunity to gather and build an intellectual community to solve health problems in Indonesia. By mutually enriching the repertoire of knowledge and human values, exploring knowledge from history, processing today, and researching for the future. Polkesyo has 6 departments and 17 study programs, namely Diploma 3, Applied Bachelor, and Professional Education. Supported by 1 professor and more than 149 lecturers who have experience teaching and research in various disciplines of health science and technology, and support from education staff. Polkesyo always develops quality education processes, which national and international standards, producing graduates with global competitiveness. To support competence, knowledge, skills, and attitudes of students, Polkesyo provides various laboratories with sophisticated and modern equipment and technology, so that a strong research culture continues to develop, marked by various innovative discoveries that are useful for society. Polkesyo has pioneered and developed the Science Techno Campus as a manifestation of its ability to create and commercialize various innovative health technology products. As support for conductive learning, in addition to other facilities and infrastructure, Polkesyo has established itself as a healthy campus by creating a green campus that is comfortable, environmentally friendly, and pollution-free with a well-maintained layout. The various existing facilities support the development of student talents through student activity units and are encouraged to realize their dreams. To improve services to the community, Polkesyo is given flexibility in financial management based on the economic and productivity principles and the application of sound business practices by establishing it as a public service agency work unit in 2011. Polkesyo has been given the title of corruption-free area as a manifestation that Polkesyo has met most of the criteria in implementing the 6 areas of reform of the bureaucratic reform program and has been able to prevent corruption, collusion, and nepotism. To provide quality assurance and quality control of education, as well as improve the competitiveness of graduates, Polkesyo has received accreditation recognition both from the government through BAN PT The year 2020 is the toughest year for all countries in the world and has an impact on the joints of life, including educational activities. All the face-to-face learning activities must be stopped, student activities cancelled, and people work and worship from home. The world of education has no other choice so that learning can run effectively, namely by making maximum use of information technology. The utilization and development of information technology is a necessity for Paul Casio by adding supporting facilities by continuously adapting and creating online learning applications. As part of the Ministry of Health, Paul Casio is required to participate in efforts to overcome the COVID-19 pandemic by participating directly, forming an officer unit, conducting training for health workers, becoming a vaccination center, and deploying health volunteers. Various challenges that occurred have led Paul Casio to continue to innovate and change the mindset to maximize information technology for optimal development facilities. This is in the line with the strategy carried out by the Ministry of Health by making efforts for Digital Health Transformation 2024. Success is a journey that requires hard work, smart work, and thorough work, together embracing all potential and diversity into energy for the future for the progress of the nation, country, and the world. Poltekkes Kemenkes Yogyakarta. Together, we are ready to transform to heal the country. Paul Casio, excellent, cultured, and worldwide.
Halo teman-teman Nusantara, saya Muhammad Habis Ansari selaku perwakilan produk inovasi kesehatan dari Poltekkes Kemenkes Yogyakarta dalam Indo Health Fair tahun 2022 bersama rekan tim saya
Muhammad Burhanuddin,
Saya Bima Priyananda Nugraha,
Saya Wahyu Adi Pertama.
Tuberkulosis atau TB telah menjadi permasalahan kesehatan di dunia. Berdasarkan WHO TB Report pada tahun 2020, Indonesia termasuk dalam 3 besar negara dengan kasus TB terbanyak di dunia setelah India dan Cina. Di Indonesia sendiri, kasus angka kematian akibat kasus TB mencapai 11 kematian per jamnya. Menurut Menteri Kesehatan Bapak Budi Gunadi Sadikin, mencanangkan agar Indonesia bebas dari kasus TB pada tahun 2030.
Kompetensi ATLM dalam pemeriksaan TB belum sepenuhnya memenuhi standar kompetensi dalam pemeriksaan. Hal ini disebabkan oleh minimnya sertifikasi yang berfokus pada pemeriksaan TB.
Padahal menurut rekomendasi WHO, penegakan diagnosis TB harus dilakukan secara cepat dan tepat dengan berdasarkan pemeriksaan basil tahan asam atau BTA pada dada untuk menentukan langkah pengobatan.
ATSZN hadir menjadi inovasi baru instrumen laboratorium dengan konsep robotika yang bertujuan untuk menggantikan metode konvensional dalam pemeriksaan TB. ATSZN memiliki dimensi 95 x 45 x 38,5 cm dengan material ABS plastik plus dan akrilik. ATSZN terdiri dari beberapa bagian diantaranya drying container, alcohol container, methylene blue container, carbofuscin container, aqueous container, dan heater container. ATSZN berbasis microcontroller yang dikemas dalam satu kontrol panel dengan LCD, sehingga user dapat mengoperasikan alat ini dengan mudah. Inovasi heater container yang terintegrasi termostat, maka dapat membuka dinding lemak bakteri, sehingga badan bakteri akan menyerap cat warna dengan sempurna. Berikut langkah pengoperasian alat ATSZN. Pertama, hubungkan kabel power dengan listrik. Nyalakan alat ATSZN dengan menekan tombol power. Kedua, tuang ZNA, ZNB, ZNC, dan Aquades pada kontainer hingga batas tera. Ketiga, apusan dahak yang sudah difiksasi diletakkan pada carrier object glass, lalu pilih menu Start Staining pada layar display. Keempat, alat akan bekerja ketika Aquades mencapai suhu 65 derajat Celcius. Jika proses pewarnaan telah selesai, maka alat akan mengeluarkan bunyi alarm dari buzzer. Kelima, proses pewarnaan telah selesai. Objek glass dapat diambil dari carrier lalu dilakukan proses pengamatan menggunakan mikroskop dengan perbesaran 1000 kali. Pengamatan mikroskopis dapat dilakukan dengan mikroskop konvensional, mikroskop digital, dan adapter yang telah peneliti buat.
Kami sangat mendorong dan memfasilitasi serta menjadi pembangkit lahirnya produk-produk inovasi mahasiswa One Student, One Product untuk masyarakat, untuk program-program bidang kesehatan.
Saya mengucapkan selamat kepada Mas Burhan, Mas Wahyu, Mas Hafiz, Mas Bima atas keberhasilannya menyusun, membuat, dan menciptakan alat sebagai penunjang diagnostik TB.
Menjadi bagian dalam eliminasi TB di Indonesia merupakan ibadah yang tak terhingga.
Dari Jogja untuk Indonesia.
Halo teman-teman semua, kenalin, ini Niko, mahasiswa Poltekkes Kemenkes Yogyakarta. Sebagai anak muda penerus bangsa, Niko selalu menjaga kesehatannya, tentu saja PHBS, caranya, perilaku, hidup bersih, dan sehat. Nah, hari ini Niko ingin berbagi cerita tentang kesehariannya. Sebelum beraktivitas, Niko selalu mencuci tangannya dengan sabun dan air mengalir. Berikut ini 6 langkah mencuci tangan. Langkah yang pertama, basahi tangan dengan air mengalir, lalu ratakan sabun ke telapak tangan. Langkah yang kedua, gosok punggung tangan dan sela-sela jari. Langkah yang ketiga, gosok punggung jari kedua tangan dengan posisi tangan saling mengunci. Yang keempat, gosok ibu jari dengan memutar dalam genggaman. Nah, yang terakhir, usap ujung kuku tangan dengan diputar di telapak tangan, kemudian bersih deh. Setelah mencuci tangan, Niko mengonsumsi buah-buahan. Karena buah-buahan mengandung banyak vitamin, mineral, dan serat yang dibutuhkan oleh tubuh kita. Bahkan, buah-buahan sangat disarankan untuk dikonsumsi setiap hari. Nah, aktivitas selanjutnya adalah bersepeda. Dengan berolahraga, tubuh kita akan terasa lebih baik. Olahraga juga menjaga kekebalan tubuh kita. Tapi jangan lupa, keamanan tetap yang utama ya. Aduh, capek juga ya. Langsung aja deh, minum air putih agar tubuh tetap terhidrasi. Nggak perlu banyak-banyak kok, cukup 2 liter per hari. Loh, Niko, stop. Ayam Bangkok, ayam Jawa. Dua-duanya dimakan buaya.
Cakep.
Stop rokok, hindari nafsa. Dua-duanya nggak ada gunanya. Aktivitas terakhir, tapi tak kalah penting yaitu istirahat yang cukup, minimal 7-8 jam per hari. Dengan durasi istirahat yang cukup, tubuh kita akan segar kembali dan siap melakukan aktivitas yang telah menanti. Halo, gimana? Terlihat susah ya? Tapi, dengan tekad dan konsistensi, lama-kelamaan akan menjadi kebiasaan kita dalam sehari-hari. Negara kita membutuhkan sosok anak muda yang dapat berkontribusi dalam memajukan negara. Meski dengan cara yang sederhana, Akhir kata, saya mengajak teman-teman semua untuk menjadi anak muda penerus bangsa yang berguna bagi Indonesia.
Health Polytechnic Manado is being presented as professional medical personnel education institution, which formed based on Ministry of Health and Social Welfare, Decree number 290, 8 from April 16, 2001. Based on the assessment of National Accreditation Body for Higher Education or BANPT, Health Polytechnic Manado has successfully achieved B accreditation according to Decree number 206 of 2020. The assignation of Health Polytechnic Manado by Ministry of Health as the government agency that applies the Public Service Agency's financial management pattern has been registered according to Ministry of Finance's Decree number 399 of 2019. At this time, Health Polytechnic Manado has 7 majors, consists of 13 study programs that have been accredited by Indonesian Accreditation Agency for Higher Education in Health or LAMPTKS, such as Nursing Department, Environmental Health Department, Nutritional Science Department, Midwifery Department, Pharmacy Department, Dental Health Department, and Medical Laboratory Technology Department. Nursing Department consists of 4 study programs that has been accredited by LAMPTKS, such as Nurse Study Program, a 4-year Diploma Nursing Study Program, 3-year Diploma Nursing Study Program, and a 4-year Diploma Health Promotion Study Program. 4 study programs in Nursing Department excel in their own respective field. Nurse Study Program and a 4-year Diploma Nursing Study Program excel in Emergency Unit Nursing. A 3-year Diploma Nursing Study Program excels in Cardiovascular Emergency Unit Nursing, and a 4-year Diploma Health Promotion Study Program excels in Health Behavior and Promotion. Environmental Health Department consists consists of 2 study programs that has been accredited by LAMPTECUS, such as a 4-year Diploma Environmental Sanitation Study Program and a 3-year Diploma Sanitation Study Program. 2 study programs in Environmental Health Department excel in their own respective field. A 4-year Diploma Environmental Sanitation Study Program excels in vector control and waste management. The 3-year Diploma Sanitation Study Program excels in vector control and liquid waste management. Nutritional Science Department consists of 2 study programs that has been accredited by LAMPTECUS, such as a 4-year Diploma Nutrition and Dietetics Study Program and a 3-year Diploma Nutrition Study Program. 2 study programs in Nutritional Science Department excel in their own respective field. A 4-year Diploma Nutrition and Dietetics Study Program excels in utilization of local food and nutrition intervention management, and a 3-year Diploma Nutrition Study Program excels in food science technology. Midwifery Department consists of 2 study programs that has been accredited by LAMPTECUS, such as a 4-year Diploma Midwifery Study Program and a 3-year Diploma Midwifery Study Program. 2 study programs in Midwifery Department excel in their own respective field. A 4-year Diploma Midwifery Study Program excels in quality midwifery care in the midst of crisis and emergency management. A 3-year Diploma Midwifery Study Program excels in local culture innovation in midwifery services. Pharmacy Department has 1 study program, which is a 3-year Diploma Pharmacy Study Program that excels in traditional medicine and pharmaceutical service. Dental Health Department has 1 study program, which is a 3-year Diploma Dental Health Study Program that excels in preventive oral health care and health promotion. Medical Laboratory Technology Department has 1 study program, which excels in lung tuberculosis diagnostic and comorbidities. All those 3 study programs also have been accredited by LAMPTECUS. Based on data from the last 3 years, the total of students applying for Health Polytechnic Manado is 11,463 students. Consists of 9,155 applicants for a 3-year diploma study program and 2,308 applicants for a 4-year diploma study program. Now, the total number of students since 2018 until 2020 is 7,341, which consists of Nursing Department 1,763 students, Environmental Health Department 1,231 students, Nutritional Science Department 1,179 students, Midwifery Department 1,148 students, Pharmacy Department 653 students, Dental Health Department 568 students, and Medical Laboratory Technology Department 773. Number of lecturers at Health Polytechnic Manado is 109 people with master and doctoral degree from well-known universities both in country and abroad. Furthermore, the human resources of Health Polytechnic Manado is powered by instructor, librarian, and administration staff. In providing education with good quality, Health Polytechnic Manado is located in 3 strategic locations, which Campus A located at Jalan RW Monginsidi, Malalayang 2, Manado, Campus B located at Jalan Parigi 7, nomor 22, Malalayang 1, and Campus C located at Jalan Manguni 20, Kelurahan Malende. Implementing its activities, the departments are managed by Directorate Management, which led collectively by Director, Director of Academics, Director of Finance, General Staff and Administration, and Director of Students Affairs and Cooperation. For the sake of convenience and continuity of teaching and learning process, Health Polytechnic Manado provides representative facilities and infrastructures. The supporting facilities provided are classes, laboratory, workshop, technical implementers unit of health services, discussion room, library, auditorium, and an information system, Siakat Cloud, which integrated with MLS Edlink, journal portal that has been accredited by Dikti. Let's join Health Polytechnic Manado, and together we make Health Polytechnic Manado as an excellent, independent, and cultural vocational health education institution.
Indonesia, known as Nusantara, consists of thousands of tribal islands and millions of diversity, bring millions of hopes and dreams. Here is the place where passion and hopes meet from across the archipelago to nourish the nation. Politeknik Kesehatan Kementerian Kesehatan Yogyakarta, established in 2001, is a fusion of 6 health academies in Yogyakarta, establishing itself as the leading college of health workers in Indonesia. Politeknik Kesehatan Kemenkes Yogyakarta, or Polkesyo, is a state university under the Ministry of Health, known as university that upholds cultural values, nationality, and upholds diversity and prioritizes the interests of the nation. Polkesyo, with various works and achievements, we have proven ourselves to always serve tirelessly to produce competent health workers who can carry out their professional performance to make the healthy nation. Polkesyo, which is located in the special region of Yogyakarta, or referred to as a student city, creates a learning climate and academic atmosphere that supports student achievement. Polkesyo continues to grow and develop to become the leading, best health college in Indonesia, and aspires to be global by cultivating, implementing, and utilizing education, research, and community service, which are the main goals of higher education in Indonesia, or the Tridharma of higher education, by always being guided by Pancasila values. We carry out education, conduct research, and provide community service by improving science and technology in health sector that is beneficial to society, nation, and state. This is where the nation's best sons and daughters from various backgrounds and variations are given the widest opportunity to gather and build an intellectual community to solve health problems in Indonesia. By mutually enriching the repertoire of knowledge and human values, exploring knowledge from history, processing today, and researching for the future. Polkesyo has 6 departments and 17 study programs, namely Diploma 3, Applied Bachelor, and Professional Education. Supported by 1 professor and more than 149 lecturers who have experience teaching and research in various disciplines of health science and technology, and support from education staff. Polkesyo always develops quality education processes, which national and international standards, producing graduates with global competitiveness. To support competence, knowledge, skills, and attitudes of students, Polkesyo provides various laboratories with sophisticated and modern equipment and technology, so that a strong research culture continues to develop, marked by various innovative discoveries that are useful for society. Polkesyo has pioneered and developed the Science Techno Campus as a manifestation of its ability to create and commercialize various innovative health technology products. As support for conductive learning, in addition to other facilities and infrastructure, Polkesyo has established itself as a healthy campus by creating a green campus that is comfortable, environmentally friendly, and pollution-free with a well-maintained layout. The various existing facilities support the development of student talents through student activity units and are encouraged to realize their dreams. To improve services to the community, Polkesyo is given flexibility in financial management based on the economic and productivity principles and the application of sound business practices by establishing it as a public service agency work unit in 2011. Polkasyo has been given the title of corruption-free area as a manifestation that Polkasyo has met most of the criteria in implementing the 6 areas of reform of the bureaucratic reform program and has been able to prevent corruption, collusion, and nepotism. To provide quality assurance and quality control of education, as well as improve the competitiveness of graduates, Polkasyo has received accreditation recognition both from the government through BAN PT The year 2020 is the toughest year for all countries in the world and has an impact on the joints of life, including educational activities. All the face-to-face learning activities must be stopped, student activities cancelled, and people work and worship from home. The world of education has no other choice so that learning can run effectively, namely by making maximum use of information technology. The utilization and development of information technology is a necessity for Polkasyo by adding supporting facilities by continuously adapting and creating online learning applications. As part of the Ministry of Health, Polkasyo is required to participate in efforts to overcome the COVID-19 pandemic by participating directly, forming an officer unit, conducting training for health workers, becoming a vaccination center, and deploying health volunteers. Various challenges that occurred have led Polkasyo to continue to innovate and change the mindset to maximize information technology for optimal development facilities. This is in the line with the strategy carried out by the Ministry of Health by making efforts for Digital Health Transformation 2024. Success is a journey that requires hard work, smart work, and thorough work, together embracing all potential and diversity into energy for the future for the progress of the nation, country, and the world. Poltekkes Kemenkes Yogyakarta. Together, we are ready to transform to heal the country. Polkasyo, excellent, cultured, and worldwide.
Halo teman-teman Nusantara, saya Muhammad Hafiz Ansari selaku perwakilan produk inovasi kesehatan dari Poltekkes Kemenkes Yogyakarta dalam Indo Health Fair tahun 2022 bersama rekan tim saya
Muhammad Burhanuddin,
saya Bima Priyananda Nugraha,
saya Wahyu Adi Pertama.
Tuberkulosis atau TB telah menjadi permasalahan kesehatan di dunia. Berdasarkan WHO TB Report pada tahun 2020, Indonesia termasuk dalam 3 besar negara dengan kasus TB terbanyak di dunia setelah India dan Cina. Di Indonesia sendiri, kasus angka kematian akibat kasus TB mencapai 11 kematian per jamnya. Menurut Menteri Kesehatan Bapak Budi Gunadi Sadikin, mencanangkan agar Indonesia bebas dari kasus TB pada tahun 2030.
Kompetensi ATLM dalam pemeriksaan TB belum sepenuhnya memenuhi standar kompetensi dalam pemeriksaan. Hal ini disebabkan oleh minimnya sertifikasi yang berfokus pada pemeriksaan TB.
Padahal menurut rekomendasi WHO, penegakan diagnosis TB harus dilakukan secara cepat dan tepat dengan berdasarkan pemeriksaan basil tahan asam atau BTA pada dada untuk menentukan langkah pengobatan.
ATSZN hadir menjadi inovasi baru instrumen laboratorium dengan konsep robotika yang bertujuan untuk menggantikan metode konvensional dalam pemeriksaan TB. ATSZN memiliki dimensi 95 x 45 x 38,5 cm dengan material ABS plastik plus dan akrilik. ATSZN terdiri dari beberapa bagian, diantaranya drying container, alcohol container, methylene blue container,
Carbofusion Container, Aquades Container, dan Heater Container. ATS-ZN berbasis microcontroller yang dikemas dalam satu kontrol panel dengan LCD, sehingga user dapat mengoperasikan alat ini dengan mudah. Inovasi heater container yang terintegrasi termostat, maka dapat membuka dinding lemak bakteri, sehingga badan bakteri akan menyerap cat warna dengan sempurna. Berikut langkah pengoperasian alat ATS-ZN. Pertama, hubungkan kabel power dengan listrik. Nyalakan alat ATS-ZN dengan menekan tombol power. Kedua, tuang ZNA, ZNB, ZNC, dan Aquades pada kontainer hingga batas tera. Ketiga, abusan dahak yang sudah difiksasi diletakkan pada carrier object glass. Lalu pilih menu Start Staining pada layar display. Keempat, alat akan bekerja ketika Aquades mencapai suhu 65 derajat Celcius. Jika proses pewarnaan telah selesai, maka alat akan mengeluarkan bunyi alarm dari buzzer. Kelima, proses pewarnaan telah selesai. Objek glass dapat diambil.